It makes them own what they're doing. It makes them responsible for their workplace. And it gives them a sense of power over how things are being done. And then it takes away the blaming of, well, the manager's doing this, the director's doing this, it's their fault. No, it becomes your fault when you own it.
So I want to move now to Dr. Hales, because Colleen is naming what's missing in the institution. And Barbara, you're working with physicians who are burning out inside their own practice.
That's right.
So it's not just the hospital system, but the actual businesses that doctors have built. What's breaking?
You know, burnout really is pervasive. And so I am grateful for the opportunity. I'm grateful for the opportunity to present that moment. I think one of the biggest misconceptions about burnout I think one of the biggest misconceptions of burnout is that physicians assume that they should be able to fix it. But it's not about strength or commitment. As physicians, we are trained to be resilient. We push forward. We treat everybody first. So when it happens to us, we think we must need to be more efficient. We have to work harder. We have to be able to control our stress. But the problem is that it's often a mismatch between the demands of a modern medical society and the doctors that work within it. It's a signal of misalignment, so that what the doctors are expecting is not what the medical care is demanding. And because of that, burnout exists. The fact is, until we acknowledge this misalignment, burnout is going to get worse, and more physicians are going to be affected among us.
So you have what you call a strategic practice blueprint, which does promise physicians that they can do less, earn more, and feel human again. So what's the first concrete thing a physician can change in their practice this week before any major structural overhaul?
Well, before that, the problem is different for each physician. So it's a question of identifying what the problem is for them. The first step is actually very simple, and yet is extremely crucial. And that is, they have to understand where they are on the burnout spectrum and what got them there in the first place. Because burnout rarely happens overnight. It's a gradual process. So while they're working, it starts out just fatigue, and then it goes to frustration. And if this is not handled properly, it progresses on to disinterest in everything that was once meaningful to them. Over time, if it's not addressed, they are going to be either stuck or they're going to question what it is that they're doing and why they're even doing it anymore. What I see for physicians is most of them do not recognize how far they actually are into burnout. So before making any decisions, the most practical first step is clarity. That's exactly why I created something called the Burnout Reality Check. It's a very brief 2-minute self-assessment that will tell you not only where you are on the spectrum, but what it is that is demanded of you within your practice that's creating that situation. Because once you can identify it, you can then change it. The goal is not to wait until burnout itself makes the decision for you. Change things while you can before you reach that state. It's easy to understand where you are early enough that you still have the ability to shape what comes next. Remember, you don't have to leave the medicine that you love. You just need to change what doesn't work for you. It's about helping find a way to continue in a way that helps sustain you. I've had doctors come to me and say, for every 1 hour that I treat a patient, there's an additional 2 hours of charting that needs to be done. They're crying, I can never leave the office. I can't stop charting. I haven't spoken to my kids. I haven't had a meal with my family in months. I've had other doctors say to me, I can't make enough money to get ahead. I'm working harder, 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 bringing more money in. It doesn't seem to make a difference. So what the problem is causing burnout can differ for each person. If this is something that you are experiencing, I made the burnout reality check easy for you to access. I have papers for you to access on a table in the back. And if not, you can go online to go.themedicalstrategist.com/burn hyphen out. Even if you don't think that you have burnout, there are several different stages. And I urge you to take that so that you see just where you are in that spectrum.
That's good advice, Barbara. Thank you very much.
Thank you.
So, uh, Dr. Hales has been redesigning the external practice, Jasmine, but I'm sorry, Dr. Burns, Jasmine Burns. Um, but you're redesigning internal culture. So, from within your own organization, tell us what that looks like.
So, oh, it's working. So I have received training and worked in various settings. VAs, schools, community mental health, all kinds of places. And I saw burnout in every setting that I worked in. And part of that was because we were made to feel like we were cogs in the machine. We didn't really get a lot of support from our leaders. We were told we had to hit a certain number, productivity hours, all of these things. And no one asked us, like, we had no say, no buy-in in these conversations that the leaders were having. I didn't like that, so I started my own private practice. I said, I'm gonna work for myself. So I now have a group practice. My lovely staff member is actually right here. And I told myself that I didn't want my staff to feel the way that I felt because I was experiencing burnout and I had just started in the field of psychology. So what I do is I have conversations with my team. I ask them, how are you guys feeling about your caseload? Are there is there any way that I can help you? A lot of people on my team were moms of kids under the age of 5. Y'all, we are tired all the time, and that's outside of work. So I model what I want my staff to do. So I will tell my team, hey, I had a hard night with the kids. I'm going to be starting my day a little later. You can still reach out to me. It just may take me some time to get back to you. I am very open in my communication. I am vulnerable with my team, and I'm transparent. By modeling that behavior, my staff now know, oh, okay, Dr. Burns is talking to us like that. We can do the same thing. And so we have a very strong, my team is small, we're about 10 people, but we have a very strong, safe relationship. And that helps with burnout, just knowing that there's like a safe work environment. And that goes a long way.
You've trained and practiced across the VA, private practice, schools, community mental health. You've watched burnout win in virtually every corner of the mental health field. And you've responded not with policy statements, but with action within your practice. Can you walk us through what boundary setting as a leadership practice actually looks like?
Yeah. So again, I'm really doing a lot of modeling, but I'm also educating my team. So one of the things that we're noticing, well, across healthcare, but I'm going to speak specifically to mental health and psychology because that's my field, are there's a lot of systemic issues. So one of the issues that we're encountering a lot within my practice is reimbursement rates for insurance is abysmally low. And my team and I, we specialize in diagnostic evaluations, autism, ADHD, and things like that. And we are busy and we see patients practically nationwide. We're about in 43 states right now. My practice is completely virtual because patient access to care is so important to me. So my little team, we're very, very busy. And it's very frustrating when we do all of this hard work. I kid you not, we've done like 5, 6 hours of testing and we got paid out $144 from insurance. A lot of providers are just not wanting to accept insurance because of these low rates. We have providers who are accepting insurance, but because of these low rates, they're taking on all of these patients, as many as they can get, and they're burning out. So one of the other things that I do is, again, I talk to my team and I say, where are you now with your caseload? And where can we, like, what's kind of the realistic cap that you can do? And if they tell me a number that I think is too high, because I know they're doing other things, we calibrate. So having ongoing conversations is extremely important as a leader when you have, I don't care how small or big your team is, you have to have that ongoing conversation. And you have to notice those signs of burnout. If you have a staff member who is normally really on top of notes, they're happy and they're just kind of great at their job, and you start noticing things here and there, like they're making more mistakes, or you're noticing that they're not as happy or chipper as they used to be, they're quieter, things like that. Those are early signs of burnout, just some of many early signs of burnout. So as a leader, you have to tune into your team, just like Victor was saying. We're virtual. My team is spread out. I have team members in Texas and California, and yet I'm still present as I can be. And by catching those early signs and being proactive, that's a strong way that we can catch burnout.
And that leads to my next question. What's the gap between awareness and accountability?
I think there's a leaders feel, I think, detached from their team. I think leaders become very busy in the big picture stuff, and that leads to not noticing what's going on, like in their home, so to speak, with their work, with their practice. And so, again, just like Victor said, we have to take that responsibility and that accountability as leaders because there's a trickle down effect. It starts at the top. And if we're not taking care of ourselves, which often happens when you're leading something, again, we're not modeling that behavior. If we're overworking ourselves, our team, they may start overworking themselves. So we have to take an inward look. And I think that's where accountability starts, and that's where it's going to go a long way.
But you've also taken action.
I have.
Yeah, tell
Yeah.
us a little bit about that.
So, in addition to the internal things that I'm doing within my practice, I also strongly believe in advocacy. I think that there are a lot of leaders of the nation, like our representatives, who are not aware of what we go through as healthcare providers, as even patients ourselves. And so I go to advocacy days. I've been to Washington, D.C., and I've sat down and I've spoken with federal representatives. If you don't know who your representatives are, Google. Who's my federal representative? Who's my local representative? You can use Google to figure out. And I went with a group of people, and we had these elevator pitches because you have to be very concise when you have these meetings. And we talked about what the issue was. So for me personally, I was part of a LEND program, and that program was getting funding slashed. And this program is very important. We were learning a lot about autism and how to work with autistic individuals, empowering them. And there's kind of a shortage of that nationwide. So to have that funding slash was not, it was just not good. So anyway, so we went to DC, we had our elevator pitch, and we directly talked to the representatives and let them know the importance of the program. So if we can do more things like that as healthcare professionals and be that voice, not just for ourselves, but for our patients, that advocacy can go so far because I just don't think the higher ups fully understand what's happening.
Excellent. That's excellent.
So I want to turn it back to you, Sandra.
Thank you.
Yeah. So every voice on this panel today has named something real. We've talked about systems, leadership, education, practice design, culture, and all of this is true. But let's close with something that sits underneath all of that. Because in 12 years of working one-on-one with people in crisis, I'm just curious, do the outer fixes, these external fixes, truly hold until something shifts inside? Can you talk about that?
Yeah, what has to shift inside, the thing that is actually holding and grounding you, because just because you clear a bottleneck doesn't mean that there won't be another bottleneck. And it's you that's going through each of those bottlenecks, those stops. So what I've witnessed uh, in thousands of soul readings are where I allow the universal consciousness to speak through me. And in soul readings, people have a dialogue with this consciousness. But I've noticed the shift that is occurring is coming from an ethereal place, just as burnout is. That is the curiosity of the mind, the soul, the spirit. These are the conditions of your being that determine your well-being. So it comes down to burnout isn't really something that happens because of external circumstances. It's because you're ignoring your spirit and your need for inspiration and recovery. And that it doesn't require policy change. Carl Jung called it individuation, where you are drawing closer to an authentic self. And William James called it stream of consciousness, which is an awareness beneath the noise. And universal consciousness, through me, calls it the accelerated self, where you're working within the aspects of your being that are the ethereal, that affect you even though it's within the unseen. It affects how you see the world every day, how you see yourself and your place in it every day. So I took this topic, burnout, to universal consciousness, the being I call God, to get their take. And I just want to read to you what they said. And I want you to think of this personally. This is a very personal message to each of you who are in healthcare. Here's what they said. The process that takes an individual from keeping up to losing ground is the first sign that trauma has occurred. Whether that trauma is caused by environmental influence or personal doesn't distinguish when you are treating trauma, because it is the individual's urgency to stop a wound that indicates the wound lives in you. Therefore, when the wound isn't healed in ourselves, the consistent and constant need to heal is an expression, external, instead of an internal impression. When that need to heal becomes an impression, the When that need to heal becomes an impression, then there's a practice and a management of the self. Only in the practice and management of the self can we fully be present to the trauma in others. All right, I want you to join me in thanking our panelists, General Scott Dingle, Victor Bycroft, Colleen Fiamingo, Dr. Barbara Hales, and Dr. Jasmine Burns. My name is Sandra Sneed. Come visit my booth, get a soul reading, get contact information for each of these panelists if you think they can help. And remember, this conversation is just beginning. Thank you for joining us. You know you did a good job, so say you did a good job. You know you did a good job, so say you did a good job. You did a good job.
Thank
Good
you.
job.
Go ahead, Sandra.
Good job. Good job. All right, distinguished panelists. We know there's lovely questions and considerations on the topics that were discussed here, and I do hope that you connect with our panelists after this session and throughout the day during our networking hours. Checking in with self
Falling
is really important.
at the end.
Ensuring that you are well, and sometimes the best way to be well is to affirm that you are well. All is well. Try with me. All is well. I am whole. In this moment of now, I am perfect. Because your point of power is always in the present moment. So I say these things throughout the day. When you see me energized, I probably just gave myself about 100 affirmations before I got up here. Okay? I got the energy. I got the juice. Everyone's feeding love. And that's how we do it. That's how we keep going, yet also honor the sacred time to rest. Just want to thank the panelists because that was such an important conversation. As they're getting microphones off, we're going to get ready to introduce our next speaker for the day. Let's move on. Our session is Healthcare CEO to a Healer. This is a journey that reflects how roles in healthcare can evolve over time, from leading organizations to making a more direct personal impact on people's lives. It's about perspective, purpose, and how leadership can take different forms within the same industry and how we evolve as our personhood. Please join us in welcoming our speaker and bronze sponsor, Shani Maraminova, CEO of Best Home Care Incorporated. Please give it up for Shani. Shani brings extensive experience across medical adult care, assisted living, pharmacy, holistic healing, and wellness services. In this session, she will share powerful insights on the journey from her lived experiences to embracing a deeper purpose of healing and human-centered leadership. Let's give her another round of applause.
What if I told you in search of something that you're trying to achieve? Hello, everyone. My name is Shani Madaminova, and I'm truly honored to be here today. We all in constant motion, trying to chase for dreams, trying to chase for things that we think that gonna make us happy. But however, once we get there, we achieve that goal. We're only happy for a moment, for a day or so, and that feeling comes back to us. The feeling of unaccomplishment, that adrenaline that you're looking for, and you don't understand, why are you still unhappy? And we end up going to our next search, trying to see, what if I just get this house, this car, this business of yours, or the dream of yours, or the fame that you're looking for, and you reach that goal, and you're still unhappy? Please raise your hand if you ever felt that way, because that was me, trying to reach and trying to achieve and trying to find and run and chase for that golden goose. We all have million things that are expected from us as parents, as sisters, as children of our senior parents, the work, the businesses that we run, the responsibility that we have in front of all of our team members, that God forbid you forget to run a payroll on time and you did not receive that reimbursement from the state, and now you're panicking, oh my God, I don't have money to pay to these team members of yours. That was me. Responsibility, I'm a mom of 3. Responsibility in front of our children that, oh, I have to put this child through college. Constant chase that it's a survival mode that we're in. The friends and neighbors that we're trying to impress. Oh, let me just get another car because this neighbor of mine has this car and now I want to have another one. Because we're all trying to impress other people. And we all have these masks that we wear. I'm a leader. I'm an actress. I'm a president. And all these are an illusion. It's a mask that we wear to please and impress others. But what we forget is ourselves. Because the amount of responsibility that is put on us, whether it's from the family members or society that expects things from you. You have to go to college. If you want to achieve something, go to college. If you want to build a great career, go to college. But have you ever thought, who said that it's true? I'm in medical field. I don't even know how I ended up there. I mean, I know God, but I never even went to college to study medicine. But yet, I'm here. So I guess it's my calling, because when you're in medical field, what we do is we actually care for other people. We're selfless. But what we do forget is we achieve that goal. You become who you are. But then there's something still missing inside of us. And every business that we build, that we grow, at the end, it comes at a cost. Sleepless nights that we have, because we constantly trying to grow that business and to hustle. And what we truly do is actually trade our time for money. But what happens with your time? Can you buy the time? That was me. I lost time with my children when they were growing up. Because when I started, I had 2 little children. Back then, they were 4 and an infant. I remember those days when I would be walking with those pump machines because I had an infant to feed. But I had to grow my business. So I never even spent, in 2 weeks after birth, I went to work and hustle because of the responsibilities I had. And one day, In January 2022, we were in Paris, me and my husband and my son. Back then he was 16. We visited Paris, had great time at Louvre, and that evening, I felt there's something happen inside of me, in my belly. First, I couldn't figure out, but then I thought I had appendicitis. But then the doctor, a French doctor, came to our hotel because the pain was crucial. I could not understand what was happening to me. He misdiagnosed me. And his misdiagnosis nearly cost my life. I had internal bleeding. The next morning, I could not even move anymore because he gave me a painkiller and I went to sleep. It was during COVID time, by the way. Lots of people are talking about pandemic. And when we got back, with only God's help and my angels, I was able to fly back from Paris with internal bleeding and come back to my home, New Jersey. And I ended up in ICU. I was unconscious, by the way, while I was flying back. So they had to wheel me into the plane. So day 4, when I woke up in ICU, because I was unconscious, people started coming, doctors started coming to my bed and saying, miracle, miracle. At first, I could not understand because I thought I had food poisoning because that was a diagnosis that was given to me by a French doctor. However, at that time, my baby burst inside my belly. And only I was saved by an angel, by one of our team members, who became our dear friend now, who was a nurse, who actually gave me the right diagnosis, who actually told me that I had an ectopic pregnancy. So after that event, which deeply shook me, everything I thought that mattered in life, that I had to build my career, feed my children, be successful, make sure I put them through college, like everyone else here. Every belief that I had just shattered in that moment. Because when you experience death and you come back from it, you understand what truly matters. All the shiny things that we're trying to fight for, hustle, work, and all the things that I thought that was true, that mattered, didn't anymore. And I stopped the chase. Money did not matter. Success didn't matter. Nothing mattered. So I stopped the chase. So that something that was missing inside you, that you're constantly trying to chase, and you're trying to chase it externally, is actually inside of you. One question you have to ask yourself: what's the purpose in your life? Is your life supposed to be the way it is now? Are you happy with it? We're constantly searching for that success, to look for what exactly? For validation from others? Or validation from yourself? To impress others? But that answer that you're looking for and searching for, that you think, how I thought, that if I only get this item, I'll be happy. If I only get this house, I'll be happy. If I only get this job, I'll be happy. Or build this career, I'll be happy. And what I was actually looking for was inner peace. I was in constant fear because, again, I run big operations. I'm responsible for thousands of families, thousands of team members. And like all of you, I work with the state, with the government, and we always hope that they will process that reimbursement on time so we can pay our team members. So that anxiety was way on top, the stress, the survival mode, the constant hustling. It was always there. Panic attacks. I almost collapsed on the street because I was having panic attack. It's a constant, because we all live in survival mode. Let me tell you, 95% in the world are in survival mode. So that event had changed me completely. And during the moments post-hospitalization, where I had to learn how to walk again, be myself again, to get back on my feet, lots of things came to me. A huge realization of what's important in this life. And I was able to completely heal myself. Again, sorry, not me, him. So once I healed myself internally, once I became in alignment, I was completely healed, not only physically, mentally, emotionally, and spiritually. So now, it's my mission to dedicate my next chapter of my life to help those who actually is in the survival mode, and to trying to stay afloat in the ocean and trying to get to that island. All this time, I was reaching success, chasing to make more money. And all I needed to do is look into myself, find that peace, to be fulfilled, and to be in alignment. So I no longer lead out of fear and anxiety and stress, but I lead from heart, with an alignment. Because when you lead as a leader from your heart, when you do not care about how your people performed, the metrics, the growth of the business, the very new thing opens for you. In your businesses, all your team members, you will build this strong and trusting relationship with them, because you will come down to their level, because you are aligned and you totally understand that it's not about you, it's about others. So we were not born to survive and not born to hustle. We just need to be aligned, to connect to your inner peace, to your inner soul. When you work with your inner soul, that's when everything starts coming to you, where you don't need to hustle anymore. It just comes to you. So we're constantly searching, and we can't find the answer. But close your eyes for a moment and think about it. If it was the last day of your life, would it be this life? You may open your eyes now. Would you lead your life like this, the way it is now? Or would it be different? That's the question you need to ask. So I stopped that. I stopped the way I was thinking, the way I was leading my life with, chasing for something, for that ghost. And I totally look into my inner self, inner state. I stopped thinking was this. I started thinking was this heart. And when you connect to your authenticity, your authentic self, that's when you actually heal. That's when you actually get aligned. Oops, it just. So my takeaway for you, find that authentic self. Connect to yourself. Be in stillness. How do you do that? I started meditating every morning. Did you know that if you meditate, before you take your phone, before you get out of your bed, when you just meditate and you pre-plan your day will be so successful and with ease. It will just run so smoothly. But when you get out and start looking and scrolling through your phone, what happens? Your whole day goes sideways. So now, today, I help executives, high performers, and leaders to find their authenticity, to find what they're looking for, to find their purpose. And once they aligned, everyone who they connected to, their children, their families, their friends, even colleagues, everyone, you walk into this room, everyone starts healing because it goes as a ripple effect. So as a healthcare leaders, I want you just to wake up. You're all angels, and you just need to remember your true essence. So thank you so much. I'm open for questions if you have any questions. And my book just came out, and we also have a booth. If you need to come and get a signed copy, please come by and see. Thank you.
And we only have time maybe for one or two questions. And both the light and so at this point, are you speaking into more spiritual?
Very good question. So the whole world got confused, forgot, and they get confused between religion and faith. Religion is, there are so many religions, right? It's diverse. It's embedded with lots of traditions and cultures. And we tend, most of the people now, we tend to believe in religion, but we forgot faith. We need to be faithful. We need to be faithful to God. That's what He wants. You could pray 5 times a day, 10 times a day, do all the things, whatever is said in the Bible, in Quran, Torah. And then what happens? It does not matter on the other side if you're unfaithful, because we believe so much in the book that we forget our faith. So have faith. He's always with us, and He's always in you. He's here. Think about it. How does your heart beat? You need a phone. You need your phone to work, you need to charge it. You need to watch this TV, you need to plug it in. Where do you get that energy from? Why does your heart beat? From him. Thank you.
Thank you, thank you, thank you. Beautiful, beautiful session. Thank you, Shani. Thank you all. Um, I wonder if you all know the meaning of your names. Like, look up the meanings of your names, like your first name, your last name, and search. I know the meaning of my name. Malika means angel, an angel who walks with a caravan of other angels. So it's always a pleasure to be in each other's presence. Our next session, Game-Changing Cancer Research, What's Coming Next, will explore the cutting-edge innovations in oncology, from immunotherapy to precision medicine, and examine how these developments are shaping the future of cancer care. Let's give a warm welcome to our panelists, Dr. Neil Longkey, CEO of Histologics LLC, Satya Brat Jaiswal, President of Academy of Sound Healing, and Samyata Saxena, CEO and founder, The Garden Recipe and The Garden Pooch. The stage is all yours. We need some.
Thank you, Sam.
Are you okay with doing it? All right, everyone. I'm going to go pass the mic just in case this isn't working. Feel free to introduce yourselves. Who's going to go first?
Okay. Hi. Talk about my subject. Hi, good morning, everybody here. My name is Satyabrat Jaiswal, and I work with sound medicine to help people suffering from cancer and any kind of physiological or psychological health issues. So I'm going to talk about it, how it can help people suffering from this life-threatening disease.
Hello, everyone. I'm so happy to be here. This is my third year with Health 2.0 conference. So this is just like second family to me. And my work in cancer research has a history, or should I say story, both professionally and personally. So let me go back a little bit in time. When I got my big job, right before even I finished my college, it was in Methodist Oncology Institute in research. And it was, as we all know, Texas Medical Center is one of the top in America, and Methodist has a very good reputation for cancer healing and cancer research. So I got a job in Methodist, and my responsibility included looking at all the data of all the clinical trials and analyzing the data and making it ready to go into manuscripts so that we can get the manuscripts accepted in PubMed, NIH, and all of these big journals. So I got really good insight into what treatments are there, what combination drugs we are using, what chemo, radiation, or non-invasive, and is it this treatment going before or after, and just seeing the whole patient data. And sorry to say, it was not really good because most of the patients were not making it, or they would walk in healthy and then they would lose weight and look like skeletons, and sooner or later they were just dying. Then I was working for UT Oncology, same department, but we moved to UT Oncology, and it was pretty much the same. It didn't align with my values because I just didn't understand what right do we have as a medical field to charge patients millions of dollars that their family has to pay after their death, because often they don't make it. And yet, they're not healing, but we continue the treatment. We're not looking at ourselves. It didn't align with me. It just something seemed really wrong. And so I said I need to quit this job. I just was done with it. My body gave me signals that you should quit the job. And luck would have it in a way, 1 year later, I got cancer. So I had ovarian cancer. And I kind of like knew it was coming because of my intuition. But when I had ovarian cancer, because I was lucky, I'm from India, and because I was raised by my beloved grandparents who believed in holistic health, in home cooked meals, vegetarian food, Indian spices and herbs. I was very lucky to have this knowledge. And I had gone so far from the girl that my grandma had raised me that I knew that I was going to have a disease in my body. And when cancer came, it was one of the biggest blessings in my life because it was a reminder I have to go back to the girl that my grandma raised and the love I got the first 10 years of my life. Cancer, my dear friends, is not because you forgot to eat your greens or blueberries, or even because you chose a conventional treatment. It is much more deeper than that. It is a serious issue. It is because something has triggered your genes to go in a wrong direction in a haywire way. And the stress, the trauma that you're carrying is becoming too much for your body. And now it is pushing to heal itself. And when my ovarian cancer came, and this is very open, I've talked in my last year's panel and before to raise awareness. There are a lot of wonderful women over here. I had 3 years of bleeding nonstop. And yes, my dear friends, I was working, I was taking care of my dogs, I had no support in my life, doing everything, and I was bleeding all the time. But once you make sense of things spiritually, you kind of realize that there's a reason for it. And I knew my body is pushing through the trauma. And I let it go on until it was time to take the tumor out. And I just went for the surgery. So they asked me, do you want to do chemo or radiation? And I looked back in my work in cancer research and I said, no. And the doctor was like, well, you will live for 5 years. You will die pretty soon. You should do radiation. You should do chemo. You won't have your periods. I said, okay, fine. Good for me because I'm a very rebellious child. I said, we will see. I just went back and never went back to the clinic. Never. So I was told by two doctors who talked to me like a robot. They didn't even look at my face, didn't look at my eyes, didn't make no connections with me. But they were like, well, you will live for 5 years or you will die and you will not have periods for 8 months. Guess what, guys? I went back to what my grandma had taught me. Indian, Ayurvedic style cooking with spices, ginger, garlic, herbs, vegetarian plant-based diet, high vibration food, home cooked, pure vibrations. I ate it, and honest to God, 2 months later, I got my periods. And I say this because so many women are struggling, and so many men in cancer research are told the wrong lies. This won't happen for you. This won't happen. Who gave them the right to say this to you? You know? So I had my body back in balance within 2 months, and today, well, not today, in May, I'll be 12 years cancer free. All because of myself. Thank you, guys. Thank you. Thank you. Thank you. Thank you. And I don't go to doctors. Everybody who knows me and all of this wonderful conference, like my friend here, knows I don't go to doctors at all. And this is how I launched my business. I said I have to teach people like you guys who are paying, you work hard, and like she just mentioned, we work hard to chase some dream, but then we fall sick. We forget our own self. And that happened with me as well. And then we pay a huge price to the doctors and corporations for drugging us. So it is like vicious cycle. And I said, okay, I have to teach people something about how I have healed myself. So I launched YouTube channel teaching about my recipes so anyone can cook side by side. And then it launched a newsletter so it can reach global readers. It goes with holistic health articles and recipes. Then I thought, what else has helped me in my cancer journey? I was, oh, well, it is spirituality, mindfulness, managing my stress levels. So then I launched a spiritual section to help cancer survivors or people who just want to be healthy. And then I launched a section on trauma on my website because until you heal your trauma, that disease is going to come back. So if you want to heal for once and for all, you need to heal at the root level, the pain and suffering that you have suffered, okay? If you have a disease in your body, it is there to heal you, not to kill you, unlike what the doctors tell you. It is there as a healing friend. You understand the emotional and psychological reasons for it. You understand the spiritual reasons for it. Once you deal with that, you have healed permanently. So my organization provides basically a holistic healing model to people who want to heal, whether it's inflammation, hormones, diabetes, thyroid issues, or cancer. And this is where I say the gap is bridged by my organization, the Garden Recipe, because we are not taking one side and killing the immune system, and neither are we saying just eat this. We are providing you healing the way it should have always been from the very beginning for all of us. But we were too controlled by the governments, too suppressed by Monsanto, too suppressed to even speak the truth in our own society, by our own families or loved ones sometimes. So this is why my organization focuses on bridging the gap so everybody has all the tools and understanding of what healing requires. It requires looking within, inner awareness, and saying, I'm going to eat this, I'm going to manage my stress levels like this, my lifestyle like this, and I'm going to deal with my trauma. And that's what you deserve to heal from cancer. That's what I do. All right. That's it. All right. Thank you so much. Thank you.
They mic'd me up, but I decided to come to the podium anyway. It's a pleasure to speak to you all today. I would have definitely looked in your eyes and talked to you when I saw you. I'm an OBGYN doctor,
Oh, great.
and I understand your journey, and I'm so impressed that you were able to find the healing in the way that you did.
Thank you. Thank
And
you.
I think more people should try alternative ways to see things. I'm going to tell you my journey about how I found an alternative way in more of a prevention cancer model, but maybe therapeutics in the future. So I'm an OBGYN who trained in allopathic medicine in the United States. I went and moved to California from the East Coast, and I started working after I trained at Kaiser Permanente, which is basically a not-for-profit health. And at the time I started, people didn't really think much of Kaiser. You know, you weren't in business to be medicine. And I said, I don't want to mix business with medicine. If I'm going to do business, I'm going to do business in my creative side. So I was always an inventor since I was a young man. And I kept inventing while I was practicing. And I kind of merged the two together. I was a professor, and I am still at University of California, training other doctors to see things the way I do and treat things the way I do. And I got very interested in cervical cancer first because cervical cancer is something that can be treated and cured before it becomes invasive. And I said, if I can work people up and find the way to find them before they get cancer, then I can save lives. I'm going to dedicate my research life to this because it's like I can see the cervix when I examine it. I can take care of it. It's not inside the body. You unfortunately had something that was taking time to develop, that you were sick for a couple of years. Yeah, so I said, well, I can do it. But when I started training and I started getting into it, I realized it was very invasive. People were getting using sharp tools, no anesthesia, curettes with pretty much a lot of pain. They'd say, just, it's only going to be 20 seconds or a minute. You can, hold your breath, count to 10. And it was like, no, I think that maybe I could develop something that was a little more compassionate. So I got into this thing called compassionate colposcopy, which is compassion with an invasive procedure. If you talk to people who've had the procedure, they don't speak highly of it, but they have their lives saved. They get their pap smears. Pap smears are not really primary prevention. Primary prevention is a vaccine or a lifestyle change or what you're doing. If you would have been in that lifestyle in the beginning, maybe the epigenetics of making cancer develop wouldn't have happened. Stress, diet, exercise, all the things, those are all important. But once you have the precursors to cancer and you can find it at the early stage, you can make a difference. But what's the barrier? I'm looking at men in the room, but I'm also looking at women in the room. And, what's the difference? The difference is that patients fear. Everybody fears getting cancer, but patients fear the pain, the trauma, the emotional ups and downs of being diagnosed with it. And if we could take some of that fear away, it would be great. There's a movement in the United States to do self-HPV testing for cervical cancer now, where you don't have to go and be exposed to a gynecologist or a family doc and have this procedure done where they examine your lower genital area so now they have self-HPV. So, okay, you have a positive test. Now what? Now you have to go and get a longer procedure with an invasive technology. I just wrote an editorial that didn't get accepted by my peers. I basically exposed that. I said, this is okay, we've got the first thing settled. Now we got to work on the second thing. So my invention is actually converting these specialized brushes that can take biopsies from the body And once I found out they work very well for the cervix through really disciplined research, and it's all out there. My company's name is Histologics LLC. It's been around for a decade. There've been over 2 million cases in the United States done. It's sort of like a well-kept secret, kind of. Patients don't, not all doctors and nurses know about it yet. But there's going to be some interesting news from the National Institutes of Health that took it all over the world. Because in the world where cervical cancer is really an epidemic and a problem, you need to have access, you need to get the patient, you need to have time zero, you need to know it's wrong, and you need to treat them right on the spot. Because they may have walked in from a village. There's a lot of sub-Saharan Africa, there's a lot of research being done there, South Africa, India, all over the world with this technology now, because it's pretty quick. And they're using AI with these cameras that are doing the evaluation. They're trying to make it more modern, and I am trying to make it more compassionate. And I've succeeded, and I'm so grateful. I even get to use it in my own practice because it's in my organization now. So there's primary prevention where you're doing vaccines and health. I think there's a lot of that here. There's been a lot of, I've been coming to a lot of the sessions about mental health, and I'm very attuned to mental health. I have people who suffer from it in my family. And then there's the secondary prevention, which it's your responsibility. Screened, get follow-up if you're positive, get diagnosed right, don't be afraid of it, come back. If you have a bad experience, you miss appointments, you get scared, you run away. There's fight or flight. So you want to fight this, you don't want to run away from it. And then tertiary prevention is what you had. You're extremely lucky and extremely fortunate and smart that you said, I want something that's life-bringing. I don't want to change my lifestyle. I want the most minimally invasive, least invasive thing that's going to help me cure my cancer, right? And the same, I believe the same. I find the most minimally invasive way to take care of you. I'm not in the treatment side of it yet, but we're doing research to see if this frictional brush can remove these diseased areas of the cervix, can remove wound necrotic tissue and get to the infection under the surface that's part of the reason wounds don't heal. We're in two specialties, women's health and advanced wound care. And I even made a brush that fits on a nurse or a doctor's finger so they can touch a patient and say, it's going to be okay. And by the way, I'm debriding your wound. You don't even know I'm doing it, but I'm actually cleaning your wound while I'm talking to you. The whole idea of the personal, caring with a personal touch, compassion, that's been the driver for my success in my career. In my practice, I've delivered several thousand babies probably. Um, and I chose it because it's a very happy profession most of the time. But when I get patients with symptoms like what you had, I have to switch gears and I have to think about what it's like for people who are going through cancer workups. So with that, I'm going to keep my talk short because I know you wanted to speak a little more. You just introduced yourself and you want to speak a little more. And we're going to have questions, I think, at the end. And I'm keeping it a little short because we were running behind in time. But this technology, this fabric is called Kylon, Kylon. I'll actually tell you a funny story as I leave. So it's made of nylon, kind of looks a little like Velcro. It actually turns into a little curette when you press it in the body, and it cuts. And when you twist it, it takes a biopsy, but you don't really feel it that much. But I named it and I trademarked it. And I didn't think it's Kylon. And because it's nylon, I said, I like Kylon. About 2 or 3 weeks later, I looked at it and I go, that's my last name. My last name is Lonky. How did there's a lot of things that go on in your brain that you don't realize till you've done it. It's totally and utterly natural. And I think it's natural to look at a patient and the patient care experience. The value of healthcare, the value of healthcare is the quality of care you get. It has to be really good. Everybody goes to a clinical setting and they say, well, they know what they're doing. They're using the best evidence. They should be thinking that. If they don't, I see somebody shaking their head. I know, you're right. They don't always do that. But quality is assumed. Because I was a director of Kaiser, I can tell you I ran the quality program there. Quality is assumed. Access is driven. Get the care you need when you need it, but service is always monitored. You always get those surveys. It's always monitored. It's one of the most important things that drives healthcare is the patient care experience. How easy it is to get into the clinic. How easy it is for people to actually um, uh, deliver the care in a very effective way, efficient, precise, not harming you while they're treating you, right? Yeah, and over, that's the denominator, over the cost to deliver that care. That's value-based care. You hear a lot about it in the United States now. We've been doing it as long as I've been at Southern California Kaiser Permanente Medical Group. That's what drove us because we took the capitated payment of the patient first, and then we delivered the care. And we didn't ration it because if you got sick, it cost us a lot more than if you stayed well. So it was about wellness, it was about preventative health care. But with that, I'm going to stop and I'm going to invite, can you come back and give your talk? All right, thank you.
Thanks for your talks, both of you, and we got good insight. And what we are doing actually, if we are going to treat cancer, I think we need to think beyond the physical body, like maybe our emotional body, mental body. Most of us, concerned about our physical body most of the time, and we do take care of that. And we ignore our mental and emotional body most of the time. If you have anger in your everyday life, and somehow we just keep suppressing it, and maybe several other issues, emotional disturbances and many other things. So what we believe that these all are kind of toxic energies, like maybe anger, maybe emotional disturbances and many other things happening in a negative way that might leads to a disease, life-threatening diseases, even cancer. So, what we store these toxic energies within us for a longer period of time. And if we want to eliminate it, there is nothing, something, physical form or physical medicine, can help us. So sound is a kind of energy. And if we use specific frequencies, specific vibrations, so it can work at that level in a very effective manner to detox whatever toxins accumulated in energy form within us. So based on this principle, we use sound to relax someone, to take them to a kind of deep meditative state, because there are certain sound frequencies when it goes to our brain, it can control our brain waves, can take us to a deep, relaxed meditative state. And that's the science of meditation. Actually, when we reach that state, our inner healing mechanism is supported, and probably that is one of the best doctor. So when we support that inner healing mechanism with the help of sound vibration, that can take anyone into a very, very deep, relaxed meditative state just in few minutes. So that helps them, activating inner healing mechanism. And apart from that, there are several frequencies and vibration that works in a very effective manner to different organs in the body. So if we use in a precise way, in a clinical manner, we see lots of patients, cancer patients who are going for treatments, chemotherapy and maybe taking other therapies, radiation and all. They have very less side effects, and uh, the recovery is also very fast. In some cases, we have seen people, they just go with this, and apart from that, proper diet plan and body detox program. So even these things, even they are not taking any, Western medicine or allopathic medicine, it's very helpful in their cases. So in short, this is what I can talk about. Now, if you have any specific questions or something, we can of course go in detail about it. Yes. Yeah, so frequency, actually this is ancient Vedic healing system working on the chakras. So, we have seven major energy centers in the body, and that corresponds to, different endocrine glands and physical organs. So, based on that healing principle, we apply specific frequencies and specific notes, like, there are seven musical notes and specific frequencies. So, basically, we use the second octave. There are in music, if you know, there are octaves, and we use the second octave frequencies that works in a very effective way. Yeah. Okay. Yes, please.
Okay. Okay. So, what I think you're saying is that cancer can't live in a high vibrational frequency in the body. So, cancer is created by low vibrations or stuck energy or toxic energy.
Yes. Right. Yeah.
Can you speak more on that?
Yeah, sure. Like suppose if we are eating healthy food, it's good for our body. If we are regularly taking, unhealthy food, processed food, it's not good for us. Similarly, there are sound vibrations that is maybe very healing vibrations, very good for our body. So if we take that vibration within us, so it can change the energy level within us and can very effectively help to detox whatever negative energy we are holding within us. That's what we see. Lots of people, maybe they have in general maybe anger, maybe they are very frustrated, and just after taking few session they feel very peaceful, they feel very calm. So that what happens, whatever negativity they are holding, actually sound help, but it should be a very kind of healing vibrations, and for that we use specific instruments, like if you've heard about singing bowls and gong bells.
So those frequencies that using the sound therapies are raising the level of consciousness or the vibrational frequency,
Yeah.
right? And this is according to David, can't remember. Anyway, the map of consciousness, the clinically proven map of consciousness, if you bring them to a peaceful state,
Yes.
that's a very high vibrational frequency.
Right. You are right. It's the same principle actually.
Yeah, David Hawkins. Um, Also, Einstein told us that you can't solve a problem at the same level of consciousness in which it was created. So that's what you're actually speaking to.
Yeah, this is very much related to this.
Yeah,
Thank you. Yeah.
I have a question to Ms.
Yes.
Mehta Saxena.
Yeah.
The thing is that you had an uterine cancer, you removed the tumor, and then you started your diet and all these things. So it was an active stage, you need to remove it, and you refused the chemotherapy. So what would have been the case? Yeah? Yeah. How? Okay. Can you hear me now? Yeah. Yeah. The question is, you got a cancer, you removed the tumor, and then you refuse the chemotherapy, and then you tried your way, that is diet. So what would have been the case if at the stage of tumor removal, can you refuse the active cancer when it's tumor and you try your therapy? Have you ever tried this? Or what would have been the result if you ever refused the surgery also? And will it be effective? Your way of living, diet, and all these things in those cases when they are diagnosed. Number one. Number two is that before you get tumor, is there an early signs that you may not get the tumor with the diet, exercise, all these things? So I would like to concentrate on my first question first. Thank you.
So let me repeat your question just so I know I've got it clearly, because this is I could not hear properly even despite the mic. So your question is, even though I had the surgery to remove the tumor and then I followed my diet and now I'm cancer free for 12 years. So is it like, is the diet effective, and what includes in the diet that has kept me cancer free? You can come right here. That'll be helpful because it's very far. I don't know, it's hard to hear. Yes, yes, yes. Yeah, I refused it. Yes. Okay. Okay. All right. So you mean to say if I did not have the surgery, would it be the same effect had I done everything else, right? Well, so let me go back to how I think and what was I have always been coming from India and being raised by my grandparents and having the influence of my grandma and my aunt, who were very spiritual women, highly intuitive. So I always had that spiritual awakening, not religious, spiritual awakening. And for me, being so intuitive from the very young age, I was able to understand why it is happening to me. How come this cancer or this bleeding or metamorphosis did not happen to any of my cousins before me or after me on either side of the family? I'm the only one who got it. And I also have known very well, having lived my life, of course, from the young age, the struggles that I've gone through and a lack of support that I've had to go through because I was raised by the most wonderful grandparents and aunts and uncle for the first 10 years of my life. And from 7 days old to the first 10 years. Then after 10 years, I lived with my parents. We moved out of India to a very different country in Saudi Arabia and Jeddah. And I, there's no common ground between me and my parents. So I had severe trauma because in my grandparents' home, I got a lot of love. And when you take a child from such a wonderful, loving environment where the child is blossoming to complete opposite, it is serious trauma. I used to cry and cry and cry and cry. Nobody did anything. It was just very empty. Okay. So I knew, and then that relationship, you know how the wheels are like rubbing against each other, it gets worse, 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 worse. It got worse, 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 worse. So I'm very open about it because this is my passion to talk openly about my life story and to raise awareness. And I knew that was building, continuous. Then it becomes argument. Then you're carrying the weight of somebody's words. Then, I moved out of my parents' house because I could not take it. And then I have done everything on my own since I moved out at 21 years of age. Now, none of my cousins on this side or this side, maternal or paternal, have had that. They've had absolutely amazing homes, stable childhood, full of love, warmth, support, everything. So how come it is me who got cancer? And that too, being an Indian, back in India, we didn't have cancer rates for the last 2 decades. One of the things we did in cancer research was study the patterns of cancer. And India and Japan are two of the countries that have had the lowest or non-existent cancer rates. So how come I get it? So to answer your question, if I had not done the surgery, my thing was let my body do what it needs to do and let me reduce the noise of people. First and foremost, it's going to be a family who's going to try to give you advice. And if you look at the person you're taking advice from, make sure you observe them very well. Because if you take advice from somebody who is living out of their medicine cabinet and can barely walk without breathing, you are going to become the same person. Now, if you take advice from somebody who's fit, healthy, and a living example of health, you will become the same person. Okay? So I was not going to tell anybody in my family that I have bleeding for 2 years. Only two people knew about it at the time: my best friend from childhood and my aunt. Only two people, nobody else, because I didn't want any noise giving me advice, and I didn't want. I was so I let my body bleed. This was my thinking that let it do what it needs to do. I know my body has strength. God, universe, whatever you believe in, it has given us everything in our body. It's healing mode. Okay, and so I let it bleed. And I told myself, whenever there's time to have surgery or some action is to be taken, and this problem is to, because those 3 years seemed like eternity. I did not know it was going to be when it's going to stop the bleeding, and. So I was like, well, when will this stop? But I believed my body giving me sign that it will stop, and this is the action you should take. So my tumor was on this side. It was an ovarian tumor. So my ovarian cyst that had come from traumatic 10 years ago grew, and became ovarian cancer. And it had grown enough where at this point now, my leg was swollen because the tumor was blocking the flow of the fluids. So I had very swollen leg. And at that time, I also had pain in the back. And I knew that that stage of 3 years of bleeding, which I call my metamorphosis, because the old blood full of trauma, pain, sadness, anger, resentment, lack of support, lack of love, lack of warmth is leaving. And by God's grace, in 3 years, I never fainted. I was running my life all on my own, working UT oncology, and taking the shuttle, taking the metro, coming home. I rescue dogs. I had 5 wonderful dogs. I still have dogs, and taking them for walks and just everything. And I never fainted. It was God's miracle. Okay, and I had serious bleeding. Like my managers in UT oncology knew about it. They were females, that I may have to go home if. And for those 3 years, as any woman knows here, I only wore black pants. Going because we had to go take shuttle to go to UT in the medical clinic in the medical center. And so my managers knew if I have to go home, if it's too much, I will have to go home. It was that open. So when it got blocked, that's when I knew it's time to do something. And I said I have to go to ICU now. At that time, I had called my brother because my biological family was here, like my brother and my mom to go to the surgery. Yeah, yeah. Oh yes. Yes, yes. Yeah, 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 yeah. So if I did not follow my own intuition, in that case, in my case, I wanted to grow the tumor. That's why I was arriving at. I wanted to grow a tumor and then take it out. Now, if somebody has a tumor and they want to suppress it through diet, is it possible? I do have cancer patients who come to me, and we do offer coaching or holistic programs, especially for women. Right now, it hasn't been for men, where, for example, one of my clients, she had breast lump that she just got diagnosed with breast cancer, and she did not want to do any of the surgery. So I coached her for 1 year exactly using the same holistic modalities, like, for example, black seed oil massages, because in Ayurvedic clinics in India, where we are treating cancers, we have oil massages, since oil is one of those gifts from nature that can transfer the herbs and the spices directly to the cells, deep into the tissues. So we incorporate all of that. I teach them, okay, this is going to be an oil blend with castor oil, black seed oil. This is going to be a massage on your cancer side. This is going to be a diet. You're going to stay away from dairy and meat-based diet and fish. We don't want any of the low vibration items, okay? And this is how you're going to manage your stress. And so this is a fact where it's also on my website as we talk right now, her testimonial. Her doctor checked her, and her tumor, her lump, breast cancer, what do we call it, did not come back. And it has been, I coached her in 2019, it hasn't come back. So just one example, okay? This is 2026. So it hasn't come back. So it depends on the state of the person, I would say, at the end. Because in my case, I wanted it to grow so it can come out at once, right? I knew how my body functions and how it's healing. Somebody may have a big lump or tumor, and they want to incorporate all the modalities, and they may even have some more alternative therapies like hyperbaric oxygen therapy. Sauna is great, lymphatic detox. And I do run 12-week program for all women who are in this situation or who just want to be healthy and want to learn how to clean the lymphatic system. It is the way our body cleanses toxins. So these are all very important. And then I teach them about proper sleep, because sleep is when you heal. That is when your cancer cells are likely to die, okay? And when we clean our lymphatic system, our normal cells don't have to compete with cancer cells for nutrition, because cancer cells have 10 to 20 times more ability to get nutrition because they have more hormone receptors on their surface than normal cells. So what happens is, it's like, just say somebody has tumor, they have cancer, they have more hormone receptors, they're going to get the nutrition and they want to try. Normal cells cannot get the food, okay? So now we are having competition within the body. So now somebody has tumor, how do we suppress this and get the normal cells to boost? So then I teach them, okay, how in India we would have like in Ayurvedic centers, we still have it. We have pure boiled vegetables and detox diet, like khichdi, for example, like just very full of millets and grains and seeds. This is the diet you eat during the time of treatment. And then we do panchakarma, which is 5 stages of detoxification with oils and cleansing of your, anemas and things like that, and lymphatic detox. Then we improve your sleep and stress levels. Then we tell you, okay, this is the supplements you will take to boost your health, and regular natural supplements, minerals, vitamins, electrolytes. So we are giving more power to the normal cells and suppressing the cancer. Big thing. How do you manage your glucose? Because if glucose in a person who has tumor and they are not managing the insulin, that is a disaster. If they don't want to do surgery, that's fine. But how do you suppress the insulin from going to the cancer cells? Because cancer cells will pull it faster than the normal cells. So teaching people in my program that you have to get up after you eat. I don't care if you eat like one bite or you eat a whole meal. Get walking. Okay? Get going with the dishes, get walking, walk the dog, walk the cats, whatever you have to do. But for 20 minutes, you cannot sit because I need your insulin to go into your normal cells. So these things work because I have those testimonials on the website where women with breast cancer have come to me, and these women did not just have breast cancer because often it comes with symptoms, thyroid issues, skin inflammation, a lot of high cortisol stress, or some traumatic event that triggered it. It could be like divorce, death of a child, death of some loved one, anything. So something like that. So yes, it can be absolutely done. And we can talk more about this, and I'll give you my website. You can check it out. Yes. Yeah.
Yes.
Okay, okay.
Thank
I'm
you.
I'm done now, right?
Thank you so much, our distinguished panelists. Thank you. Thank you. Let's give them a good job. Good job. Good job. Good job. GOODJOB. Good job. Good job. Perhaps one of the hardest things about being an MC is having to cut off great conversations in the middle. And even though we want the Q&A, the question and answers, we may have to hold some Q&As today and invite you all to talk during the networking hours because your questions are so specific. They're really meaningful. And we just want to keep honoring everyone who is planned and ready to speak. Our session just now was very insightful, a very enlightening discussion. We're going to shift a little bit to the importance of understanding and addressing patients' diverse needs. Why does cultural awareness of representation matter in delivering high quality healthcare? How can healthcare providers ensure every patient feels seen, understood, and supported? Our next session, Culturally Competent Healthcare, Why Representation Matters in Patient Care. We'll dive into these questions and explore strategies to create more inclusive and effective care environments. Let's give a big warm round of applause as we welcome our incredible panelists to the stage. Coming up to the stage, we have Daniel Ruth, founder and principal of Dignity Life, Barima Apong Owosu, founder of Ankara Health. Okay, no problem. Here we are.
This one? Hello. Good morning, everyone. How are you all? Great. I can feel this energy because we need it for this conversation. And let me start with something simple but uncomfortable. Truth that healthcare doesn't fail people miserably. It fails people predictably. Because when culture is missing from the care, what we call non-compliance is just misalignment. Representation here is not just about who is in the room, it is about whose knowledge counts, whose lived experience is validated. And I'm incredibly glad that I'm not only the one thinking about this problem. I am Neha, founder of Diaspora Nutrition, and I come from this world of immigrants, of Asian Indians, where I talk about culture forward nutrition for the immigrants on the foreign land so that they don't feel this sudden health decline like food intolerances, metabolic issues, and then you are dismissed by saying, you know what, just quit your rice and have your quinoa instead. No, we are not going to accept that. I want to introduce you to the amazing panel along with me who will be talking on this conversation. Introducing Dr. Frida Maina, CEO and founder of Spiral with Frida. Burima Upong-Uwuzu, founder of Ankara Health. Eric Harris, CEO and founder of Canary MedTech. Brianne Kaiser, BetterHelp's Director of International Clinical Operations. And Daniel Ruth, founder and principal of Dignity Life. And I want to start with a question that goes right to the root of the cause. Dr. Frida, what decisions are we making before a patient is ever seen that seem correct today, but maybe quietly shaping the mistrust, misdiagnosis, and disengagement later? I'd love for you to start us off.
Thank you so much. And that's a very good question. And we have many lived experiences and many stories that all of us here could tell, where you went to see your doctor, and even before you had a conversation with the doctor, they're already prescribing for you that, you know, you need to take this or you need to start on this. So those are decisions that are already being made right there, real time. And I'm sure if I sampled here, there are many of you asking yourself, where did they get that information to start making decisions to prescribe for me something? Oh no, I looked at your chart, and because you're from this, race or this background or this continent, I know you are more likely than most to get this. And then it's like, okay, so we are going to run some blood work to find out, or we're going to send you to the lab to find out more. And then my question was, on that particular day, when I remember that, I was in Michigan. It was a cold day. So I asked, so how did you know, number one, I'm pre-diabetic when you hadn't even had a conversation with me? Just by looking at my chart. So those are decisions that are made pre even meeting the patient. And then when it comes to, this is informed by research that is global. And then it's like, did it include me or people like me? And then no, it was a general research, and that's what we found. But you haven't answered my question. Did it include me? And so what I'm trying to say is, number one, the decisions that are made on medication, the decisions that are made on how we conclude who is, predisposed to get what or to be prescribed for what, the decisions about who is making those decisions, all right? Because that's the question that kept coming to my mind. Who is making these decisions? Am I represented at that table when they're making those decisions? And then when it comes to research, decisions are made, again, on generalized research, which is not specific. And so when you find your doctor telling you, this is what I think is going on, then have a longer conversation with them about why do you think so. So another decision that is made is the space or the time between intake of a patient and the time they see the doctor. So I'll come in at the reception, I'll be given a long form, whether it is on the iPad or a physical form, and as I'm sitting there filling in all this information, even before it gets to the doctor, they've already made a decision about that. But I'm sitting there alone, and I'm filling it, and there's nobody to even ask a question. And so I'm there, the doctor is over there. There's that space. And then guess what? The minute the doctor gets into the room where I've been sent to wait for the doctor, within 15 minutes, they're able to diagnose my life history, my relived experiences, and come up with a diagnosis. 15 minutes. Because another decision was made about those 15 minutes. We are talking efficiency, and so we want to pay the doctor by the fees, not by the time they spend with the patient. And then we want to minimize the time they spend with the patient, and therefore the doctor is caught in between wanting to give proper care to the patient and efficiency. So is it efficiency we are going for, or is it care we are going for? Again, decisions that are made without the power or inclusion of the patient. And yet, we are talking about patient care. So when we are talking about patient care, which happens to be you and I, and we are not at that table, or we are not represented at that table where decisions are being made about us, that is where cultural incompetence and lack of knowledge comes in. And that's where decisions that are made out of speed rather than care, that's where my concern is. I hope I answered that question.
Beautifully, beautifully. And we need more conversation like that. Let's pass it on and continue this.
All right. So, Brima, I have a question for you. So, bearing in mind the space and the speed that I was talking about for patient care, what can AI do? And so, my question is AI has the potential to reinforce systemic biases. I've highlighted a few biases, if not carefully designed. So, how is Ankara Health building its platform to avoid embedding these biases and ensure it actually expands access to care for underrepresented groups like me?
So great question. So great question. And our metabolic health platform, the way we're trying to incorporate cultural competency into it, I'll give an example of garbage data in, garbage data out. When you think about clinical care, one example is with glomerular filtration rate, GFR. For a long time, there was a race multiplier. And so because of that, African American kidney function was overestimated, which led to an undertreatment in terms of kidney disease in the black population. And so knowing these things, there are data tables or our data sets that we're utilizing, we're trying to eliminate some of those different race multipliers and things, and utilizing the historical data, but then also combining it with real world data and evidence from real populations and different segments of populations looking at those different markers. We're looking at mostly metabolic markers, but having an understanding of where the flaws are in the data sets that currently exist are one way. And so from a cultural competency perspective, we're also including the voice of the community. And so I'm based in Michigan, and so there's a lot of community-based organizations in the Detroit area. And one thing I've noticed is that with precision health and with digital health, there are a lot of tools that are being created that don't have the voice of the populations that they're trying to serve involved and included. And so what we've done is connected with these community-based organizations to talk to the community and the people who would be the users as to what they utilize, what things they don't use, how does it fit into their daily work and their daily life cycle, because we're trying to connect with more blue-collar manufacturing workforce populations, whereas a lot of the digital health tools out there are geared towards more affluent clientele. And so there's a disconnect between the target audience and the solutions that are being provided. And so that's one area of how cultural competency and the connection that we're trying to make in terms of getting the people, the end users, their voices to the table, and they can be involved in the architecture and the design of these different tools.
Thank you so much.
Yep. So Eric, I have a question for you. As digital health and is distrust in healthcare really the root issue, or is it the consequence of gaps in representation across data, design, and care delivery, especially as AI becomes more embedded in the system?
Yeah, I think the stories that we're seeing and what you're speaking to alludes to that as, I mean, we think about data and the fact that the decisions are being made before you even have that conversation. And that's something that many of us probably experience regardless of what race, ethnicity, where we're from. We've experienced that where the decisions are being made. With AI specifically, the data set is important because the models are being trained on that data. So if your or my data is not included in that data set, how can it then make a decision that impacts or that actually is relevant to us as patients? And so that is something that we're looking at. And that's a big thing. Distrust is huge. But distrust, I don't think starts with data. It actually starts, like what you said, you're in a physician's office or you're in a clinic, you're filling out paperwork. It's that experience. And oftentimes, how the system is set up currently is not based upon the patient care, it's based upon the outcome of the doctor getting from one patient to the other. And that disconnect is where distrust is often started. Having experience with a family member who went through a similar thing with Liprocel and high blood pressure, and was diagnosed, had a lot of symptoms, fatigue, lack of sleep, low energy, and didn't realize that it was the medicine at the point. Stopped the medicine after a couple of weeks, got energy back, etc. Went back to the doctor. The numbers were not quite right. So the doctor said, stay on the medication and let's give you an inhaler because you have shortness of breath. It's like, why are you prescribing yet another thing instead of identifying what might be causing this reaction to happen within this person? And so those are some of the conversations that we had. She stopped cold turkey and said, no, I'm not doing any of that, and was fine. And lo and behold, her blood levels actually regulated normally. And that's just a conversation to be had with the doctor versus just prescribe, prescribe, prescribe. And so that distrust, I mean, her husband doesn't like, I'm not going to the doctor. It's his response after seeing his wife go through that. Imagine if that happens across a large population. Now they're not engaging when they should, and that data is not there, let alone the experience. And so those things I think we're dealing with now, and that creates a huge distrust, not only in the medical system, but then also or the health system, but also in the data that's coming out of what's considered as personalized medicine as well. And
I'll hold on here. And here I would like to take a quick pulse from the room. As you have listened to the three experts, where either the data is not correctly acquired, either the data is not interpreted properly, and then there is a cultural gap. How many of you in this room have experienced this cultural tension, misunderstanding, affecting the outcome of the patient? I want any one of you, if you have any experience to share or ask.
Yeah. I see a hand at the back with the lady in red.
It's for the people. We have a live feed, so that's why I asked people to get on the mic.
I don't know if this is an example that does justice to what you're looking for. I work in mental health, and when I was working through my license, we worked with people from federal probation who had gotten out of federal prison, and there was a cultural judgment. I'll just try to say it as nicely as possible, where people of African American descent were highly judged negatively, and they dropped out of care. So I'll just say that. I hope that that was helpful.
Thank you. Thank you for sharing this. It might help us to bring more humility in our care, how we approach the medical system, and that's what we are here for. Thank you. Eric, I would like you to continue.
yeah, absolutely. So we were having a conversation out earlier about just access to health and some of the things around accessibility internationally as well. And you're working with Better Health doing that. Can you share a little bit more on when it comes to digital mental health and how to scale that? How do you ensure that access is there and that it's appropriate to, I mean, you have languages, you have barriers in financial. You know, can you share a little bit more what you're doing there and how does that work? How are you solving that problem? You.
Okay, thank you. I never know. I think what, from a better health perspective, is we are recognizing that access alone does not equate to cultural competence. So while we have 30,000 members, we have 30,000 therapists from 100 countries, that alone does not indicate cultural competence. So through our matching system, we recognize that therapeutic alliance is one of the strongest predictors in mental health outcomes, positive mental health outcomes. So we're asking questions like language preferences, we're asking ethnicity, we're asking questions around religious-based perspective, specific conditions. And the idea is that we're having a match rate from a client to a therapist perspective at around 93%. So again, we're asking the questions to kind of be a little bit more grounded in that localized experience, in addition to having 7 localized countries. So while you can be a member in Singapore or in the Philippines and match with a therapist globally according to your preferences, we're also looking at how can we localize more specifically. And that means having country presence, having therapists grounded in that culture, in that context, and having that client experience be a little bit more relevant to your patient care journey. In addition to that, I think it's really important to recognize that therapeutic alliance is a predictor, but so are the specific preferences. How are we talking about care? How is mental health understood locally? What are the stigma parameters? What are those biases that we need to factor in? And that is one of the core values that we see as being the strongest predictor. So I'll pause there and maybe hand it over to Daniel, because while I was speaking from a mental health perspective, Daniel has a lot of experience in senior living. So I would love to hear your perspective on how do we see cultural competence in senior living.
Thank you. Can you hear me?
Yes.
Wonderful. I'm actually, as I was walking up here, I decided to completely change my approach this morning. I've done this before, Neha, much to moderator's chagrin. But I think 3 stories in senior living, 2 or 3, will really give you the sense of how cultural competent organizations can thrive or greatly fail in senior living. My background, by the way, is I have designed, developed, and operated Jewish-sponsored senior living communities in Canada and the United States. So the stories, could you imagine you're being flown in for your first interview, and you're walking down the halls and you hear what is an older adult singing, Baruch et Adonai Baruch le'olam va'ed, Baruch atah Adonai. She's starting to go through her bat mitzvah. When there's a special rite of passage when one is 13 for boys and girls, bar and bat mitzvah, and with this woman, she was a Holocaust survivor, and so she never had the opportunity as a child to get bat mitzvah. And so at the Jewish Home of San Francisco, we started holding on a monthly basis bar and bat mitzvah. By the way, it takes 6 months to a year to learn as a student of bar bat mitzvah your part, unless you're not worried about screwing it up all the time. I was. By the way, you're supposed to sing it. I purposely didn't sing it today. You don't want me to sing. Okay, so that's sort of the first story. And I happened to poke my head in the room in the synagogue, and it was there was no room for anyone else to join. So I just stuck my head in, and it involved the family. So cultural competency is ensuring presence and representation of major constituent groups of an organization. So at senior living, we looked at, of course, our board of trustees. We looked at our staff, to be sure, and we looked at our resident population. Which population do you think we did the best job with, and which population do you think we did the worst job with? I'm going to open that up. The 3 choices are staff, residents, or board. You're boarded? Yes, sir. Board. As which one?
As the one not represented.
The choices are staff, residents, or the board.
Or the board.
That's the board.
And my question was, who do you think we did an extremely good job with in terms of, and which one do you think?
I'm saying the board you did a good job with. The staff was second and the residents were third.
You're wrong on all accounts. How's that? The board did a fabulous job in terms of taking the perspective of the staff. But when you looked at the actual representation of the board, it was 100% Jewish. That was not representative of the resident population we were looking after, and it certainly wasn't representative of the population in near proximity. So the board took themselves very seriously, maybe too seriously, and they did not apply the same rules to them that they were applying to the other two groups. Your second one was staff, which you thought, you listed board, staff, and, correct? And then residents.
No, my response was data, we only analyze what we look at.
Right.
So the more data you have, the more you look at it. Since board tend to be more outspoken, they're usually listened to first. Staff is second, patients are third. I'm not saying that's what it should be.
You know, you're right. And in fact, I think the staff group are right there with the board in terms of significance and importance. And we did a horrible job of really integrating and involving staff in key decision making. It got a little bit better, but it took some time. Those are my couple stories. I think I'll stop for now.
Thank you. Thank you so much. I would like to open up to the audience once again. Yes, for those who have any questions, can we hand over the mic? We're all decision makers here, so let's work it out.
Good morning. Can you hear me?
Yes.
Yep.
Oh, okay. Yes. When it comes to cultural competency, in my experience, I found that one of the barriers is more on a systemic level. I feel like those in leadership positions who do hiring and things like that, maybe gatekeepers, if you will, cause issues with allowing certain individuals that represent certain cultures in the door. And in mental health, we have a large proportion of clients that are not being served because they can't connect. And engagement is a big piece of the work that we do. So I'd like to encourage us all here as professionals and leaders to be cognizant of the biases that we hold at the door. Because if we're not, I guarantee you that's being perpetrated on the people that we're here to serve.
Well said.
So well said. And I would like to also add on that we are one country, right? We are all here together owning our life to the soil. So let's bring in that diversity and inclusivity without any biases. Anyone else? Yes, sir.
Can you hear me?
Yes, I can.
So my question is, why are we diagnosing one person? Because if you haven't done research on a certain group, how do you know, like for example, the medication they give to people that have diabetes, they give it to everybody. And they haven't done research on all of, different groups or race, how it reacts to the person. So a lot of my friends who are black but they have diabetes, what they have complained to me is that the medication makes them feel sick. So therefore, that is why they do not like to take it. But I think there is an assumption that because most black people don't take the medication, it's like we are rebelling or we don't trust the doctors or something. Because when I speak to my doctor about certain things, she's telling me your cholesterol is high, blah, blah, blah.
Absolutely.
Well, you haven't even, when you take the blood test, the result was not in, but you already wrote me a prescription. So that is where I argue with them and I say, well, how are you sure what is going on? because you already assume that I have diabetes and I have cholesterol, and the results are not even in my blood results.
Can I?
Absolutely. I think, is there somebody
Yeah,
inside the
I,
healthcare
I would
system
do
who
that.
can answer that?
So there's one aspect of that that we all should consider. Medicine is science. Science is experimentation. It's a hypothesis, and then you test the hypothesis to see whether you're right or wrong. Most doctors, they're scientists in nature. That's what medicine is. So if we go in uninformed, the doctor's starting at a place to then figure out where to take you to or from. And that's just medicine in general. So it's not that someone's, I mean, some people are incentivized to give out medicine because they make money on it, sure. But largely, many times, doctors are, especially if you're a new patient, they're trying to find a baseline to then understand where are you going based upon where they see your symptoms arising. But that's the onus on us as people as well. Own your data, understand your own health data so that you're informed of why your cholesterol numbers are the way they are based upon your activity levels, your diet, your nutrition, things of that nature. The more informed you are, the better you can actually answer questions when you're asked. And that also gives you the power to then negotiate how you are going to be experimented with. You're taking someone that is highly trained in experimenting and understanding medicine, but it may not be relevant to you. You bring that information to help them tailor their experimentation or hypothesis process to give you personalized care. That's our responsibility, regardless of who you are. That's our responsibility because ultimately it's your body. So that's something to encourage as well.
Can I,
So-
sorry,
Yeah,
sorry.
I would
Just-
like, yeah.
I just want to give it like the flip side. And while I think the responsibility should be as you are your best advocate as a patient, as a client in the healthcare system. But at the same time, assuming that everyone has the ability to synthesize the data and have access to that education and knowledge, I don't know if that's necessarily always the responsibility of the patient to have that informed decision making. So to go back to your question, on combination of self-advocacy, but also embedding some of these cultural competencies learnings, that it's not a one-size-fits-all approach. We're acting and we're starting with a treatment plan as a baseline, but when those cultural considerations and perceptions come into play, as well as physiology and science and all the rest, I think that's where we see a better healthcare system writ large.
Yes. And I would agree with that. Yes. Yeah. There's a caveat
Would
to
you
that.
like to add something into
Yeah,
it?
so I was going to add into your point about diabetic medication and having spent a lot of time with clinical trials and clinical trial involvement. To your point, it's experimentation. And so if you think of it as a bell curve, when you're doing studies, the medication is geared towards the majority of the population, but that again goes to data going into it. And so people being involved in the clinical trials from the beginning helps understand which populations may benefit. So unfortunately, there's a lower incidence of African American people in joining in some of these studies, and so you're already removing the population at the onset. And so just being mindful that no medication works for everyone, but the goal is medication should work for the majority of the population. Side effects are part of the process because, again, it's a risk-benefit scenario. You understand that you're accepting some risk with the potential that you'll have more benefit than risk with certain medications. So as a pharmacist by training, I actually err on the other side that I try to tell everyone go the holistic route if you can, and if you can't, because it requires more work in terms of habit changing and habit modification, then use medication if you can. But again, to some of the earlier conversations, there's so many ways that you can naturally improve when we talk about chronic diseases such as diabetes, hypertension, those sort of things, that you should approach those routes. Because if you look at most of the studies, background is always diet and exercise and lifestyle modification first, with medication on top of that. But most people don't do the underlying steps.
Yeah, that's true.
Dr. Frida?
Yes, so thank you. And what I wanted to piggyback on is the advocacy, component, and you taking charge. But then I do remember there is power dynamics. So, and then because of the cultural incompetence we were talking about, when it comes to power dynamics, there is that assumption from some cultures that the person who knows, or the person I'm going to consult, is going to do, number one, their due diligence because they know better. That's the assumption I'm coming in with, even as I am ready to advocate for myself. And then when you go to a person who now knows more than you do in that field, not about me, they don't know me, but they know more in that field, then I go to them and I drop my power. and I give them all my power because they will do their diligence and because they know. That's the assumption in the hypothesis, right?
Yeah.
So because of that, then as much as I want to be my own advocate, I'm already disempowered because the person that I have gone to consult is supposed to be the person who is in power. Just like a teacher, I've been an educator since I was 19. Just like a teacher, when a student comes to a teacher, they're coming because, oh, the teacher knows more. And then you realize, I don't do math because I don't know math, right? My children are always laughing at me because when they give me 5 quarters, don't ask me how much money that is because I have no clue. I know that 1 quarter, there are 5, but the result of that, I do not know. So anyways, so the power dynamics, and let's go back with that power all the way to the boardroom, all the way to the research department, all the way to the trials. And then the conversation we were having about, the data that is collected. And so, like you said, if the bell curve is like this, then they'll follow the majority of it. And then, unfortunately, every time I'm falling on the outlier section. Therefore, none of my data is making it to the boardroom or to the clinical trial decision or to whatever decision table exists. Because, number one, when it comes to access, I don't have access. When it comes to financial, so that I can pay even copay, not on that table. When it comes to diet and exercise, I can't even afford because I live in a food desert. So all those outliers, I will never make it to the decision table. And then I become my own self-advocate, and then I have no power because I have been disempowered by the fact of the power dynamics. So tell me now, because we are all here, what are we going to do about that? Yes.
Take down the patriarchy.
Yes, ma'am, please. You want the mic? Yeah, you. Yeah.
So we all know that data is only as good as the question that asks it.
Mhm.
And in virtual care, when you think about, is it on?
Yeah.
Yeah.
Yeah, it's better.
Here it is. All right, so if you can hear me now, I'll repeat. So we all know that
Hold
data
it closer.
is
There
only
you go.
as good as the question that asks it. And in intake, or when we do virtual and digital models of care, we need to ask the right questions for efficiency. We are now in an area where to understand diversity and to be inclusive, we inadvertently created boxes that go into those questions.
Mhm.
Do you think AI is allowing for those open-ended questions to come back? I find myself always putting other. So where does that potential live in getting the accurate, inclusive data?
Fabulous. Any AI-driven?
I can have somebody in the audience speak.
I see someone else over there.
Yeah. I
Oh,
have a
there's
thought.
someone else.
By the way, I did clinical trials or designed and ran clinical trials for 42 years. And everything you're saying about clinical trials is true. Clinical trials actually do not gather sufficient data. For example, you mentioned eGFR. It is an assumption, not a test. One of the problems that the medical community has, or the world has about medicine, is we're guessing all the time.
Yep.
We really don't have the data. AI will not solve it because the AI doesn't have the data. So the bias the medical community has may not be intentional or racial or sexual. It's that it's ignorant and it's trying to use heuristics or rules of thumb to try to treat without data. One of the things that the research community is looking at is things like how do we get more data? And we know that the Mag 7 have lots of data on us to manipulate us. The medical community has almost no data on us. What you advocate about your data, absolutely agree. The whole question is how do we get more data? And that's biometric, biomarker, imaging, and we really don't have enough data, so the physician or the treater guesses, and they guess based on their bias. Without data, we can't change.
Okay, just want to make sure that we respond to the question that was asked first.
Yeah.
And I'm
So-
not sure how this
Yeah.
We're just going to fix it. Thank you. So I apologize for that.
So what he said actually does address that question because it's showing holistically how the system. So your question was, can AI kind of unlock or get us back to that point? And the answer is no, because the AI is already fundamentally built on a lack of data. The data is not available for AI to also access to then unlock more of. It can poke holes at it, but there's a bias in that in and of itself. If we understand some of those root systematic things, we then can start to ask better questions based upon what we already know. We already know there's a lack of data. How are you contributing to getting more data for yourself? Are you resistant to wearing a smartwatch or going in for blood pressure or whatever on a routine basis? How are you tracking and doing things for yourself to give yourself an additional data point that helps you then understand at least what's going on in your own body? If we start to do those things as individuals and advocate for more people to do your bare minimum, do your basic due diligence on yourself, even if you don't, to your point, understand everything. If you could go in, and I've seen this happen before, someone started taking their blood pressure for 3 weeks, knowing they were going to the doctor. They took that information into the doctor. The doctor then did not prescribe something, not because they didn't need it, because the doctor saw they were handling their blood pressure okay. They had a good management program. If you don't have the data, the doctor has nothing to go off of. The doctor guesses, the doctor puts you on something because the doctor needs to have something to start with. If we give the doctors or give physicians or give people more information in that capacity that you own, it could help in having that conversation of what am I doing? Where am I going wrong? What do I need to adjust? But if you're not tracking anything, what doesn't get measured doesn't get changed.
Mhm. And so adding on to that, the analogy I like to use is, think of finances. That's something that we track every purchase, every expense, and you can see the trends over time. And to that point, if you do the same with your health, again, now you're looking at more complete trends. Most people go to the doctor if you don't have any conditions once a year, maybe twice a year, and they're getting a snapshot in time with no concept of what else happened throughout the year in terms of your lifestyle, nutrition, physical activity, all of those different factors. And so if the doctor is able to have more information, or you yourself are able to have more information, now you can make you have a more complete picture of what's actually going on and be able to guide care in the right direction.
Absolutely.
Thank you. Thank you. Is that answers your question? Yeah?
Slightly.
You want one last? All right. Yes, perfect. Yeah.
Okay, so as a 30 plus year internist who then switched to the other side so I could empower people to know their numbers, I can tell you that it's very hard in a 15-minute visit to get all of that done. And so, what I really would love to see medicine doing is focusing on how to empower the patient outside of the room. We're talking about public health focusing on prevention in a true way, not prevention that brings you back to pharmacology, but prevention that frees you from it. And how do we then teach people that if you really understand the physiology of the human body in the easiest way you can, because we can't teach everyone how to understand. The reason I say this, if you go back to the indigenous in any culture, they figured out how to live healthy in their culture. You go to Australia. The indigenous learned how to eat poisoned food. If you don't know how to cook it like they do, you will die. But they thrive. And so we have to teach people to remember their power. Remember the fact that whatever culture you came from, I happen to be Jamaican, you can learn from your culture how to take care of your body.
Perfectly explained. And I would like to close down this here by telling you one thing. As she mentioned, that is actually a system problem right from the basics. Because in America, the food is seen as this isolated groups of carbs, proteins, and fats. And then if you want, you need a fortification of some iron, fortification of B12. It doesn't work like that. Our body is so complex. But indigenous cultures, they already know because there the system has not been developed inside a lab. There the system has been developed by observing the nature. right through 7,000 years. And it has been passed down not as certifications, but as oral traditions, right? So the one key takeaway here is, from our part, is to be culturally rooted. And the people who have lost their culture, what they can do is that they can bring those experts. Don't make Ayurveda or traditional Chinese medicine, herbalism as an alternative medicine. It's not, it's the OG. Bring it together in the boardrooms, create the system together. The mainstream needs the cultural background. Without that, we'll continue to fail and we will be there in that circle again and again. What medicines to give, how much questions to ask, this and that. It won't work unless all of us don't come together right from the basics to the most advanced medical system in the hospital. Thank you so much for all of us, all the experts here, and all the beautiful audiences. Thank you.
You know you did a good job, so say you did a good job. You know you did a good job, so say you did a good job. You did a good job. Good job. Good job. Good job. GOODJOB. Yes. All right. Thank you so much. Wow. Again, another session that could take all day because there is so much to say and so much to unpack, including starting from our own identities or sense of identities, or we can call them the masks that we have had to wear when we are in professions. We are so delighted for the panelists that just gave us this insightful session. We're going to move into another session, a little different dimension of well being. How can we go beyond conventional approaches to support emotional and mental health? Our next keynote, the introduction to transcending mind therapy. Can healing go deeper than talk therapy and medication alone? We'll introduce a powerful method that blends neuroscience, mindfulness, and energetic alignment to promote lasting inner balance and personal transformation. Please join me in welcoming our speaker and silver sponsor, Dr. Ezekiel Nelson. Dr. Nelson is a metaphysician, body worker, and psychologist, thank you, at Heavenly Healing Incorporated. He aims to help people who are dealing with mental health conditions as well as physical and spiritual issues. Take it away, love.
It's good? Okay. Can y'all hear me? All right. So, I am Dr. Ezekiel Nelson. I'm gonna be honest with you, I'm a little nervous, so bear with me. But I'm so happy to be here. So happy. First, I want to just give honor to my Creator, to God, and to my ancestors, from whose shoulders I stand on, and just allowing me to be able to present psychology to you today. Just as a little bit of background, um, as said, my name is Dr. Ezekiel Nelson. I am the owner, I am a metaphysician and certified body worker, the owner of Heavenly Healing Massage and Reiki Services. I am the proud founder, creator, and developer of Psychology Education System, where I teach you how to heal yourself, mind, body, and spirit. Uh, we do this through a method called Transcending Mind Therapy. And this therapy teaches you uh, the basis of know thyself. Because when you know yourself, you can heal yourself. Now, I'm be honest with you and very transparent. I wasn't going to mention what I'm about to mention because I was told, well, don't do this and don't do that, and don't talk about this and don't talk about that. But I'm gonna be honest, after seeing and hearing what I've heard thus far, I'm gonna talk about it. Because it's, you know, when I first got psychology, and let me tell you how I got psychology. I'm a very spiritual person. My background is straight church. I'm like the first. I'm the fourth generation of ministers in my church, and so of my family. But that transitioned into more spiritual type work when I began to understand that God is so much more, spirit is so much more, ancestors so much more. And when you hear these words, ancestors, divinities, deities, people automatically get scared because like, oh my God, this ain't that's the devil or this the whatever. But understand that all of this dwells within us. Everything is within, right? So if we are at a higher elevation or at a higher vibration within, can't we use that knowledge? Can't we use that vibration to heal our bodies as well? You know what I'm saying? We've been hearing a lot of being connected, having connectivity with source, having connectivity with spirit. And these are key key aspects to being connected and being one within self. Psychology is a new approach to cognitive behavior and spiritual healing. I was sitting and meditating, and one of my ancestors came to me during that time. He was I call him Papa Michael, but he was my great uncle who was a psychologist back in the 1800s, and he brought this education system to me with the words, our there is no mental health or mental mindfulness designed for our people in this day and time. During during the time of development, we were excluded because we weren't considered. So therefore, teach this, speak this, and let it be known that this deals with the spirit, this deals with the mind. And when you correct those two, the body follows, right? So it's a education system that will help with healing yourself, understanding to heal yourself. I believe there is a problem today, and I believe that psychology can fix this problem. How? Well, what's the problem? People are unconsciously aware of who they are. This lack of awareness impacts their thought patterns, habits, and general life in just their general life altogether. So using both psychology and transcending mind therapy, people can be able to heal and understand themselves. They can begin to know themselves and begin to take that knowledge and apply it to their lives. So I'm gonna probably skip through this whole thing, go down to the statistics, which there we go. So statistically, there aren't any real teachings to therapists that will teach other therapists to take a spiritual approach. Psychology, transcending mind therapy is here to answer that solution. It's to here to give that solution. We're here to teach other therapists to take the approach of understanding, as one said earlier for the panel, how to be able to tap into other cultures, spirituality, to where they can be able to help them heal themselves. Because I believe every culture should have their own psychology. Why? Because every culture has their own discipline. Every culture has their own type of way of thinking, how they do things, you know. And so therefore, if that can work and if that can be, then why not teach it? So therefore everybody can be healed on their level, right? So that being said, let's take it on back. What is psychology and where did it come from? Like I said, it was handed down to me from my ancestors. It is an education system, and within this system is a therapy construct called transcending mind therapy. This form of therapy helps one to connect to their true selves and higher consciousness because it is a bridge between psychology and higher consciousness. By teaching the basis of know thyself, because when you know yourself, you can heal yourself. This part of the construct includes modalities such as Reiki, talk therapy, frequency remote healing, intuitive counseling, and even somatic body work. So I am a Reiki master teacher, and one thing I realized is that when you do Reiki on people, let me slow down. People has their own concept of Reiki, spirituality, all of that. And my thing is, spirituality has been infiltrated. It's been turned into a fad because now everybody does this, everybody does that. When it comes to our ancient African type of spirituality, like Ifa and even the Haitian, with the voodoo, that's been demonized. And it shouldn't be because it is a part of life. It's a part of who we are. People don't realize that deities or energies or divinities all dwell within. How? Because there's a when it comes to the Ifa tradition, we hear about what's called the Orisha, and the Orisha are forces of nature. These forces of nature are called various names, but the most popular ones are Ilekba, Ogun, Oshun. These particular forces dwell within you, right? Oshun on the outside deals with the rivers and deals with the streams. On the inside, it deals with your veins. It deals with your arteries, the streams, the rivers of the body. Ogun deals with the forces of making things happen. It also deals with your heart. It's the heartbeat of the earth, but it's also the heartbeat within you. Ilegba deals with choices and decisions, which deals with up here. When you can make 1,000 choices, but only one decision. He's a door opener and closer. Why? Because when you make that one decision, then all the doors to that situation that you're making the choices for opens and closes. So now you have a path to go, okay, I got this option, let's go this way. And then therefore those doors close and now you have more options. So this is how this works when it comes to spirituality. When it comes to what's called the comedic tree of life, as a matter of fact, let me show y'all. And I'm very open to questions during while I'm talking. So I don't mind, especially if it'll save time, because I don't want to go over or anything like that of sort. This diagram in this is the Kabbalah, but in the Kemetic system, it's the what will be in the center will be on top. It's called and these are particular spheres. These spheres are the paths that we take as we come from conception into birth, right? Now, I'm going to wrap all this up to where it makes sense. So each sphere from the top to the bottom are transitions that we go through as we're being conceived. It's developing our mind, it's developing our spirit. And so when the child is in the womb, and and the parent is going through certain things. They're going through certain feelings, abuse, traumas, dramas, whatever. That child feels it. That child is going through the same type of trauma or drama because it's going in through the bloodstream. It's going in through the nutrients that the parent is taking in. Even the food that the parent is eating, the substance is helping to develop that child. And if they're eating in a certain kind of way, having a certain kind of mindset, even when they're having sex, wherever their mindset is to conceive that child, all of that is affecting that child and is affecting the makeup of that child. So when they come out, when they're born, they're carrying everything that that parent went through. So when it comes to transcending mind therapy and psychology, we go back to the beginning and we teach, okay, what happened when you was this years old, that years old? What happened when you was in the womb? How was your parents? What did they go through? And sometimes it goes to talking to the parents of that person if they're still around and finding out what traumas they may have gone through and so forth to be able to understand where that mindfulness of that child or that person is at. So we can take it back and then begin to treat them, begin to understand them. Then using even, once again, teaching the basics of know thyself is helping one to understand that, okay, my mind is negative because I've been told so much that I can't do something. My mind is fearful because I've been told so much I shouldn't do something. And a lot of times this starts as a child. It starts as a child, and we grew up with this. And a lot of times we forget that when we grow up, our little boy, our little girls are still there controlling our lives. They're still there in the back of our heads saying, no, don't do that. No, don't say that. And so we're trying to progress in life, but our little boy and little girl is like, no, 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 no. So we got to learn to recognize when that's happening. Is it self-doubt or is it our little child keeping us from doing what we got to do? Am I making sense? All right. So using the tree of life to understand how these spheres are all connected to your being and how it shapes your mental and spiritual makeup Very important because you're dealing with not only the top three deals with your spiritual power, the middle three deals with your spiritual will, and the bottom four deals with your consciousness as well as your outlook, as well as your output. Because not only is that how you develop from conception to birth, it's also how you live your life. When you have an idea, right? Your spiritual power is like, okay, let's make let's build this big castle. Yeah, we can do this, right? We got the drive, we got the intuition on how it's gonna work, we got the spirit, like, yeah, we'll make this happen. Your will is pretty strong, a little maybe a little doubtful because you don't have enough knowledge or anything. You may not know the laws behind it, but you still got that strong will. But then somebody told you can't do that. No, no. You got to consider this, that, this, and the other, and then this whole list of stuff. So, yeah, you can't do all that. And now it all just goes downhill because now all this negativity and all these thoughts and so forth. And a lot of times when you think of something and you dwell on that, what you thought about, it's like the universe brings more of it to you. And now that's all you see versus, I believe somebody said earlier, just keep going. Just keep going. Don't listen to what this one and that one says. If it's in your mind, if it's in your spirit, trust that and just do it. No matter what, just do it. And so we teach this. We teach therapists even how to be able to diagnose. Please forgive me on the lack of vocabulary, but we teach them how to work with clients to where they can be able to understand where their thought process is lacking, where their mobility, where their drive is lacking. We teach them how to do these things, and not only the therapist, we also teach the client themselves as to how to help themselves, where to come back and take responsibility for themselves. Because at one point in our lives, somewhere in our lives, we said yes. We said yes to a situation. We said yes to a mental, a trauma. We said yes to a drama, whether it be our own doings or someone else's doing that we allow to take on their situations. Because people will love to bring you their problems, dump it on you, and then walk away feeling better. And now you're carrying it. You're like, oh, shucks. Why do I feel bad? Why do I feel this that way and the other? Because I took on your crap. You know what I'm saying? So it's like we have to understand where are we feeling these energies from, right? And so being able to do that, we can go back, we can sit, we can go through meditation, we can journal, ask these questions, ask what it is, because if you ask yourself, you will answer yourself. People will tell you, don't talk to yourself. That's bad. No, you have all the answers. You have everything inside of you according to your path, right? If it's not your path, then ain't your answer. You know what I'm saying? It really is life. Life is simple. Life is easy. A lot of times we make it hard because we're trying to take on too much of what's not ours. You know what I'm saying? If you can't control something, then it's not yours to try to control. You got to allow spirit, allow yourself, allow reality, whatever that looks like to you, to be able to flow. We're here to flow. We're not here to be constricted, restricted, and everything else. We are in a society of disconnection, and that is a crisis in today's time. We're disconnected from the universe. We're disconnected from nature. We're disconnected from each other. We're led to believe that I'm separate from you, I'm separate from you, and you, and you, and you. We're separate. And that's not true because we're only just manifestations and reflections of each other. How? Because when I look out my eyes, I don't see my face. I see y'all, right? So that means everybody in here is a manifestation aspect of me. And when the only time I see myself is when I look in the mirror. And when I look in the mirror, I'm not looking at me, I'm looking at God because God is within. And since God is within, then why do we limit God? You know what I'm saying? What do you want to call it? God, universe, spirit? However, that's what we're looking at because these are the windows to our within souls, you know, and our inner power is that, and inner power is life, right? I don't necessarily like to give titles because titles gives limitations. And one thing one of my godmothers taught me was that to define me is to confine me. I shall not be confined. I am that I am. You know what I'm saying? And when you realize that I'm not calling myself the macrocosm because I didn't create y'all, you know, but I am a microcosm because even the scripture says ye are gods. So if we live in that mindset, if we live in the power that we have given, we have the power, we've been given the power to do, to create, to be, then we'll stop being and we'll just be what we're supposed to do. That makes sense? So people say human beings. What are we being? Being what? You know what I'm saying? We're to be. And so that means I am you and you are me. We be. You know what I'm saying? And that means that when you come to me with the issue, then I can feel you because we're connected through energy, through feeling. Because feeling is the first language, right? Feeling is the first language from the spirit realm to our consciousness. But what happens is we translate that feeling and turn it into emotions. And emotions and feelings are two different things. And emotion is where is energy in motion. So you're supposed to use emotion to push whatever it is that you are desiring to have done in your life. You do it with passion. You do it with that emotion. You do that with that energy. So that way, if you're looking to succeed, if you're looking to be able to heal, you're looking to be able to do whatever it is that you need to do, you're saying it with emotion, and you'll see it manifest. All right. So psychology begins to assist their clients by teaching them that there is no problem, that they are their only problem, and they are their only solution. There's nothing outside of them. There is no one that has done anything to them, nor is there any outside force out to get them, because we are the ones that makes the decision. Like I said, somewhere we said yes. Now, don't get me wrong. There are situations in life, especially if you're a little child, that happens, whether it be some type of trauma, some type of abuse that has happened that you definitely had no control over. I'm not talking about that because we do have therapy that do address those situations, but from the time you know better up until the adult, yes, there is time. We do say things, we do say yes to things that causes us to go through things in life. 10 years later down the road, 5 years later down the road, the the uh, the yes will manifest, right? So, am I still good with y'all? All right. So, understand your mind and spirit. Know the difference between feelings and emotions. Okay, I got a little ahead of myself. The mind is electrical and is the translator, right? The spirit is magnetic and attracts experiences. The brain is a receiver and transmitter, right? I always say the mind is the firmament. When in the scripture, when God created the heavens and the earth and He put a firmament in there, you got the heavens, you got the earth, and you got the mind, which is the firmament in between that filters everything, that filters what is in the spirit realm into the physical realm. Feeling is the first language of communication from the spirit realm. Emotions are the vehicle when used properly to move intentions to manifest. What can a psychologist do for the everyday person who doesn't have mental or physical medical issues? So just to back up, okay. Uh, do we have a question? Oh, okay. Uh, just to back up a little bit, not only will psychology help people with the mental part, the mindfulness part, but it'll also help with the physical part too. People with ailments, basic ailments, or even just main ailments like cancer, diabetes, and so forth, it will help them too because once again, it gives you the power to heal yourself. Just as a small example, when I was a couple weeks ago, I was in a hotel, and we all know this pollen is crazy, and it's just everywhere, and it's just bad for no reason. And so my sinuses was so bad I couldn't even breathe, couldn't do anything. And I'm just laying in the bed like, oh God. And so finally I just decided to just sit, meditate, and talk to myself, talk to my mind, talk to my sinuses, and talk to the information. And I said, look, y'all gotta go. It's time for you to clear out. It's time for you to calm down and leave me alone. I was a little bit more tactical than that, but that's basically what I was saying. And in 10 minutes, it cleared up. It went away. I was breathing. I could sleep that night, and I felt great. Pain. Pain is all pain is blocked energy, right? So you understand where that blocked energy is, whether it's emotional, whether it's stress, or whether it's just somewhere in your body that's uncomfortable, and you just need to be able to just address that. A lot of times, welcoming it. We do a breath technique called welcoming mindfulness. That basically is you breathe in the welcomeness. Basically, in other words, if you're going through an issue and you're 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 mad at me about something, and I know you're mad at me about something, but I'm gonna start breathing, but you ain't telling me that you're just mad, but I know you are, so I'm gonna just start breathing and welcoming that energy, that anger energy into my heart, and just welcoming and welcoming, and all of a sudden you're just gonna start getting hyper and hyper and hyper and just start going off and everything, and all of a sudden you're like, I don't know what happened, but I feel good, thank you. And I just breathed. That's it. I just breathed and welcomed that. That right there, we can do it to others and we can do it to ourselves. There's so much power in healing yourself. There's so much power in understanding your own mind. There's so much power in understanding your own spirit and where it comes from. What you're here to do. My learning of psychology, because my great 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 uncle put me through a 9 month to a year um, uh, study 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 session. So I not only had to read certain books, but I had to live it, right? And so the same way that my uncle taught me is how we teach others. You not only have to read, but it has to be a part of you because psychology, spirituality, any of that is not a fad. It's a lifestyle. And once you actually understand it's a lifestyle, then you can live it and be it. You know what I'm saying? I'm not trying to I'm not trying to just show off, oh well, I know whatever. you know, I have all this knowledge and I have all that knowledge and you hear people saying, "Well, I'm God." Okay, what you manifesting? You know what I'm saying? And so it's like we have to understand that we're more than that. We're more than titles. We are life. We are life expressed. We are life that is empowered, and that is power. We empower each other. And that's the beautiful part about it, right? If you're feeling down, and I come to you and just give you a hug, I come to you and just speak good words, I come to you, that makes you feel good. Knowledge can't do that. Energy can. Love can. You know what I'm saying? And it is not entitled, it is titled by the word love because that's the only highest frequency that we can describe. But love is just the cap. Because one thing about love, if you turn it around, is evolve, right? So instead of saying I love you, I evolve you, because we evolve each other when we help each other. So I'm a I didn't even do my whole speech. But that's okay because I just allow, that's all you can do is just allow spirit to just work, you know what I'm saying? And so I will say that I do have a table um, in the food, I don't know what room is that where we all eat at and so forth. In the tower, in the tower room. I do have a table there. I'm doing chair massages, and one thing I do want to show you real quick is we are offering um, classes. We're offering classes to teach therapists. We're offering the opportunity to be a transcending mind therapy client as well. We also have some products and so forth that we are offering. The classes will begin October 5th, 2026 this year, and it will it will change your life. It will change your life because it has definitely changed mine. And I appreciate you all's time. I appreciate you all, just being here, supporting me to be able to listen. Thank you. I take these with me.
Muy bien, muy bien. Muy bien, muy bien. Muybien, muy bien, muy bien. We're going to spell it in Spanish later on, okay? But Y, the Y is such a long sound. We'll just say like Muibien. You'll understand, okay? It works, promise. Thank you so much, Dr. Nelson, for such a transformative session, for just allowing Spirit to work through you and to say what needed to be said in this time. Thank you very much. Hopefully, we continue the conversations. Now it's time for our favorite time of the day. When I have a recognition, you all say what? I said I have a recognition. I'd like to recognize it's time to recognize all of the healthcare innovators, leaders, organizations whose dedication and groundbreaking work are transforming patient care and advancing the industry. These awards celebrate those with vision, commitment, and achievements, making a lasting impact. Let's give a warm round of applause to my co-presenter, Marissa Mer- Mer- Murgatroyd. Thank you, co-founder, lead strategist, and facilitator of the Experience Group. Now, this is going to be fun. Today we have 48 recognitions to get through, and we're going to squeeze them in 25 minutes as best as we can because you all need to eat lunch. We need to eat lunch, and everyone needs a mental recharge moment, okay? So, that said, if you do not feel like you have to say much, if you don't feel obligated to say any thank yous, you can thank us in your head, in your heart, send it out to the universe. Got it? All right, so what I'm saying is we're going to do our best. Coming up to the stage first, we have Dr. Hassan. Dr. Hassan, are you in the room? All right, come on up, Dr. Hassan. Let's give a first round of applause for Dr. Hassan. Coming to the stage, receiving the Health 2.0 Conference Excellence in Healthcare Award, CEO of Human Care Technologies. Dr. Hassan is a heart surgeon, clinical informatist, and healthcare innovator, a former Navy Chief Medical Informatics Officer and leader of the Joint AI Center. He drives large-scale transformation across medicine technology and operations. Dr. Pitt is the best-selling author of Smarter Healthcare with AI.
Oh, thank you.
That was perfect. I love how we practice this. Next up, we have Lloyd Marks. Are you in the building? Yes. Lloyd is receiving the Healthcare 2.0 Conference and Excellence in Healthcare Award. Lloyd is a founder. Ooh, Lloyd is adventurous. I like this. Okay. He came with a presence. The founder, medical director of MGI Medical LLC, Dr. Marks is an electrical engineer, pediatric cardiologist, MBA inventor, and entrepreneur with over 25 inventions. He also invented atrial septal defect oculator that eliminates the need for open heart surgery. Give a round of applause for Dr. Marks.
So the development of this device took place over decades, so I do have a few people to thank. I'll try and make it quick. First of all, Kelly, to describe the technology to the group. Thank you very much. I want to thank my partners who have put up with me for close to 20 years and continue to fund our development of our project, Mike, Finn, Kurt, and Greg. I want to thank our new CEO, Frank Hanley, who's sitting right over there, for having enough faith in us to join us and help us get this company off the ground. But most of all, I have to thank my parents. My dad was an inventor, but not college educated, didn't have the opportunities I did. And he really has enjoyed watching my career. Unfortunately, he passed away. And then I have to thank my sons, Matt and Mike, particularly Matt, because when I was about to give up on this project, Matt turned to me and said, "How many patients are going to die today because they don't have your technology?"
And lastly, and most importantly, down here, unfortunately, is my wife, who has been putting up with my crap for decades and has always believed in this project and has never complained when I spent money on it. So thank you all very, very much for the support.
Congratulations again. Our next recognition is for Abhishek Kumar. Abhishek, are you here? Come on to the stage. Give a round of applause. Abhishek is receiving the Health 2.0 Conference Excellence in Healthcare Award. Director of IT Solutions at ICONMA, a technology leader with over 20 years of global experience. His expertise spans advanced analytics and agentic AI to enable governed autonomous workflows. A Forbes Technology Council member and 2025 Flex Global Pioneer Award winner for AI adoption, he builds best-in-class enterprise ecosystems.
So thanks, everyone. It's an incredible honor to receive the Healthcare Excellence Award. Uh, as you all can see here with the hand and everything, AI is no longer a buzzword. It's the new heartbeat of healthcare. Okay, right from accelerating life-saving diagnosis to streamlining critical supply chains, medical supply chains, AI has been fundamentally revolutionizing how we heal. But innovation without integrity is not a risk we can take. We must build AI which is transparent, unbiased, and ethical. In healthcare, algorithms accuracy is not just a performance metric, it's a human life. So let's use these innovative technologies, okay, let's use these innovative technologies for the good. Let's build a future where technology really serves humanity. Thank you so much.
Congratulations. Our next recognition is for Dr. Alka Badshah. Dr. Alka, please join us on stage. Yes, congratulations. Health 2.0 Conference Excellence in Healthcare Award awardee, founder and CEO of Anarti Therapeutics, Alka creates science-backed solutions for chronic pain and fibromyalgia. Drawing on her own healing journey and decades of executive leadership, she blends personal experience with strategic expertise to develop holistic products.
Thank you for this honor, the Health 2.0 conference. This is amazing. I did not set out to start a wellness company. I actually set out to set my life back. I was diagnosed with fibromyalgia 26 years ago, and that totally took my life away from me. All the prescriptions had side effects, so I decided to take it in my own hands, and I formulated something plant-based based on Ayurveda, and now I'm happy to say that I have been medication-free for last 6 years, just having my own formulation. When I saw results like that, I thought it was worth sharing that with other people, and that's when I formed my company, Anarti Therapeutics, and people have been seeing some amazing results. So come see me, I have samples, and thank you so much for this honor.
Congratulations again. All right, everyone, just want to remind us we have about 46 more people to get through, 44. So anyone in here want to have lunch? We're going to be fast. Get ready. We're going in alphabetical order. If you know what letter your name starts with, you know you're up next because we're on the A's and we're going to the B's next. Amber Fowler, come on to the stage. Amber, are you here with us? Yes. Amber is receiving the Health 2.0 Conference Excellence in Healthcare Award. She is a psychotherapist and founder of Amber Fowler Counseling. Look at this, people just walking on stage. Love it. A counselor with over 18 years of clinical experience. She specializes in trauma treatment. Amber is known for building rapport quickly and supporting clients with complex trauma through a client-centered, compassionate approach. Any quick words of acknowledgement?
Thank you so much for having me, and I appreciate it. And waking up every day, one thing that helps is I ask for a broken heart, and that has saved me to be 18 years later to be open and my heart open and have some control in it. So thank you for your speaking. I'm very interested to come see you, and it is an honor to be a therapist. It's the best job in the world.
Thank you so much. Our next recognition is for Body Sprout Company Limited. Body Sprout Company, are you in the building? We'll give them a silent applause and keep on. Chaitanya? Chaitanya? Did I say that right? Chaitanya Shravant? Not here? Oh, wait, coming. Come on down. Help me. Say your name correctly, please. I want to honor everyone. Health 2.0 Conference Visionaries Award winner. Now say your name for all of us in the room.
So it's Chaitanya, and I think some reason my parents hated me, so they just named me this. I go by Chatty for everybody else. It's easier to call me.
You're the best. Chaitanya, I got it. Chaitanya, founder and CEO of Circle Health, is a healthcare entrepreneur and transformation leader. In this role, he focuses on improving care coordination and patient engagement through data-driven innovation. Any quick acknowledgements?
First of all, thank you to the conference for this splendid award. Hopefully everybody knows the correct name now. As I said, parents didn't like me too much. So fundamentally, we Circle Health, we are a care coordination company, and we've been doing some good work for the past half a decade or so. Fundamentally, we believe that between a provider and a patient, there is somebody who's required to kind of hold the care, right? Just make sure that what needs to be done gets done. Now, our friends spoke about AI, they spoke about manpower, all of those things. It doesn't matter how it gets delivered, but somebody needs to kind of handle the care over there, and that's exactly what we do. It's a pleasure to be here for the second year, and I can see that the conference has really gone up like 4x compared to what it was last year. So it's brilliant to see the way it's progressed. Thank you so much.
Congratulations again. All right. Our next award winner, and we're going to try this. Well, I'll say the person who comes after so you can be ready closer to the stage. So if Daniel Ruth can be ready, and the next award is for Dr. Chitra. Dr. Chitra, please come to the stage. Dr. Chitra is not in the room. All right. Daniel Ruth, come on down. Daniel, are you in the room? Daniel's not here. Applause. David Karp. David, are you here? David is on his way down. That's right. Come on down, David Karp. Our next recipient will be David Yates. Please be on standby. David Karp, Health 2.0 Conference Excellence in Healthcare awardee, is a seasoned truth whisperer, author and certified intuitive energy healer. He developed the truth whispering system at the convergence of healthy living, mindfulness, spiritual practice, and intuitive energy healing. David empowers people to use tools like muscle testing, pendulums, and focus intention.
Thank you very much for the award. This is my second H2O event. I was at the Dubai event last year, and I'm very happy to be here. The people that are in this event seem to be very focused, very uplifted, and surprisingly, what I've found is that in a lot of the business talks, they're talking about using your intuition. Having a more of a spiritual approach to it to have more success in business. So I've sort of crossed over and started using my intuitive healing skills applied to a corporate business environment. Just like the body needs to clean up its energy, a company also has energies where they're being drained or something's blocking them. And so this can be applied in various different business applications. So if your organization might be interested in it, I'll be around. Come find me. We'll talk. Thank you.
Congratulations again. Up next, we have Dr. David Yates. Come on up. All right. Dr. David Yates is receiving the Health 2.0 Conference Excellence in Healthcare Award. Deb Ghosh and Deepthi, please be on deck for next. David Yates is a chiropractor at God, Health, and Relationships. Dr. Yates was born to serve others. At the young age of 19, he served a 2-year voluntary mission for his church in San Jose, Costa Rica. His primary passion is to become an upper cervical specific chiropractor and views healthcare as the most important service offering.
Thank you very much. This is actually the result of some very clever marketing. by the Health Point 2.0 staff. They knew that the only way to get me to this conference was to give me some recognition, which as a chiropractor in the healthcare field, we don't usually get a lot of recognition. We're probably the most disrespected profession in all of healthcare, but I really feel that what we do is an integral part to a healthcare plan. I had a 5-minute speech planned to give, but in the interest of time and respect for your hunger, I'm going to forego that. You're welcome. All I ask is that you come and sit with me. I'll be here for the rest of the conference. I would love to share with you how important upper cervical specific chiropractic care is to a patient's healthcare plan. Thank you.
Thank you so much, Doc. Deb Ghosh, are you in the building? Deb here? Deb is on the way right here. Excellent. Deepthi will be next. Deb, Health 2.0 Conference Excellence in Healthcare Award. Deb is the Vice President of Data Engineering, BI, and Analytics at Alignment Health, who sees challenges and opportunities to create meaningful impact. He has successfully led cross-functional teams to deliver strategic technology solutions for Fortune 100 companies. Congratulations.
Thank you. Thank you so much. Thank you, Healthcare 2.0, giving me this opportunity to take this award. It's a very privilege to come here and seeing a lot of founder, healer, nurses, and doctors together here. We never been recognized. Data is the backbone of any company, any healing system, or any healthcare. It's a privilege, and I'm very proud that finally healthcare too is recognizing people from data background. I must thank you, my family, my wife, my kids, and my doctors of data. We call them data engineers. I call them, they are the doctors of data. Thank you. Thank you, everyone.
Congratulations again. All right, I'd like to ask the following to be ready for the next awards. Deepthi, Doug, Elnita, and Eric. First up, we have Deepthi coming up to the stage. Let's give a round of applause. Health 2.0 Conference Excellence in Healthcare Award. Deepthi is Strategic Global Project Manager at LabCorp, a global supply chain and procurement leader with over 20 years of international experience driving strategic sourcing, procurement transformation, sustainability initiatives. Currently pursuing a PhD in supply chain management. Yes, get that PhD.
Yeah, thank you, Health 2.0, for the recognition, and hope this is a milestone in my healthcare supply chain career. Thank you.
Our next recognition is for Doug Sparks. Doug, are you in the building? Doug, come on down. Doug is a champion of the 2.0 conferences. He has been here since the beginning. This is one of his favorite conferences, and we consider him family. Health 2.0 Conference Excellence in Healthcare Award winner, Elnita and Eric, if you're in here, come closer to the stage. All right, Doug Sparks is the chairman, CEO, and co-founder of Precision Healthcare Technologies and Precision Value-Based Management, a nationally recognized healthcare strategist. He brings more than 39 years of experience in healthcare innovation, value-based care, and healthcare finance. Doug, congratulations.
Thank you so much. And as always, I'd like to make the statement that of all the things that happen each year, this is the only conference I ever go to. And the reason being it's the only one that actually doesn't bring in the competitors here as cannibalism. You're actually bringing people that can work together. In the words of my friend that runs Google Cloud Healthcare, we are AI generative workflow. We've been building the grading and compliance systems that Medicare and 22 other payers use to grade doctors and hospitals for 20 years. And she says, without us leading the way, your Google Maps with no destination entered. But we may be the air traffic controller, but we're nothing without connecting to you guys. So thank you so much for your collaboration, and thank you for the award.
Congratulations, Doug. And next up, we have Elnita. Elnita Ote, receiving the Health 2.0 Conference Excellence in Healthcare Award. Let's give applause. She's a licensed clinical mental health counselor at Elnita Ote and Associates Counseling and Consulting Services. She's a trauma-informed therapist, speaker, and mental health leader advancing accessible evidence-based care. So many more recognitions. Please check out everyone's bios. Congratulations again, Elnita.
I'd like to thank Health 2.0 for recognizing me with this award. I'd also like to thank my family for all of their support. I'd like to thank my husband, Lundy, and my family who always support me in my endeavors. Thank you.
Congratulations. Eric Harris, come on over to the stage, receiving the Health 2.0 Conference Excellence in Healthcare Award. Gavin, Jennifer, Julie, come closer to the stage. Eric Harris is the founder and CEO of Canary MedTech. He brings over 20 years of product strategy and systems innovation experience, including work at NASA, the U.S. Army Materials Command, and Microsoft's Copilot team. Today, he focuses on the intersection of health equity, data infrastructure, and independent living. Congratulations. He said, thank you. I love it here. Gavin, come on to the stage. Gavin, are you in the room? There you are. Come on up. Gavin Quinn, CEO and co-founder of U.S. Health Center. Oh, no, wait. Gavin is not here. I'm so sorry. Jennifer, Dr. Jennifer, come on up. Thank you so much, Dr. Jennifer, for hearing Dr. Coldry. Dr. Coldry receiving the Health 2.0 Conference Excellence in Healthcare Award. Dr. Coldry is the founder of Soul Echo Therapy, integrates music, neuroscience, and hypnotherapy for emotional healing. She is a certified hypnotherapist, IEMT practitioner, and EMDR trained clinician. Any words of recognition?
Thank you. I would just like to thank my partner and also my husband, Dr. Deal. We're part of the Doc Hypnosis Wellness Center in Phoenix, and we do clinical sound therapy, hypnotherapy, and other modalities. So if you're in Phoenix, please look us up. We'd love to say hi.
Thank you so much. All right, coming up next, if you hear your name, Julie, Carmen, Kezia, Kathy, Casey, come closer to the stage. Up next, we have Dr. Julie Tran Olive. Are you here? Coming to the stage. Congratulations. Dr. Julie is receiving the Health 2.0 Conference Excellence in Healthcare Award. Founder of Silicon Valley Natural Health, Dr. Julie is a licensed naturopathic doctor and acupuncturist dedicated to integrative, patient-centered care. She blends Eastern medicine with evidence-based Western approaches to address root causes and support long-term wellness. She's also won an International Impact Book Award for her book, Acupuncture Awakenings.
I'd just like to thank my friends, family, and of course my patients who made this award possible, and my husband Doug out there who's supposedly taking pictures somewhere.
Congratulations. Thank you for all the partners and all the friends supporting your people up here. Carmen Reeves. Carmen? Yes, welcome to the stage. Congratulations. Carmen Reeves Jenkins, LISW S Health 2.0 Conference Excellence in Healthcare Award. She's the founder and CEO of INR Healing for Abundant Living. She's a retired Army officer, licensed clinical social worker, certified abundant living coach, empowering women of color, veterans, and mothers to build strategies for living abundantly. Congratulations.
Thank you. I just want to thank everyone here in the room for all that you do. I have been in the medical field since 1978, and I love it still. And what I purpose to do is to empower every woman to live out their life purpose abundantly.
Congratulations again, Dr. Keisha Hein-Peters. Dr. Keisha's in the building, on the way. Congratulations. Give a round of applause. Founder and CEO of Abante Scientific, Dr. Keisha Hein-Peters is a best-selling author, speaker, and expert in launching pharmaceutical and medical device innovations. She founded Abante Scientific in 2022 to bring life-changing solutions to the global market. Congratulations.
Thank you so much for the award. And again, I'd like to congratulate all of us. I think what we do is amazing, and we do it for the better patient outcomes. I hope we'll continue doing this. Thank you.
Thank you so much. Kathy, Casey, Kosha, all come to the stage. Approaching nearby, Melissa, Michael, M. If your name starts with an M, come close to the stage. All right. Coming up next, Kathy. You told me this. Miguel. I had to remember. I know we spoke weirdly. Kathy Miguel. Give it up for Kathy. Kathy McGale, health and life coach, business strategist, and legacy builder, and founder of Today Forward Consulting, is a fifth-generation farm girl whose agricultural roots inspire her farm-to-table approach to health, life, and business. Kathy believes every day is a chance to choose health, growth, and yourself and move forward with strength and purpose. Congratulations.
Thank you. So yes, my last name is Miguel. Looks like Michael with two E's. Table for four from Michael, that's me. Anyway, thank you so much. As a generational farmer girl and the first girl born to the Schnetzer family in over 90 years, I've been a trendsetter. My husband is here with me, and I am very thankful for the clients that I've had in the past, continue to work with them, and I'm looking to grow my business globally. See you at the 3 o'clock panel.
Congratulations. Up next, Casey Collins. Dr. Casey Collins, come on to the stage. Dr. Casey, are you here? All right, applause for Dr. Casey. Dr. Kosha Thakur. Dr. Kosha Thakur, lead clinical EMR implementation specialist at NYU Langone Health. Dr. Kosha Thakur specializes in healthcare technology and medical information management. She spearheads systems innovation to drive patient experience and champion the journey to recovery. Congratulations.
Thank you to Health 2.0 for inviting me and for this honor. Thank you to God, my family, friends, colleagues, and well-wishers here and in spirit for your love, guidance, and support. And to all of you here, thank you for being here. Thanks.
Congratulations. Up next, Melissa Pickersgill. Melissa, are you here with us? Melissa's on her way up. All right, Melissa. Melissa is the founder and owner of the Brain Hack Cafe by Emotionally Rewired LLC. Melissa is a multicultural counselor and trauma-informed mind-body psychotherapist. She works extensively with neurodivergent individuals, including those with autism and ADHD, adapting therapeutic tools and psychoeducation to make them more accessible and practical for neurodivergent minds. Congratulations.
Thank you. Thank you again for this recognition, Health 2.0. Back during the pandemic, when I tweaked a lot of the mind and body psychotherapy tools for my kids with autism to be done online without me being able to see them, to be safe, I had no idea they would evolve into what I call today brain hacks that are actually emotional nervous system regulation, calming my verbal and nonverbal clients very quickly, decreasing violence. And also, I have a 2-hour rewire that's actually stopped SI. So thank you so much for this recognition, and good day.
Thank you. Congratulations again. Love the butterflies. Michael Cardamone. Michael, are you here? Applause for Michael. Michael Hildebrand. Michael Hildebrand is coming to the stage. Michael Hildebrand is a 26-year-old entrepreneur and fitness professional, the owner and CEO of CrossFit Bolster in Ferndale, Michigan. The owner and head coach, Michael specializes in CrossFit, conditioning, athletic development, and mindset training by crafting programs accommodating people of all fitness levels. He is dedicated to helping members move better, grow stronger, and live healthier lives in a supportive, team-oriented environment. Okay, thank you. Lawanda. Lawanda, are you here? Come on down, Lawanda. Lawanda Sanyak, she's the founder of the Beauty Bar presented by Lala Faces. Lawanda is a licensed esthetician and instructor with 10 plus years in business. A community catalyst, she mentors students and provides local education. Health tech pioneer, Lala embeds AI-driven dermoscope analysis and practical AI workflows to deliver precise data-informed treatment plans. Congratulations again.
Thank you. So I'd like to thank Health 2.0, my family, and all of my clients who come out because skincare is healthcare. And one of the things I really focus with them is that your skin is your biggest organ on your body. It's so important to take care of it. So I really focus on innovation with AI technology, restoration, restoring the skin, and elevating them. So thank you.
Thank you. Lisa Miller, Lonnie, Melissa, if you all can approach the stage. Zoli Monica, Neha, Nicole, Pamela. All right, our next recognition is for Lisa Miller. Lisa Miller, you here? On the way. Come on down, Lisa Miller. Lisa Miller is a licensed mental health counselor and the founder of Thrive and Nourish Counseling Center. Drawing on years of experience in trauma recovery and mind-body integration, Lisa supports individuals in creating sustainable change. Her innovative work in bridging mental health and nutritional wellness has earned her recognition for advancing whole person and promoting mindful, balanced living.
Thank you. Thank you, everyone here and Health 2.0. A quick thank you to my family and clients that make this all possible. I love what I do, and I'm so grateful I get to do it.
Congratulations. Thank you. All right, Lonnie Fagel. Lonnie, come on to the stage. Fagel, thank you. Lonnie Fagel. I appreciate it. Lonnie Fagel is a licensed professional clinical counselor, EMDRIA, approved consultant, speaker, author, and educator at Lonnie Fagel Training and Consultation LLC, specializing in trauma, grief, loss, and complex medical experiences. Congratulations.
Just thank you, and thanks for having me.
Thank you, beautiful. That was honest. Melissa Adwell. Melissa's on her way. Congratulations, Melissa. Melissa Adwell is the founder and CEO of the Mental Health Moment, a nonprofit dedicated to reminding people they are never alone in their struggles. A graduate of UNLV with over a decade of nonprofit experience, Melissa combines her skills with her deep passion for mental health advocacy. Congratulations, Melissa. Approach the stage. Zolly, Monica, Nia, Nicole, Pamela. Thank you. Zoli Monica, are you here in the building? Yes. Did I say that okay? All right. Master Zoli Monica Ferragutti is a teacher at Zolemic Estrella Formation with a deep commitment to holistic health and transformation. Monica focuses on helping individuals align with their purpose, elevate their mindset, and embrace a more balanced and meaningful life. Through her work, she continues to create impactful spaces that support healing, self-discovery, and overall well-being. Congratulations.
Thank you so much for the conference. I loved it. And I want to thank my teacher, Master Solem Estrella, who trained me in 5 different type of Reikis and in the therapy tech LSR that raised the consciousness of my practice into integrating all aspects of energetic medicine into the Western medicine. Thank you so much.
Congratulations. Thank you. Neha Shah, are you here? Welcome to the stage. Congratulations. Applause for Neha. An integrative nutrition practitioner and the founder of Diaspora Nutrition, Neha Shah brings homestyle nutrition care for immigrant Indian families in the U.S. Recognized as a Fortune Leadership Woman Under 40 honoree for her outstanding contributions to preventative nutrition solutions, Neha has reshaped the health journeys of countless families, making her a trusted voice in immigrant wellness and a prominent advocate of cultural heritage. Congratulations.
I would like to dedicate this Health 2.0 honor award to my traditional wisdom from where I belong. I belong to Indian civilization, which is the oldest and the largest and the most diverse I could ever see. So thanks to my ancestors that even after so much invasions and colonization, we have not left our roots and we will keep continuing living it. Thank you.
Next recognition, Nicole Broderick. Pamelia, if you want to come to the stage following Nicole. We have Pamelia, Patricia, Patty, Ria. Nicole is the owner and founder of Innerloom Healing and a holistic health practitioner specializing in nutrition response testing. She's dedicated to helping individuals uncover the root causes of their chronic health challenges through personalized nutritional protocols and whole food supplements. She helps clients restore balance, regain energy, and support the body's natural ability to heal. Congratulations.
Just want to thank Health 2.0 and also everyone for being here today. Seeing all the different types of clinicians speak about integrity and intention, whatever the mode of communication, whether it be AI and the forward thinking of that or our traditional roots. I believe that we're all here to peel back the layers and give back what we need, which is natural healing. I'm super appreciative. Thank you.
Congratulations. Thank you so much. Pamelia. Is that how I say it? Pamelia? All right, not in the building. Here we go. Next up, do we have Patricia Martinez? Patty Milligan. Patty, congratulations, Patty. Come on down. Dr. Milligan, the founder, you okay? Dr. Milligan is the founder of Gold Time and founding member of Sprouts Farmers Market, has 41 years of nutrition expertise. For 18 years, she has led high-performance nutrition programs for global executives and serves on the board trustee for the Southwest Center for Naturopathic Medicine. She holds a doctorate in the neuroscience of taste, specializing in saliva's impact on regeneration nutrition. Congratulations, Dr. Mulligan.
Oh, thank you so much. And I'll echo what all my colleagues have said. All of you are dare to disrupt this healthcare system, and it just really inspires me. And lastly, I have goal time, a travel resilience, because I wanted to disrupt the travel industry and bring joy back to traveling. So I have samples of the goal time supplement over at the table. Come and enjoy. Thank you.
Next up, we will be having Richard, Rita, Roxanne, Sheila here in the building. Come to the front. Shravan, Taiwana, the garden recipe. First, we have Raya.ai. Raya.ai, come on up. Based in Silicon Valley, Raya Health Incorporated is a pioneer in AI health tech firm revolutionizing the longevity and lifestyle medicine sectors. Unlike traditional episode EMRS, Raya's real-time architectural utilizes AI agents to automate continuous member engagement, allowing clinics to scale efficiently and reducing churn. Congratulations.
Well, I just wanted to thank my team in Bangalore that helped build this awesome product and my customers, investors, and partners. Thank you very much for believing in us. We built the first AI agentic system for connecting longevity and AI together. So we're really excited about our future. So again, thank you very much to Health 2.0.
Congratulations. Richard Winter. Richard, are you here? Richard is, we'll celebrate later. We'd like to recognize Rita Brewer. Rita, come onto the stage. Congratulations, founder and CEO of Rita Brewer Consulting. Rita is a board certified physician associate with 34 years of experience. She is a diplomat of the American College of Lifestyle Medicine and a distinguished fellow of the American Academy of Physician Associates. Rita practices evidence based lifestyle, obesity, and functional medicine in Raleigh, North Carolina.
Thank you so much, everyone. I just want to give God, of course, all the glory and honor in my life. He's the shining light of my life. I want to honor my husband, Rob, my daughter, Jasmine, my church family, who are always encouraging me to share my passion with the world. And now here on a global stage, it's amazing. Thank you so much, Health 2.0, for acknowledging me. I feel like I'm representing all metabolic health practitioners around the world. I truly believe metabolic dysfunction is the true pandemic of our time. The rates of obesity in America have gone up by 2,000% over the past 40 years. Americans are 75% overweight, almost 45% obese, and we can do so much better. The rates of type 2 diabetes globally is over 357 million, and it's projected to double by the year of 2045. So we need to do a lot better. We deserve better. Our patients deserve better. And I just want everyone to be focused on this situation. And just lastly, I just want to thank all my patients and clients. You guys are amazing for trusting me with walking this journey with you, and all the work that you put in to transform your health is truly inspiring. And I love you guys. Thank you.
Congratulations. Friends, we're almost there. We only have like 7, 8 more people. We got this. All right, Roxanne Smith, are you here? Roxanne, come on down. Applause for Roxanne. CEO of Lemurian Healthcare. Dr. Roxanne A. Smith is an experienced physician, healthcare leader, and life coach with experience in epidemiology, global health, and healthcare management. She also leads the telemedicine division at Clinical and Herbal Innovations, integrating holistic and clinical approaches to enhance patient care. Her global initiatives in Haiti and Kenya have supported multidisciplinary medical training and community health services. Congratulations.
Thank you. I'd like to thank, first of all, my foundation, Jesus Christ. After that, everything is easy. My colleague, Leilani, is here, and she came all the way from Texas to join me here, and I'm thanking you for that. For ELF 2.0, thank you for the recognition because I appreciate the fact that you look at a different side instead of the typical side, and your energy as the hostess with the mostest has been refreshing. Um, my colleague that was just up here, it was great to see her and to have her speak about metabolic health. I approach that same topic with food. Food is the future of medicine, and I'll be speaking on that a little bit later on. But for us to understand how to manage our magnificent bodies is my calling, and I'd be happy to share it with anyone. And for physicians who want to come onto this side, I'm also health coaching and life coaching physicians who would like to transform their life through spirituality, science, and coherence. Thank you again.
Thank you so much. Thank you, Roxanne. Coming up next, we have Sheila Shravan Taiwana, the Garden Recipe, the Trauma Academy, and Tom and Victor. If you're in the building, come on to the stage. And up next, Sheila. Where is Sheila? Sheila Warnock. Come on down, Sheila. Congratulations. Sheila is the founder and CEO of Share the Care. By 2003, after 2 decades of personal caregiving experience, she abandoned her advertising career to establish a nonprofit to take grassroots philosophy to a new level with the second edition in 2004. As a speaker, storyteller, and trainer, Sheila has touched the lives of hundreds and thousands of caregivers, concerned friends, families, and community groups and health professionals throughout the US and Canada and beyond. Congratulations, Sheila.
Thank you so much. This is a fantastic conference, and I'm very honored to have this award from you all. And I found it so interesting to hear the perspectives from the different professionals here. I have taught professionals about Share the Care. It's called our seating Share the Care in your community because Share the Care is it's a plan on how people, instead of saying, let me know what I can do to help or call me if you need me. It's a plan on how to organize into a fantastic caregiving team of friends and neighbors who don't know each other. But by working together and sharing the workloads, they learn and work, and it's life changing. And I just want to thank all the caregivers and caregiving groups in 21 countries. That's how far it has spread, mostly word of mouth. So thank you.
Congratulations. Up next, Shravan Kumar Nidiganti. Shravan, congratulations. Oop, let's wait for Sheila to come on down. We can still give them applause. Give applause to everyone. Fantastic. Shravan is an enterprise quality leader of benefits and clinical operations at CVS Health. He has over 2 decades of experience spanning IT, safety critical systems, and pharmacy benefit management. A doctoral candidate and scholar practitioner, he is committed to improving access, safety, trust, and affordability. Congratulations.
Thank you. Honored to receive this award at this stage, and thank you to all my family and friends, mentors and leaders who support me in driving me, and now the Health 2.0 conference driving me towards healthcare quality and providing healthcare accessible, affordable, and predictable. Right. So one thing I strongly believe is healthcare quality is a mindset more than a skill set. So that's the reason, as a healthcare professionals and subject matter experts and also leaders here, we are more important than ever. So with the kind of transformation happening in healthcare sector, with AI coming in, and this is more responsibility for all these subject matter experts to keep the transformation ethical and also make sure that we are providing the members or patients best care possible and make it that's what I thank you.
Congratulations. Dr. Tawana. Dr. Tawana Houston, welcome. Congratulations, Dr. Houston, founder and CEO of Black Cell Consulting. Dr. Houston is a licensed naturopathic physician and leading expert in health equity and chronic disease prevention. She is a recognized thought leader in cultural wellness and former adjunct instructor in medical DEI. Dr. Houston is also the best-selling author of Black Wellness Barriers.
Thank you. Giving all gratitude to God who expresses in, through, and as my life, to my ancestors, to my Broham Wade for traveling in to support me on this day, and to the Health 2.0 conference. Thank you for this recognition. In my combined roles, I strive to reduce the chronic disease vulnerabilities within the Black community by raising more awareness on the historical factors and the structural inequities that contribute to just more elevated chronic stress that leads to the health outcomes that we see. And this is terribly important, especially at such a time as this when the history of our ancestors in this country is being intentionally watered down and erased. And I am here to just let the world know we cannot heal what we refuse to acknowledge. And I'm doing my part to change that. Thank you.
All right. The garden recipe. Do we have the garden recipe here? Garden recipe, come on down. Come on down. Also be ready. The Trauma Academy, Tom, Chiap, Victor, and Gavin come closer to the stage. The garden recipe was launched after Samyata realized that a pure plant-based diet lifestyle changes and plant medicine offers a superior path to healing. She founded the platform to share these truths globally, providing exact recipes and resources through her YouTube channel, website, articles, and weekly newsletters. On behalf of the organization, Samyata Saxena, the CEO and founder of the firm, is present to receive the award. Congratulations, and thank you for sharing your story with us today.
I just want to say if anyone needs any support for cancer or inflammation, come and find me. I run programs for women's holistic health. It's a 12-week program, and you can check out my website. But for the next day and two till tomorrow, I'm here. So come and join me for lunch or come and ask me any questions, and I would be happy to help you in any way I can. All right. Thank you so much.
Congratulations again. Do we have the Trauma Academy Northwest in the building? The Trauma Academy Northwest, congratulations. Began in the summer of 2015. No, that is not it. Okay. The Trauma Academy Northwest, are we here? Do we have the Trauma Academy? Oh, no? Okay. Tom Chiapata. Is Tom here? Tom, did I say your last name right? Correct me. All right. Tom is president and founder of Good Sports Solutions, LLC, a consulting firm he started in 2006 that provides marketing, communications, fundraising expertise, event planning, and celebrity securement for the sports philanthropy community. Congratulations.
Just like to thank everybody for us to be able to be part of this great conference. Also, should say conferences because I did have an opportunity to speak on an education panel and met 5 like-minded people from around the country and made friends. So I know I'm walking away with that. Having a small nonprofit in Connecticut to be recognized here for the 20 years of work that we've been able to do in our communities is really something special. And it will help us with this endorsement to be able to let people know that the next 20 years, hopefully we have, will be there'll be more to come. Thank you very much.
Congratulations. Victor Panev. Victor, are you in the building? Come on to the stage. Congratulations. Victor is the founder and CEO of Edamame and a seasoned serial entrepreneur, mentor, and investor in food technology. Prior to Edamame, he co-founded and sold Bulgaria's largest internet company, NetInfo BG. Congratulations.
Thank you. Gratitude is felt alongside hunger, so it's time to go eat. And if you believe food is medicine, come join me for a bite.
Thank you. Our next recipient is Gavin Kinneys. Gavin, come on to the stage. Gavin? Yes, thank you. Gavin is the CEO and co-founder of US Health Center, and PredictImed is a pioneer in predictive analytics with over 35 years of experience. Gavin advises health systems and employers on strategies that reduce costs and improve quality of life. He leads efforts to identify disease risk 3 years before diagnosis by integrating medical, genetic, and lifestyle data.
Well, 25 years ago,
25 years ago, we invented what might be the first version of predictive AI. Since then, we've served nearly a million people, 948,000 to be exact, and saved 67,500 lives. I'm here to tell you there's absolutely no reason for surprise diseases. Cervical cancer, endometrial cancer, heart disease, depression, unforeseen surgeries. That's really a cultural challenge and a way that we compensate our providers. We have busted that model through inventing different kinds of health plans, rewarding people and providers for preventing disease, compensating them. So with God's grace, we've been recognized, frankly, more than any organization in the health and wellness space. That is a great value to our team. They've been working hard, 80 people in all 50 states, most North America and across the world. So with God's blessings, I thank you.
Congratulations. And our final recipient recognition, thank you everyone who has been here celebrating all of our award winners, Dr. Arpit Patel. Dr. Arpit Patel, please come to the stage. Congratulations. A board certified cardiologist, healthcare innovator, and founder of Pulse Perfect LLC, a preventive cardiology longevity practice transforming how cardiovascular care is delivered. He specializes in shifting medicine from reactive treatment to proactive optimization through advanced imaging, genomics, and Dr. Patel works with high performing professionals and individuals with elevated cardiovascular risk, helping them extend life.
Thank you so much. Thank you so much for this honor. I want to thank and dedicate this award to my family, friends, mentors, and patients who have believed in me. I also want to thank Health 2.0 for recognizing this achievement. And I believe this recognition is my work shifting traditional reactive cardiovascular disease and management to more preventive, proactive cardiovascular management and changing patient outcomes with evidence based care. Thank you.
Congratulations. Thank you so much, Marissa, for your support. Thank you to the team and everyone. Please enjoy the remainder of your break. We will see you back here at 1:30. Please feel free to bring your lunches here. If you don't finish, if you need to bring your snacks, whatever you need, this is our room, our family. Thank you, everyone. See you shortly.
So, hey, 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 1 2 2 2. So you've got channel one. Don't have a lot of gain, but it's working. 1 2 2 2 2. Okay.
Check, 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 check. 1 2 3 4. Check, check. 1 2. All right, sounding good. And I'm pulling away from the mic a little bit. 1 2 3. Check, check. 1 2. 1 2 3. 1 2. Did you already have your lunch? 1 2 3. Oh, you brought your lunch. Okay, 1 2 3. 1 2. 1 2 3 4 5 6 7 8 9. Whoa, look at that. I'm ready. I'm ready for showbiz.
Ten, 1 2. That sounds great. So yeah.
See a little fuzzy brooch that I have on. Ha ha ha. Okay, we're in business.
If you're a walker,
I am a walker.
just stay behind the speakers.
Okay. Or it's gonna go.
It could.
Okay.
It could. Wait, it'll whine at you. At us.
Okay.
So I'm gonna mute you now.
Okay.
Check, check, 1, 2. Check, check, 1, 2. Testing, 1, 2, 1, 2. Huh? We're about to. I'm changing. I'm giving you 9.
9? Okay.
Now, do you want me to get those other 2 mics on
Yes.
speaker stands? That
Yes.
way you can direct them to go ask their questions because no one was hearing the questions.
Yes, that would be great. Yes.
Okay.
Yeah.
Right. Okay.
You're the best. I appreciate you.
Okay.
When I say buenas, you say tardes. Buenas. Buenas. It's still buenas tardes. Buenos dias is good morning. We're going to say good afternoon. Hi. Buenos dias, buenas tardes. Thank you, everyone, for being here present. We know some folks are going to be trickling in as lunch just ended. Thank you, everyone, for your flexibility, for your presence, your energy. We are going to do our best to stay on target with our schedule. Any sessions that might go over, we'll do our best to just adjust. And then we have quite a few recognitions for the evening. So we have a full day. Really excited for what comes next. Now that we're settled, let's begin the next round of sessions. The keynote that we have coming up next is titled Beyond the White Coat, a CEO's practical guide on grieving, sustaining, and well being. It brings attention to the emotional and mental realities that come with leadership and responsibility, and how individuals navigate loss, resilience, and well being along the way. Please join me in giving a warm round of applause to our speaker and bronze sponsor, Dr. Joanne Schaefer, President and CEO of Serve Healthcare Consulting and Coaching. Joanne will share her expertise and experience, passion about executive coaching consulting, committed to helping leaders thrive and create lasting patient-centered change in the healthcare system. Welcome.
Thank you so much. Okay. There's supposed to be a clicker up here. Is this the clicker?
That is correct.
Okay. Ah, 2 buttons on it. That can't be that hard, right? All right. Well, I'm in everyone's dream spot of speaking right after lunch. So that will be fun. But we're going to have fun. And this will be, even though it's kind of a sad topic, it's going to be energizing. And I'm going to leave you guys with some real practical tips. Can I get, by a show of hands, any physicians in the audience? Okay. Any healthcare leaders in the audience? Okay. Very good. Any nurses in the audience? Yay! Our daughter's a nurse, so special love for nurses. All right, let's get started. So I wanted to talk a little bit about the burnout in healthcare. I know we had a panel earlier this morning, and if you were able to attend it, who attended that panel? Raise your hands. Okay, so a few of you. This is not repetitive of that. This is a little bit more deep into the weeds, some evidence-based strategies. My evidence is taken from the NIH, National Institute of Health, and the Journal of the American Medical Association. They were studies gathered and taken from the general population of what's happening in the United States today. So that's where the evidence comes from. And the strategies that I will give you and the things to think about come from a real boots on the ground experience in hospital systems, in large clinics and small clinics, rural and urban. So there you have it. Where do I point this to get it to go? Aha. Point it at you. I'm pointing. There we go. So the state of the workforce right now. So I didn't hear a lot of like general statistics this morning, and I'm glad I put them in. And I would never expect everyone to be able to cover the whole scope of everything in one talk. I won't do it. They certainly couldn't do it this morning in their panel either. They did a fantastic job though. So I wanted to just mention that about 45% of US physicians report at least one symptom of burnout. Burnout peaked during the pandemic at 63%. 68% of nurses report burnout symptoms, and over half of the workforce is considering leaving their jobs. This is why it's a crisis, and this is why it needs so much attention. Okay, I'm gonna have to make friends with this little guy. Again? Okay, where's the magic spot? Okay, nope, still didn't do it. Can you be my clicker? Okay. Either that or you're gonna have to be my clicker. There you go. The new magical clicker. Okay. Back on task, here we go. Okay, so what's driving burnout? These are things that you probably already know. Staffing shortages, administrative and documentation burden, lack of control over the workload. Things just keep coming and coming and coming. After hours work of what we call pajama time. So you go home, you eat dinner with your family, and then you log back on the system and you start doing the charting, the real charting that has to get done for the patient encounters that day. Inefficient technology and very chaotic work environments. Burnout reflects system design problems, not people problems. That's a key message that I want to get through today. The hidden burden of grief. Healthcare workers experience frequent exposure to patient death and suffering, moral injury when systems prevent optimal care. So the pre-auth that didn't come through in time to give the patient the life-saving drug that was needed. The inefficient staffing mechanisms that prevent really good care being given at the bedside, and the physicians and the nurses know it. Emotional suppression to maintain professionalism. This one I heard loud and clear, and I experienced it myself as a physician. I'm a family physician by trade and practiced for many years in an academic professional setting. And so, you know, you go from a tragic death in one room, and then you have to button it up, suppress it, and go back in and help the very happy couple in the next room that just welcomed a child into the world. They don't deserve to understand the trauma that you just dealt with in the previous room. So we get really good at emotional blocking, suppressing. That's not necessarily good for our overall mental health. And then secondary trauma for crisis care. So clinicians often carry cumulative grief without structured support. Oh, come on, clicker. Okay, the organizational cost. Physician burnout costs the United States healthcare system billions of dollars annually because turnover and recruitment cost. It costs between $1 and $1.5 million to replace one physician. That is an incredible costly thing. And we focus on the physicians because they're so incredibly costly. But there is a cost that's associated with replacing nurses on a continual basis, or having the cost to hire staffing agencies to refill nurses that come in to do the nurses' jobs when the nurses quit. Reduced productivity. We talked about this today earlier in the panel discussion. Increased medical errors for sure. When people are burdened, they might be present, but they're not present. I think everybody understands what it means to be checked out of a job. When you are checked out, you make mistakes. And who wants to go to a physician or have a nurse take care of you when they are checked out? It's not good for our system. It's not good for our health. And as you heard the Lieutenant Colonel speak this morning, it can affect our national security. And of course, there's lower patient satisfaction. Who has ever experienced medical care that has not been the best? I mean, raise your hand. Everyone's had an experience that is, you've been taken care of by someone who's just not in it anymore. And you've seen that over half of the healthcare workforce, that's across the board, counselors, psychologists, nurses, physicians, they're ready to leave. So we have to do better. What is actually working? So here's the evidence-based practices, the things that we know that are working to help sustain our workforce. Peer support programs, real peer support, not somebody else working in a different field coming in and talking to somebody working in a different field. We know it's important to have peer-to-peer interactions because if you're in that field, you understand what the other person is doing to work so hard in that field. So when you start to talk and do peer support with one another, there's a whole lot of, they don't have to explain their job to you before you understand what's happening. So that's why peer support is so important. Leadership and workflow redesign. A lot of folks could learn how to redesign workflow. Leaders can help people do that if they just spent a little time with the people that are in the field. So the boots on the ground, they know what's wrong with the workflow if leaders just took time to listen to them and help redesign the workflow. EHR workflow improvements. The electronic health record, I encourage leaders and I encourage teams to consider that EHR as a team member. And if that team member isn't doing their job, they need to step it up. In other words, the EHR needs to be optimized so it functions as well as any other member on the team. So there's a case manager, there's a nurse, there's a physician. That EHR is just as valuable on that team as everybody else. And if it's not working well, they need to swarm around the problems and make that work just as well as any other team member. And then, of course, AI-assisted clinical documentation, that is making things better. But as we heard yesterday, it needs some guardrails. We need to be careful. We need to be intentional. But for the systems that have embraced it and allowed it to come to fruition in the ways that it can improve medical care and improve documentation in a way that takes the pajama time out of the game, it has been very helpful, and the evidence has borne that out. So system level solutions reduce burnout. What clinicians say they need, primarily nurses and physicians, they need adequate staffing, reduced administrative burden, efficient technology. They need to be valued by leadership. And this isn't a hard thing to do. Greater control over the workflow. So recognition and support strongly influences retention. So sustaining the healer. Leadership strategies, if they could normalize the conversations around grief. And this is something that's near and dear to my heart. And if you've seen me at my booth, I'm the one out there selling this book on grief, and we're going to talk about that for a second. But this is from some of my experiences in healthcare, personal, and then I interviewed a ton of people about their experience of loss. But normalizing the conversations around grief are important in healthcare, so we don't compartmentalize and move on to the next patient. That grief will come out at some point. And in part of my job, part of my career path was to be the chief medical officer of the state of Nebraska. Part of my roles there, as well as safety net programs, disease investigations, outbreaks, and that. I also regulated the healthcare system. So from hospitals, nursing homes, surgery centers, to anybody who carried a license. We were responsible for um, taking licenses away, suspending them, getting them into rehab, whatever, because there was a lot of substance use. But when you looked back in the cases, sometimes you found physicians, nurses, um, you name the gamut of a licensure, they had long suffered issues that were not dealt with. Issues of grief, issues of things like divorce, things that happened in their life where they hadn't sought out proper help. And it led to a substance abuse issue that led to something happening in their career that got them in trouble with the licensing board. And then they lost their license or they had their license suspended. And I just think that if we had more supportive ways and more actual conversations about talking about grief in the workplace, maybe some of those things wouldn't have happened. So on that note, we created a peer support program in Nebraska called LifeBridge. It right now is only for physicians. We hope to expand it to nurses in the future, but right now it's about 6 years old. And it is free coaching to any physician in the state of Nebraska at any level. So once they become a physician at any level, they can seek free coaching. I'm the medical director of that program as well and a coach. I went off and got certified in coaching. The reason why we did this is we were having too many physician suicides. And it was really starting to impact our physician colleagues. Things that had gone way too long, we had lost too many, and enough was enough. So we started it emergently during the pandemic, although we had been planning it for the year prior. So we started about 6 months too early when the pandemic hit. And this is a true peer-supported, all the coaches are physicians, and it is supported by some of the people that cause physicians the most grief, like the insurers. So they actually contribute money every year. The hospital systems contribute money every year. And then we have other people that contribute money that support the program. And it has a 1-800 number that can call in. It is anonymous. Nobody ever knows who calls the program except for the coaches. We are given a number to identify them for demographic purposes, and they are allowed to call us. And then we give them unlimited coaching time. But most people wind up using about 4 coaching. And then we have connections with psychologists and psychiatrists if they need mental health counseling. But we've put that in a hope that by having physician to physician coaching, that we'll be able to curb some of the issues that we've seen in our state. And it has been working. We have touched the lives of many physicians. And the one thing that we did extra special in our program is that we got it protected under statute. This is key for physicians, particularly, and we imagine it will be key for nurses too if we can expand the program. So every physician that calls, it is truly a safe place. In statute, it is protected so that it's not discoverable. What every physician talks to me about, no attorney can have access to. It is non-discoverable, non-subpoenable, and is 100% a safe place. It is the only place in the state that they can talk confidentially and it not ever be discovered. That is healing for physicians because most of the time they just need to get something off their chest. They had a near miss. They had a bad case. They didn't get sued from it. Sometimes they do talk about their lawsuits because they're heavily burdened by them. They know that something went wrong. There may not even be any guilt associated with it, but their hands caused something to go wrong, whether it was surgical or writing a script. And the burden of that they went into medicine to heal people. They did not go into medicine to hurt anyone. And the burden of causing somebody pain weighs them to the point that they commit suicide sometimes. So just to wrap that part up about our program called LifeBridge, it It is one of the things that we know is evidence-based. It does work. It is very helpful, and we have been enjoying the success of that program. And it's one thing that you do. If anybody wants to talk about that program and bring something like that to their state or to their community, please let me know. So reducing clinical burdens is another thing. Making sure that you're obviously properly staffed. Invest in supportive leadership training so your leaders know how to take on the role of supportive leadership. And then build cultures of respect and recognition. This is so important. People need, not everybody, but most people need to know they're doing a good job and have it be meaningful, not a just, hey, great job. They want to know that they did something that mattered. They don't need to hear it every day, but once in a while, a meaningful, great job. I saw you, I saw what you did, and it mattered. That can go so far for people to be motivated to work a little harder, get up the next day, and come to work. It's not hard, but leaders need to know that they need to do that. And then the leaders need to be told by their leadership that too, because the leaders, they're often getting nothing but negative all day long. They're the cheap problem solvers, and sometimes they need their bucket filled a little bit too. So at the end, human sustainability must be a leadership priority. So back to this book that I'm selling out there. I wrote this book because of the conversation of grief. As a human being, we all will experience grief. It is a universal problem. You can't get out of life without experiencing loss at some point in your life. And so I noticed this, the inspiration for this book came a long time ago, 35 years ago, when my best friend was murdered. And it was a murder-suicide, and my husband and I were the godparents of her children. It was a very ugly situation, and you'd think that happened, life goes on, but it didn't. And the reason why it didn't is because we were part and parcel to help raising those children. And their oldest, Allie, I held her. I was the second person to hold her when she was born. You know, her dad held her, and then I held her. And we were very close to her. She is our third daughter, by all accounts now. And what I learned through the process of grief is it never stops, especially when children are involved. We had really difficult questions to navigate when we were raising her. And then I became a physician and I realized, wow, we have really difficult conversations to navigate with every patient. And I literally walked out of a patient's room where a woman was grieving the loss of her husband. And I recognized how different that was. And I walked into the next room where parents had lost their child. And I was like, wow, I need to read more about this because it's so different, the type of loss she experienced and then the type of loss these parents had experienced. So as a young physician, I said, oh, I have to read more about this on grief. And there wasn't a book that talked about the nuances and the difference between those losses. One, how it's a loss of intimacy and closeness with your spouse, and the other, how it's a loss of your future and everything you dreamed about that child. And I thought, how can there not be a book on this? So then it took me 30 years to write it. So I wrote it. Thank you. Thank you very much. So I did write the book, and I did include my clinical experiences, some personal experiences, but I did interview a lot of people. I just reached out to people who had lost. They introduced me to one person, then 10 people here, and then 14 people over here. And I turned my basement during the pandemic into a gigantic storytelling room. And I cobbled together all into themes. So the first 5 chapters are about loss of parent, loss of child, loss of spouse, loss of best friend, loss of sibling, and loss of pregnancy. And I talk about the nuances and the differences between those types of loss. And then the second half of the book is the wisdom that I gained from everybody in that loss, because I asked them the same types of questions. What helped? What didn't help? What were the things that you learned from that loss? If you could cobble anything together that was positive about it, what were those positive things? Some people created foundations. Some people created incredible nonprofits focused on the very thing that their loved one died from. Some people stopped chasing their jobs and money. Some people walked away from relationships that were not good for them. And some people re-engaged in relationships that they missed. So they were very profound things that they talked about, and I cobbled them together into chapters. So I hope, I do have a booth out there. I hope you stop by to see the book. I'm happy to sign a copy for you. But the whole point of the book was to help raise empathy. I'm not trying to make money. Raise empathy, help us all be better human beings, and have better conversations about grief. I know it can be uncomfortable. Nobody likes to talk about death because it reminds us that we're all going to die someday. And nobody likes to look at their own mortality. It's uncomfortable. It doesn't feel good. But I would encourage you to take a moment to lean into every loss that is presented to you as life goes on, because you can learn so much from each loss. And it can be a beautiful moment in time for you to learn how to engage and how to live your life more fully, with more purpose and more meaning. And so this is why I want the conversations, because it shows up in the evidence that I just showed you, that we don't have those conversations in healthcare. And I want those to be more present in healthcare because we need it. And I think we would be happier for it. And there, in fact, would be less burnout. So the future of healthcare leadership, we need sustainable healthcare that requires sustainable healers. And the way we're going to get there is to design systems that sustain caregivers, recognize the emotional labor, including grief, in medicine, because there's a lot of it. Promote recovery and resilience, and build cultures where clinicians feel supported. All clinicians. And with that, thank you.
Good job, good job. Good job, good job. GOODJOB, good job, good job. Thank you so much, Dr. Schaefer. Thank you. Thank you for bringing depth, honesty, and perspective to the stage in a conversation that matters. We're now going to move into a session that looks at healthcare from a slightly different lens. As our industry evolves, we're seeing a growing focus on measurement, prevention, and understanding health at deeper levels, not just treating conditions, but truly understanding what's happening within the body, ideally the body, soul, and mind. Our next session, Healthcare's Evolution and the Power of Measurement, Why Nutrient and Antioxidant Status Matters for Health and Cellular Wellness, brings this perspective into focus, highlighting how tracking what's happening at the cellular level can shape more informed and proactive approaches to health. Let's put our hands together for Dr. Greg Caldwell, Doctor Optometry and co-founder of Optometric Education Consultants, as he reveals how nutrient and antioxidant status is shaping the future of healthcare.
Perfect. Thank you. Thanks for that nice introduction. Is this anyone's cell phone? Now that I got your attention? Haha, all right. So I'm an eye doctor. I studied allopathic medicine for about the first 20 years of my life. That means opposites cure, right? And I had patients coming in asking me for macular degeneration, would resveratrol work? And I said, I don't know. KNOW, I didn't say no. I need to research it. Can astaxanthin work for my glaucoma? Can CoQ10 work? And I had to keep saying, I don't know. But I didn't say no. I wasn't that narrow-minded. So I decided I was going to try and find out the answer to that. Well, I'm a KOL in optometry, key opinion leader. I thought it would be pretty easy. I knew a lot of industry, knew a lot of the supplement companies within eye care. And when I would go in and I was looking for that data-driven wellness, I wouldn't find it. I found maybe a couple doctors that read a bunch of white papers, that put a formula together. I could have done that. My buddy Trevor's out at the booth. He and I are pretty smart guys. We could have read some white papers, found some lab, and called it maybe Amazing Eyes. A lot of people do that, right? I wanted data-driven wellness, and that's what goes on with the theme here. Technology, trust, and the road ahead. Within technology, I wanted to be able to measure someone's antioxidant status. Now I can do it in 15 seconds or less. It creates a great conversation. I can now then give them a solution, a data-driven solution for when I find the problem. Maybe help break their addiction, which we're going to talk about here shortly. So this works perfectly for the great healthcare shakeup, technology, trust, and the road ahead. The reason being, I was watching people lose vision from metabolic conditions which are reversible, right, or treatable or preventable. I was watching people lose vision from chronic diseases, watching them lose it from macular degeneration. And they're looking for naturopathic reasons or ways to do it. So if you're looking for a naturopathic, a nutrition way, then there's a solution here that I'm going to walk you through, but also to focus on the great healthcare shakeup, technology, trust, and the road ahead. Okay, so let me go through some slides here. And you can see here that it's your body's report card. There we go. So real quick, we have macronutrients. There's a big focus on it right now. Everything's this protein-driven society, which is great. We want to get away from those carbohydrates. Out of the 3 macronutrients, that's the one that carbohydrates are the ones that become addictive. You cannot become addicted to protein, can't become addicted to fat, but you can become addicted to carbohydrates. We've all had this. Everyone in here ever eat a bag of Doritos? Did you ever get that real cheesy one? Everyone's got it. Is that done on purpose? Yes, food scientists have done that. Because carbohydrates can become addictive, and now you overeat. Subconsciously, you keep eating, and hopefully you'll get another cheesy one, right? So you heard me yesterday, if you were here when I was part of the panelists, I would say, what are the benefits of smoking? There really aren't any, right? Everyone looks at me and says, what are the benefits of smoking? There really aren't any benefits of smoking. But if you said to someone that smokes, hey, it causes cancer and emphysema, it's not that they're going to say, hey, I never smoked again. They're going to continue to smoke because they're addicted. And whenever we look at the 3 pillars of health, exercise, sleep, and nutrition, and I say to you, if I told you that exercise will decrease, if you did it 90 minutes a week, will decrease all causes of mortality by 14%. Sleep, I hear people say, I'll sleep when I'm dead. Well, that might come a little bit sooner than you think if you don't get that 7 hours of sleep. And nutrition, I think we all know nutrition is good, but we all don't do it because why? We're addicted to foods and we're addicted to our hormones, and there's things that we have to do to break it. So macronutrients are important. Micronutrients are important. They regulate, they protect. They're needed for smaller amounts, needed in smaller amounts, but are essential for health and ocular conditions. So the macronutrients are energy and building blocks, and the micronutrients are regulators and protectors. Most Americans and most people in society are micronutrient deficient. And the only way you can get micronutrients are what? To eat them. So most of us don't eat enough micronutrients, and so now our homeostasis is off. So wouldn't it be great to know if you had low-grade chronic inflammation in your body? Know your fruit and vegetable intake. Know if your supplements were absorbing. Had lower risk for chronic diseases, or know your antioxidant status. Wouldn't that be cool if you could do that? And you can in 15 seconds or less. You put your finger on here, you get a score. This, every time I put someone's finger on here, a 15-second scan, is usually minimum a 5-minute discussion because it really now becomes an eye-opener. Whenever you now look at that score, try to figure out why it's high, why it's low. Most of the time it's low. All right, chronic disease. The world does not come to us for chronic disease. Europe is a heck of a lot better at preventing chronic diseases, right? There's over probably 200 chemicals that they in the EU that they don't allow in their food sources that we allow. I know whenever my stories, every time I go to Poland or Germany, I pick up a bottle of ketchup. It says tomatoes, vinegar, salt, water. Pick up a bottle of ketchup here, and it's got hydrogenated something and poly something and whatever something else in it. And you're wondering why they don't come to us for chronic disease management. They don't come to us for prevention. We're great at acute. We all know that person having a heart attack, took a couple aspirins, take them to the hospital. Someone, man or woman, comes zooming in on a Porsche, sticks a stent in and prevents it. We're great at that. The world comes to us for those repairs in our knees. You know, when they have the star soccer player blows out their ACL, they come here. We're good at acute. We stink at chronic, right? No one comes to us for the chronic part. And that's why when you look at life expectancy and health expenditure, we're one of the worst in the country. And we know that low-grade chronic inflammation causes cancer, cardiovascular disease, Alzheimer's, diabetes, autoimmune, neurologic, whatever you are. I always love giving this talk in Vegas because if you have a low score, it's like going to the roulette table, let it spin. Are you going to be something up in your head? Is it going to be Alzheimer's, dementia? Is it going to be an eye? Is it going to be lung, heart, anywhere of the organs? Where's that going to stop when you have that low-grade chronic inflammation? When you have a low score on this scanner, like I hear people say, oh, I might not even come to class tomorrow because I'm going to be dead by tomorrow. No, this is not an acute problem. This isn't your blood sugar being through the roof. This isn't a blood pressure being super high. It's not an acute problem. It's a low-grade chronic burn inside. And when that roulette wheel stops, what disease is it going to stop on? Right? So that's why I like to focus on raising people's micronutrients, getting that low-grade chronic inflammation away from the body and stacking the deck in their favor. When it comes to chronic disease, we want to stack the deck in their favor, and this becomes part of the strategy. It's not the only way that I'm treating glaucoma and macular degeneration, but it's part of the strategy for helping people and prevention and wellness, longevity, anti-aging. Here's our food sources. I take the pictures all the time. I walk through. Bananas are the easiest. What do you think the color of this bananas were when they were picked? What color were they? Green. You can see it. How about those oranges? You can see they're still green. This is the problem with our food sources, is that tomatoes, apples, everything's picked green. And I always use the analogy of a baby. If a baby's born at 8 months because it's disconnected from mom, it usually ends up in neonatal intensive care because it hasn't matured yet. Our fruits and vegetables, when they're connected to the vine, the tree, the plant, they have to be connected, light, dark, cold. And as they turn from red or green to red, green to yellow, or green to orange, now they become micronutrient dense. When they're picked and put into a gas chamber and then shipped for months and then turn green, they're not going to become any more micronutrient dense. And that's why it takes 21 oranges of today to meet one of years ago. And the same thing over and over again. And that's why they tell you to go to farmers markets, because the farmer picked it the day before and then is selling it to you. So it's now micronutrient dense. Our food sources, right? And we see this all the time. 21 oranges of today of 1950. We have all kinds of stresses out there that create oxidative stress, whether it's inflammation, your own metabolism, making ATP. It's not a clean system. It produces free radicals. Smoking, oxidation. When you walk outside on Las Vegas Boulevard, traffic everywhere. You're breathing in. You're creating oxidative stress in your body. And you better have your fruits and vegetables on board because you're creating free radicals. Free radicals, all it means it's missing an electron. Your body loves homeostasis. So it's going to use a cell membrane, it's going to use DNA, it's going to use the mitochondria, it's going to use something. But what you want is your score to be high so that the organs of your body are saturated with antioxidants because they want to give up that electron. You don't want it hitting the DNA. You don't want it hitting the eye and creating macular degeneration or causing that to be part of the macular degeneration, causing it part to be the glaucoma or the diabetes, the receptors. If someone's trying to take a medication and the receptor is oxidized, and now that medication won't work as well. So again, it becomes part of the strategy. We have, whether they're internal ways of getting oxidative stress or external, we're always bombarded. But the equalizer is supposed to be our fruits and veggies. And now in this big heavy protein society, what are people cutting out of their diet because they're afraid of those carbohydrates? Fruits and vegetables, right? Because now they're trying to go protein heavy. And what is the only way that you can get vitamins and minerals? Can your body produce them? No. They're exogenous. It means you have to eat them. Your body cannot produce them. They're not endogenous. You have to eat them. And now we're cutting out our fruits and veggies. And that's why good supplementation, data-driven wellness becomes important. And that's what's been one of the biggest helpful changes the last 10 years of my practice. I'm an allopathic doctor. I studied nutrition, I studied naturopathy, and I kind of now do integrative. I didn't give up on my allopathic background. I always say I'm still going to treat a sty with an antibiotic, not an avocado. But then I also going to know what I did to that gut microbiome, support it, probiotics, prebiotics, postbiotics, give them some, measure their score, make sure they have a good micronutrient, and they're not deficient. So here's the American rainbow. I picked this up at the Atlanta airport. Look at those beautiful blue Almond Joys and the yellow Lay's potato chips and the Doritos. Look at all that processed food. And we wonder why we have such low scores. There's your American rainbow. You see it with the fruits and vegetables. Those were taken at the Delta Lounge, Marriott, and Hilton as I travel. And I take those pictures, and you wonder why as we travel. And now we're out of our sleep rhythms. And we have poor sleep. We're not exercising. We're eating processed foods. Then we think we're eating oranges that are so nutrient dense, right? And that's why I just supplement faithfully with my Life Pack every day and my collagen and my gut products. So 15 seconds can change your life. It's your body's report card, and that's what the Prism is all about. It actually, no one would take blood pressure medicine by saying, hey, it looks like you have high blood pressure. I'm just going to give you some medicine. Hey, it looks like your cholesterol's up. Let me put you on some Lipitor. We have to measure, right? That's what we want. We want technology. We want trust. We want data-driven wellness that's out there. Your body, again, we talked about the 3 pillars of health: exercise, parasympathetic system, sleep, recovery, and basically your nutrition. Nutrition comes down into macros and your micros. And I'm very big, as you can tell, on the micronutrients because there's plenty of evidence-based medicine, evidence risk-adjusted medicine that will help us out with our patients and clients depending on what setting you're in. So it's not anything that just came out. We've got 21 years worth of data. You can see at the bottom is the S1, S2. The one at the very bottom there was the S3. It's the one I used in my office. Basically, it was in physicians because it was about $4,000. It had a click fee. It had a contract. It had a lease. Now we can give these right here for $299. And my first 2 patients bought them. And that's where I want them. We want them in households. We want people breaking behaviors, changes. We want them changing their diet. We want them to get better. It gamifies nutrition. Out of those 3 pillars, I was here yesterday and I polled the audience, exercise, sleep, nutrition, which one do you think is the biggest to cause disease if you had to pick one of your own, if you just wanted to pick one? There's no right or wrong answer. Which one do you think out of those The 3 pillars of health, it's like a bar stool. Take one away, it falls down. Don't exercise enough, don't sleep enough, nutrition. But which one do you think would cause the biggest part of that disease process? Right? Everyone always says it, nutrition. So why wouldn't we measure it? Why wouldn't we help our patients out? We got 21 years worth of carotenoid research, 28 million scans, 20,000 light measurements and readings in 15 seconds in proprietary technology. It's not something that's new. Raman spectroscopy has been around for years. Back in 2014, the Yale Cancer Center validated that Raman spectroscopy is a biomarker, a great measurement for our nutrition and our status that's out there. So here's how it's done. You put your finger on it. It's using hyperspectral absorption. And we have a Raman database. We have some machine learning. So basically, you put your finger on it. It's the prism. The prism is filtering out the carotenoids. Now, let me just pause and ask. Carotenoids are part of the antioxidant system. Vitamin A, vitamin B, vitamin C, polyphenols, flavonoids, carotenoids. So let me just, since you're just sitting in front of me, if I measured you and you happen to be low in carotenoids, do you think that you're low in carotenoids and everything else of your antioxidant status is optimal? No. So it's a great, and it's been proven, it's a great representative of your whole antioxidant status. Through science, proven, hundreds of studies, proven. It matches the blood. It matches the skin. It is a great biomarker, non-invasive, quick score developed by the National Institutes of Health to study at the very beginning cancer, and then to my near and dear to my heart, macular degeneration. That's where it originally started, years ago. Then it went to the University of Utah to be shrunk down to be portable. And look at this now in 2026, able to be super portable and measure in 15 seconds or less. Create that conversation that's out there. So here is a scan, and you get a solution, and I love to call it data-driven wellness that's out there. All right, so we have a whole life pack family, right? This is what I do for my patients. So I don't want to create a problem. And what I love about the scanner is I'm not the one telling them that they have a crappy diet. They're not getting mad at me. There it is, right? You have a crappy diet, but it's not me saying it, it's the instrument. They fill out an antioxidant assessment form. It's not me being a salesy person. Now I can give them a solution. And we have a starter, optimized, and advanced. That's just in the antioxidants. We've got a peptide, a bioactive collagen peptide. It means when you use it, it's going to go to work. We also have gut products because we can't be linear and binary. We got to think of the person as a whole. All right, let's see if this can work. So when you look at Life Pack, people say, is that a good multivitamin? I say, yeah, you're about 1/7 correct. Because our clinical studies show, yes, it is a multivitamin, but it's also cardiovascular, bone. It's also immune support, blood sugar support, anti-aging, and an antioxidant formula. So when they say, man, that's a multivitamin, I say, yeah, you're about 1/7 correct. It's part of the whole part of that Life Pack family. All right, let's see if I can get my remote to skip. Move along. Here we go. Here's what I love about the country. Data-driven wellness. They will select from all over the world. They will source from all over the world and select. They will pick the product, whether it is a natural form, a synthetic form, whether it's the alpha, beta, gamma form. They'll have tight specifications, standardization. But what more importantly I like about it and why I put it in my body every day is because the FDA for contaminants is here. Theirs is down here. Every supplement's going to have a contaminant in it. You just want it low. And you want it low so that you're not micropoisoning yourself. And the last one, they call it substantiation, just a fancy word for studies, and they do it on humans. So they have human studies. I think the 7th one should be stability. People don't realize that if it's on the box, on the label, that it doesn't mean that it's in the vitamin. They have shown me, because I speak, and I speak a lot, and I speak in optometry, fitness shows, health shows all across. If I'm going to have the confidence of speaking, they had to show me some data. So I signed a non-disclosure, and they showed me other people's products that they tested. That's not their MO, but what I like about it is if they showed me that it's supposed to have 10 milligrams, but because it's in the shelf and it's sitting there, it will break down. So it doesn't mean that if it's on the box, that it's going to be in there once it's sitting on the shelf for 6 months. They do stability testing. Whatever their expiration is, it's as strong as it is on day one as it is on whatever the expiration is, which is usually 2 years. So it's not going to break down. They have a 6S process, which is higher than the TGA because supplements in Australia are considered drugs. All right. So here's what I was talking about here. Knowledge is powerful, right? But it's logical. Yes, I know smoking causes lung cancer, but I can't quit because implementation is biological. And to change habits, you got to have something that is a behavior changing device. So implementation is biological, all right? And knowledge is logical. So we all know we should exercise. We all know we should eat better. That's logical. But we can't do it because of the addictions, the neuronal loops that are out there, and that device can help break it. And that's what all the other devices that we wear are supposed to do, right? The Oura rings, body compositions. When we take our continuous glucose monitors, our Apple Watches, sympathetic, parasympathetic. Apple Watch is sympathetic, how much exercise? Oura rings, how much are you sleeping? Now we have something. So I came up with all these different names. It's an addiction interrupting device, craving disruption device, habit breaking, loop rewarding, whatever you want to call it. That's what we're trying to do in nutrition. We have it in exercise, we have it in sleep. Now we have a way to break it in nutrition. So it's the rise of personal health monitoring devices. Antioxidant status shows inflammation, oxidative stress, nutrients sufficient, mitochondrial load, cellular recovery. And we have all these different devices that are out there. Now we have something that we can measure nutrition. And why measurement of oxidative status matters? The cost of treating illness is expensive, and the value of preventing illness is priceless. That's out there. All right. Here we go. We're going to have about 10 million devices in households by 2030. That's already started. When I was a part of the team with the old scanner, we had about 6,000 units out there. Since we launched this in January, we now have 40, maybe 50,000 by now. We have 40,000 devices. It's pretty cool watching these roll out. And the public and the doctors and the nutritionists, the dietitians, everyone is starting to embrace it because now we have a way to measure, and then we also have a way of giving someone a solution. And that's what this is. Very rarely do you see, and I've done it before, I have devices that come in as an eye doctor, and then their treatment plan isn't so good. Or they have a great treatment plan, and now their device isn't so good. Very rarely do you get a company that has a device and then has a scientific driven, they have 75 scientists, a scientific board, 14 disciplines that are making their supplements. Again, data-driven wellness. So as a doctor with my license, I don't really have to worry about it. I know that whenever I prescribe it, what's going to be in there because of their 6S process is going to be what the patient is getting and is well deserved. So you're getting intelligent solutions, trust, right? We want something that people can trust. I've been talking to a lot of people this last 2 days, and a lot of people know that kind of the supplement market's a little bit of a wild, wild west. So that's why I go with a company that has a scientific board, it's not Trevor and Greg just building it. They have 75 scientists in 13 and 14 disciplines, depending on, I guess, what time of year, and the team is changing constantly. All right. So I will pause because I want to respect the time, but I'll take some questions. And the reminder is, since this is being streamed live, we'd like to go to the microphone to make the questions. There's one here, and there's one here for questions, or we can take you a microphone back. Uh-oh, we need some juice over here on Mike to my left. All right, thanks.
So it's New Skin that owns the patent on this, is that right?
New Skin is the,
Owns the patent on this.
yes, New Skin owns the patent on the Prism device. Yes, New Skin Pharmanex.
And is there any way, or have you considered, or are you looking into incorporating it into something like an Aura ring? Would that be a possibility?
So the question is, about regarding incorporating into an Aura ring. They're already working with a company called Full Sun to make or Full Power. You can look them up on the internet, Full Power, to integrate the Aura ring, to integrate things like Apple Watches and Whoop watches and this data to make a digital twin. So it's going to be really cool to see what they do with this data, putting it into kind of machine learning and AI learning. An example would be I live on the East Coast, and then once it gets, my Aura ring starts feeding in, this is the future, I'm telling you what's coming, it's not here now, is that what's going to happen, and it's going to say, hey, I see your sleep patterns off. And you put in, yeah, I was in Vegas for a few days, and it will help make a recommendation, like maybe their nighttime formula. So they're not going to really incorporate it into an Aura ring. Samsung already has a watch that measures antioxidants, which is really cool because it validates what we're doing, but it's not as sensitive. It doesn't have the proprietary database. It just says low, medium, and high. But it's really cool. If you Google it, Samsung has a watch that can measure someone's antioxidant level, but it's not as a number driven. It's just more quantitative rather than qualitative.
And what is the accuracy rate of this?
What is
the accuracy percentage?
Yeah, the accuracy they say was if you remeasure, you're going to be within 10% because you're never going to hit the same spot of the finger. So if someone comes in and they score 500, so 10% would be 50. So now you could say 550 down to 450. It's a little bit tighter than that.
But what's the accuracy if you were actually like taking their blood or measuring it physically?
Yeah, so there's been plenty of studies out there. There's 110 studies where the skin matches the blood, and more importantly for me, that it matches what's found in the eye, because the highest concentration of carotenoids is in the macula, or the fovea. So they've done studies to show that they all match up.
Okay, last question. Will you just touch really quickly on how it is working? You did go over it, but you went really fast, and I was just wondering if you could.
Yeah, so in this technology, the question is, how's it working? It's using really bright white, and there's a prism in there filtering out the carotenoids. Carotenoids are yellow. It used to be a blue light where yellow and blue make green, and then we knew the amount of green light. It was like 478 blue hitting the yellow carotenoid, bouncing back a 618 green light. It's a different technology now using white light prism, and then it goes and filters out that carotenoid, talks to that Raman database, and now gives us a number. So that's a pretty cool proprietary science that they have using the 21 years of data that we have on carotenoids.
So I assume that you would do better with this prism measurement if you change your diet and use the Life Pack supplements and vitamins.
That is correct. So basically the question was, so I tell my patients, and I'll use this as the last question because it's 12:30 and I want to stay on time for the conference here, or it's 2:30. I want to stay on time. So I tell my patients, I cannot supplement you out of a poor diet. But what had recently happened to me with a patient, this big burly guy comes in and says, Doc, I know I need to do something. Tell me what I need to do. I put him on Life Pack. And what he did is he came back and he goes, hey, this little inflammation spot has gone away. I think my score is going to be up. I'm eating better. Boom. And when he went out with his buddies, he said, yeah, we had burgers the other night. Instead of me getting those fries and that seed oil stuff I hear them talking about, I got a cow salad. So now I've made the behavior change. I made the lifestyle change. That was done by a measurement, him now thinking about it and gamifying it, breaking his addictions, breaking his behaviors that are out there. So yes, I can't supplement someone out of a poor diet, but yes, supplementing with Life Pack to fill in the gaps, changing, really becomes synergistic.
So also, do you have some kind of guide of how long will it take to double your score if you take the supplements and you start eating like the rainbow diet?
Yeah, so the question is, how will it double? Everyone's different because of the different inflammations and what the illnesses they have in their body. Yeah. But if they're perfectly healthy, I can usually double someone's score in about 8 weeks. So 2 to 3 months, I can usually double their score if they're healthy, just to kind of give you. Yep. All right, everyone, I want to be respectful of the time. So I want to thank everyone. I'll take questions in the back, but I don't want to be the one getting us behind on because this is always we can sit and talk. So thank you.
You know you did a good job, so say you did a good job. You know you did a good job, so say you did a good job. You did a good job. Good job. That's right, that's right. That's how we do it here. The session really did shed a lot of light on the evolving role of measurement and in improving health outcomes. How do we understand wellness more deeply? Thank you for the perspective. Sincere thank you, Dr. Caldwell. Uh, Up next is a keynote on the topic Help Me Live: Why Chronic Disease is a Design Failure and How Innovation Can Fix It. Chronic diseases are rising earlier and progressing faster, yet healthcare remains designed for late stage intervention, not upstream prevention, driven by shared metabolic dysfunction, inflammation, and muscle loss. Modern chronic disease reflects a system design failure, not a lack of science. In this session, Dr. Sean Hall will explore how innovation in delivery, precision medicine, and AI can shift care upstream, restore function earlier, and make prevention more scalable. Let's give a warm welcome to Dr. Sean Hall.
Thank you. Hi, everyone. Thank you for having me here. The title today is Help Me Live. I've spent the last 20 years of my life researching chronic diseases. And what you see before you is the cliff notes for all you back at school that would like to go to the summary at the end. If I may, sorry, that's what I'm looking for. Just as a disclaimer, I'm CEO and chairman of a biotech. We're a private company. We engineer pharmaceutical and food supplements for mid to large size pharma. So you'll get a sense on where my bias is straight up. Beyond that, though, I sit on a number of charitable boards around the world. The commonality is they're all kids in rare diseases or life-threatening diseases. So my career has given me a unique perspective of life sciences, more so around the chronic illness space. So here today, especially in this country, this is our greatest challenge. It's chronic diseases, right? And when we look at it, everyone here knows what I mean when I say a chronic disease, right? No one's, okay, great, so we won't go down that far. But what I do want to point out is when we deal at the patient level, you'll have a number of patients, a large number of patients, that will complain that their treatment is being undermanaged, especially when you get into areas of mental health and you get into pain. And pain is where I've focused the last 10 years. Here in the US, there's our top three: hypertension, obesity, and chronic pain. And I'm only for the purpose of this talk going to focus on those three. When we look at the adult population, so everyone above the age of 18, we see a staggering 76% of the US adult population today having at least one chronic disease. I can make that worse. 50+% with one or more. The real kick is when we look at the kids. 3 to 17. 1 in 3 children today have at least one chronic illness under treatment. That's not a hidden thing. That's actually a statement. So this is why I say I understand how we look at healthcare, and healthcare is a siloed industry. But it can't be that way moving forward, especially when we're playing with something that is not a condition. It is not a treatment. So as we move through this, keep open minds, stay treatment agnostic, and focus on the problem. So I'm really going to run this point home. When we go back to data sets going into early 2000s, and we run out to last year, and from those type of census data points, we're projecting 24, 25. The commonality you see here is our 3 top chronic illnesses, so our hypertension, our chronic pain, and our obesity are all going up. So I'm going to make a motherhood comment, and for those of you who know me, I don't do this often, but I'm going to say this: it is really clear that historically every initiative we've undertaken, every public health policy we've put out, every drug, every supplement, every intervention tool has failed. The problem has not been arrested. right? I look at this, and from my experience, there's three key issues. We have what we call chronic diseases, but we've got to think now outside of the medical framework and look at the stakeholders to those conditions. So food, and we're hearing this over and over and over again today. I want to talk a little bit about misinformation because I'm not a fan of social media. I want to talk about eroding trust. I want to talk about marketing. I want to talk about the lifestyle, especially in the US, that we choose to leave. And then beyond that, I want to point out that those patients who claim that their treatment is undermanaged, or they claim they are unmet in their needs, they're falling behind. They go off and they look for something else and they leave their primary health caregiver. And we have a further disconnect. So we are now developing a group of non-responders in chronic disease patient population. Last is the commercialization of healthcare. Doesn't matter how you look at it, right here, right now, we're all in various countries. I'm from Australia, where we have increased cost of living and cost is a barrier. We also have the situation, particularly in this country, where insurers like to dictate health outcome, right? So keep that in mind. JAMA, this was actually end of January, focused purely on US state level POPs. So this is an accumulation of that data for adult obesity going back 1990. And it basically says this: doesn't matter what color your skin is, what sex you are, the prevalence in obesity alone is going to increase. It does give some wonderful insights as to which subgroups of the population are more at risk. But it's not painting a pretty picture. So what I want us to do is I want us to shift our focus. We know what medicine is today. I want us to look at medicine and shift the focus into a more upstream-based model. Modern chronic diseases, such as our top three, our hypertension, our pain, our obesity, they all share very common metabolic and inflammatory roots. There's no question about that. And again, we're hearing that over and over today. These include insulin resistance, chronic low-grade inflammation, more so mitochondrial dysfunction, right? So progressing these together over time, we now are starting to see years or even decades before a formal diagnosis is made, the influence of each one of these subgroups in the disease, both at a biological point of view, so muscle loss, worsening, insulin resistance, and at a behavioral point of view where we have pain driving inactivity, and inactivity is accelerating metabolic decline, right? It's a vicious circle. So the problem, it's not always a lack of treatment options, it's coming down to how, when, and what treatment is applied. Right? Bear in mind, medicine, as we know it, is siloed. So the current medical system largely intervenes after the disease has declared itself, right? Targeting these downstream signals, such as elevated blood pressure, pain scores, and so forth. And whilst this approach manages symptoms really well and can prevent acute events, it fails to address the upstream drivers that we're seeing more and more of: the metabolic dysfunction, muscle loss, inactivity, chronic inflammation. And it's these conditions that emerge, they cluster, and they worsen over time, right? So we need to shift our focus and start to treat metabolism, muscle health, pain, and function as primary targets, basically aiming to slow or reverse disease trajectory, extend lifespan, and ultimately reduce long-term dependency on otherwise reactive care. Right, so if we prompt the question, is the current US medical system, including all its dominant treatment options, adequately addressing the rise in hypertension, obesity, chronic pain, and earlier onset chronic diseases? Categorically, no. It's simply not there. As reiterated in our last lecture, the current US medical system is highly effective at late-stage disease management. Right? No two ways about it. But it's structurally inadequate to cope with chronic diseases. At looking at preventing, reversing, or slowing earlier onset, multi-morbidity type diseases, pain, muscle loss, and accelerated aging, it fails. So this is not a clinician failure. This is what we call a system design failure. So beyond medicine as we know it, I want us to look at some of the key stakeholders that influence us as practitioners influence our patients, influence those policymakers around the medical institution. Number one, we need to recognize that social media is a behavioral modifier, and not necessarily in a good way. Number two, today, as people are driving business, there's more and more false marketing claims made in food and in supplement use. We have an uneducated public. I was absolutely staggered to read that 21% of Americans today are functionally illiterate. I couldn't believe that, right? And add the rising cost of living on top of that, we now have situations where there's lack of desire to learn. We need that patient to be an active participant in their health journey. But we also have this large group seeking medical or health advice from non-qualified people. And that's because everyone has one of these. And I can guarantee you everyone in here has a social media account, right? If we look at economics, as I said before, medicine is a function of insurers. And that is fraught with a whole heap of danger, right? Cost of care, barrier of treatment is too much for some, especially as we're moving through, rising costs of living. Hospitals today, unfortunately, have a more turnover, turnout function than let's get to the root of the problem so that when you're out, you are out, right? Last, I want to mention AI. I'm being very careful how I say this, considering there's so many tech people in here, but AI is not always right. I can't tell you the amount of patients, my father included, that will ring me and go, oh my God, ChatGTP just told me I have, right? My heart hits the ground every time I say that, right? At the moment, AI cannot replace that experience a healthcare provider can do, especially when we start talking about personalized and precision medicine, right? And let's face it, if you have a look at the types of patients that are hitting AI for answers, a lot you're going to find in the oncology space, right? But here's the big disconnect at all, and I do really want to drive this in. The amount of patients that look to AI for answers and believe it carte blanche is staggering. These are challenges we're up against on a day-to-day basis. So just to paint this into a cascade of events, we have our lifestyle and our environment. We've heard, and I'm not going to labor on it, ultra-processed foods, high-fat foods, adulterated foods, sedentary lifestyle, screen time, all that stuff that drives metabolic dysfunction. So here you have your insulin problems, your inflammation problems, and your early onset obesity. This drives our muscle and our functional decline. So muscle loss is now being seen in people at the age of 30, right? And muscle loss is probably one of the biggest biomarkers to me about your risk of death. Because medically, especially in oncology, we look at muscle loss or premature muscle loss as an indicator for early death. So we're seeing it in people the age of 30s now. This amplifies pain. This is all happening a lot earlier. So I'm going to try and start to propose some solutions here. And again, in this, I'm going to be therapeutic agnostic because everyone has something to offer. Everyone has a world of experience in their class of patients, right? I think we must recognize that these diseases no longer are isolated diagnoses and they are biologically linked conditions and they're driven by shared metabolic dysfunction, inflammation, physical inactivity, early muscle loss, and so forth. If we accept that onset is now a lot earlier, looking at these individuals into larger, more expensive disease trajectories is the current outcome. So modern healthcare remains structured around these downstream symptoms, but upstream causes just are not there yet. We're told to tell patients eat better, move more, whilst living in an environment engineered towards sedentary behavior, ultra-processed foods, and chronic stress. So behavioral change is demanded without us first addressing key quality of life areas such as pain, fatigue, and then things like insulin resistance or loss of muscle, making adherence from a patient point of view unrealistic as opposed to more irresponsible. At the same time, poorly regulated wellness and supplement products flood the market with unsubstantiated claims. In many cases, low bioavailability products, pharma-style marketing without pharma-grade evidence. So we have a bunch of people jump off or spend lots of money around these products that neither prevent reverse disease, ultimately eroding trust into what could be a lot more legitimate medical treatments. And again, for the audience here, I use medical as a generic term for healthcare. So I'm going to give you a couple of examples. I won't spend a lot of time on this, but just to give you an idea of some types of innovation happening in the background. So from my company, one of the things we specialize in is lipid nanoparticles. And we use lipid nanoparticles to repurpose drugs, more so existing drugs. So why do we do this? Because many effective compounds fail not because they lack biological activity, but because A, they don't reach target a tissue effectively, right? Or they require high systemic doses and hence produce dose-limiting side effects, not desirable. Or in a number of cases, the route of administration is invasive, like subcutaneous injection. So when we're developing new engineered platforms for re-administering drugs, we look for lower effective doses, so we're reducing the amount of the compound we're actually giving, faster onset of action, better consistency of exposure, a significant reduction in systemic side effects, thus improved safety profiles, but more so we're looking at bypassing first-pass effect. Everyone understand what I mean when I say, okay, right? So in these, we favor buccal or nasal routes because everything we do focuses on the patient first, and patient compliance is big in any model that we apply across any of the life science spectrums. So in that, we have two programs underway. One is a program targeting cancer-induced bone pain and noisy plastic pain, strong data across 1,200 patients to date, opioid sparing, which is really, really interesting because we're removing those opioid compounds from the body, pain reduction, but more importantly, significant improvements in quality of life, especially around mobility, appetite, social cohesion, and so forth. The other one is in a peptide program, and we are believers in peptides. And in that, all we're trying to do is change the route of administration. So for most people who know peptides, they're typically a sub-Q injection, and the stability of a reconstituted peptide is really, really short. You can measure it in days. The program takes the sub-Q injection away. Bear in mind, in this country alone, 30% of the adult population is taurinophobic, which means scared of needles, right? In doing that, we keep the bioequivalence to the sub-Q injection up at 70+%, which is far more superior than we see in the pills that are being generated for GLP-1s. And we improve drastically the overall stability of the reconstituted peptide. That kind of gives you an idea of the work we do, right? One of my favorite companies, Eli Lilly, they have a program going on at the moment called retatrutide. Hands up if you know what retatrutide is. Okay, so quickly, think semaglutide on steroids. This is a GLP-1, a GIP, and a glucagon receptor, sometimes called a GLP-3 drug. Eli Lilly dropped phase 3 data November last year, also known as Triumph 4. It's worth a look. And it is being positioned as best-in-class weight loss, but weight loss is an outcome to what the drug does. What the drug is doing, it's questioning why you would use a statin in cardiovascular disease, why you would use metformin in diabetic and insulin control. So the problem, let's start there, is the delivery is sub-Q, and once that peptide is reconstituted, the stability is 28 days, right? So it involves a pharmacy to reconstitute for the patient take it home, monthly supply. The benefit is it's a weekly injection. It's delivering near 30% mean weight reduction, but like I said, the weight reduction is an outcome to the drug. What it really does is significant improvements in HbA1c, fasting glucose, triglycerides, improvement in insulin sensitivities. And what we're seeing now is participants self-reporting improvements in physical function, activity, knee pain, and more recently, and I didn't get to put this into the presentation, in tumor reduction. This is something well worth having a look at because this is, in my mind, that type of apex medicine that will make us rethink how we diagnose and treat several diseases in the one. In both cases, it would be remiss of me not to say that history is our greatest teacher. And in that, there's an old cliche that every inventor or every invention stands on the shoulders of giants. And when we look at what we're doing at MedLab and when we're looking at what Eli Lilly is doing, that is really, really true. If you have a look at some of the other, let's call them blockbuster medicines that have been over the past 20 years, I encourage everyone here, look at the past to give you a way forward, right? Especially when you start designing supplements, you design foods, you design pharmaceuticals. It is the one thing that can save years and a significant amount of money to any R&D program. Last example I want to give, this one is close to my heart. This is the Children's Cancer Institute of Australia. This is now a global initiative, and there's 14 major hospitals in the US that have signed into this initiative. What CCIA do, and clearly by the name, they specialize in kids' cancers, right, is they perform very rapid, very comprehensive genomic and molecular profiling of each and every individual child's tumor. And they punch results in 24 hours. They have a database that taps into every drug on the global market, whether approved, used to be approved, or currently under investigation. And the outcome assigns the child to a drug, right? So what they're getting to the point is they're identifying actionable genetic markers, and from that, they're coming out with very tailored, very effective, at minimal risk, targeted therapies for the child. Doesn't matter where the drug is in the world, they can get their hands on it, right? This avoids ineffectiveness and unnecessary risk to the child. Most of their children are under the age of 14, right? So put it another way, rather than the normal one size fits all and we put people down that various type of oncology progression, this is trying to fast track to which is the drug gives you the best exposure efficaciously and with minimal risk. So this takes me to, where is AI? And I'll be honest, I'm a fan of AI, but I'm going to also say in the same vein that we're at very, very, very early days. It's not there yet, right? And we need a balanced approach when we look at this. Bear in mind what I said before, a number of patients use AI for autonomous diagnosis, and we're simply not there. Where we do see AI used is software as medical device, such as imaging. In drug development world, target identification, lead optimization, PK and tox, predictability modeling, very little in the clinical trial design stage, but more so in the patient optimization and stratification areas, right? And we see the FDA today using it more so in change control plans and to some extent in drug development support. Where we're not seeing it at the clinician level is autonomous diagnosis, and this is due to what would be narrow, non-representative data sets to either the clinician's patient cohort or to a trial cohort. Validation gets a little bit wonky, especially when we start looking at using AI in actual clinical design or clinical trial execution, right? And there's algorithmic fragility, you know, where it's not aligned to changes in practice or population changes, such as what we saw in COVID, where everything seemed to change overnight. When we ask why, my group comes back to me and says AI has a number of significant limitations around privacy and consent. So that's obviously my legal team throwing that at me, right? Quality of data sets and algorithmic bias are very questionable. More so what keeps coming back, and this is more so from my friends in university, they keep talking about this thing called a black box. And when you get to the guts of it, they don't understand the AI decision process. And if they can't follow the AI decision process, they can't validate it. This is a problem that's been echoed at TGA, FDA, Health Canada, and EMA, which are the four major bodies that register most of the drugs that we see around the world. Okay, so where do we go from here? We frame up the challenge. First, we need to accept what's happened with chronic diseases in the past hasn't worked. We need to look at a new way in approaching it forward. So if we look at the fact that these are clustered, these are upstream driven, and these are accelerated earlier in life, But our current healthcare model is optimized to late stage single disease prevention. If we don't do something, the consequences are predictable, right? So in that, we need to look at various parallels that we can put forward, we can work towards in order to change a medical system to suit today's patient. So in that, from my point of view, from my team's point of view, our immediate steps would be reposition the patient as an active participant. We still have too many patients that are along for the journey, but not responsible for their own journey, right? So in that, we forget the lifestyle prescriptions and we prioritize pain, fatigue, mobility, and inflammation recovery first. We use that to get some early wins with the patient. We promote education, we open dialogue, and we build them into their journey, right? We remove therapeutic barriers, so we support innovation companies providing said innovation, right? Whether that's in med tech or drug tech or nutri-tech. And we look at ways at developing faster market approvals and access models. We have to build guardrails around misinformation. Right? I won't labor on this point. I think you all know what I mean if I put social media in the same context of that statement, right? And maybe ways in doing this is looking at some credibility marker for a doctor or a researcher based on their vocation and their research. So a reader can identify quality material versus potentially BS marketing material. And on that, I'm really pushing out to those influencers out there that end everything with, use my code and get 25% off, right? When it comes to healthcare, we've got to be a little bit more serious. We need to improve where AI works. To that, to me, a logical step for AI is to move into triage, right? If it has good data points, it can offer up high confidence triage models. From a hospital point of view, from a patient point of view, from a physician's point of view, that could be invaluable. Beyond that, I would build out the PK and tox modeling capabilities so that it can be used in clinical trial evidentiary support, right? And then I would adjust insurer protocols so coverage offers flexibility and coverage rewards and incentivizes prevention because we're not doing it. Longer term, we redefine and treat chronic diseases as a cluster and we jump into quality of life matters first and foremost. We build out precision care models because every patient is different. The cookie cutter doesn't work anymore. I can remember when I studied medicine, everything was flowchart. If, and I was lucky. I had two good profs in my early years who rewarded us to think about the model, not regurgitate the model. Right? And I see some people nodding, so I think they get where I'm going with that. Right? We focus AI on becoming the clinician's co-pilot, not replacing the clinician. Right? The clinician is always going to know information about their patient population that is not going to be in their records. Right? We doctors are the worst record keepers out there. Our insurance companies like to remind us of this periodically, right? But knowing intrinsically that person is key. So I think the best step AI can take is become the clinician's co-pilot and move forward. Last, I really do believe we need to redefine what food is, not this ultra-processed stuff that we have today. So here's your tailwind. I grabbed these from social media a couple of weeks ago. The headline is 1 in 3 children have chronic diseases. The other one from News 10 back home in Australia is the city of San Francisco is suing Nestle, Johnson & Johnson, and every other food manufacturer under the sun for poisoning people in their city with foods, right? So closing remarks, I want to be honest, if chronic diseases were a startup, we would have shut it down years ago. That's the corporate side of me speaking, right? They have terrible user outcomes, catastrophic economics, zero scalability, and a product roadmap that it just starts far too late. But yet, to be perfectly honest, it's one of the fastest growing industries on the planet. So in saying that, we don't have a chronic disease crisis, we have an upstream neglect crisis. This is where we have to change to, right? So here's the uncomfortable truth though. Most chronic diseases are not discovered, they're allowed to mature. I think deep down we know that. So if we address these signals now, if there are ways that we can restructure health policy, we give our patients a fighting chance. Real innovation is about designing delivery as well as the drug, precision that replaces averages, functional matters more than biomarkers, and prevention is more profitable than progression itself, right? So outside that, I personally believe if we don't redesign healthcare intentionally, chronic diseases will continue to scale at fault. And unfortunately, unlike technology, biology doesn't forgive bad architecture. Ladies and gentlemen, references are there. Thank you very much. I can see the URL wasn't dropped in my presentation. If you email me, I'm more than happy to give you a copy of the slides. Cheers.
Good job. I'm telling you, you did a really good job. You did a very good job. I'm so sorry we are unable to do questions. We have opportunities for chatting. Are you able to have a question outside? We have another
No problem.
presentation.
Thank you very much.
I do apologize for that, everyone. We have to we have a next session from 3 to 3:15 that just got added. We're going to be excited to celebrate. Dr. Hall, thank you again for your topic. Up next, we turn our focus to the powerful role of artificial intelligence in healthcare. This session, Healthcare AI Enhancing Outcomes Through Intelligence, will explore how AI is transforming the way medical professionals work, enabling faster, more accurate decisions, improving patient experiences, and driving innovation across healthcare ecosystems. Our expert, Dr. Prabhu Kumar Chalagali, consultant in internal medicine and diabetes, will guide us through real world applications, emerging trends, and the opportunities and challenges of integrating AI into healthcare today. Get ready for an eye opening discussion that highlights how technology and expertise can come together. The stage is yours, Dr. Chalagali.
Is that okay? Oh, hey. Yeah. I think, speaking after a nice lunch, maybe this kind of sounds will help us to enhance, you know, become most effective. That's fantastic. Good afternoon, gentlemen. Yeah, folks. I am Dr. Prabhu Kumar Chalagali, Senior Physician, Consultant Physician, Internal Medicine and Diabetes, MD MRCP from London, and convener for Commonwealth Medical Association, London. And I deal with especially in the field of AI and digital health, which is the era of, a technology era where we need this, artificial intelligence to reach to the nations. This is where we are very much interested these days. As we look at AI, as a clinician point of view, there is a lot of, myths and doubts on AI in different parts of the world, and we see that they have a lot of questions on AI, especially doctors in different parts of the world say that, doctors are replaced or the humans are replaced from the jobs. So there's a big myth among the doctors that where we are working to, deliver them from that kind of myth, as well as, we are also telling the humans that you are not replaced because a clinical judgment is important on both sides. So when you look at this, the benefits of AI is tremendous. At the same time, clinical judgment from the clinician point of view is also very important. See, how AI helps is like, when I'll give you a few of the examples in the workflow, what we do. Generally, like, early diagnosis, when we have a lot of data, early diagnosis and predictive analysis, because when we do our radiology, like in the hospitals, a lot of reports are piled up in the radiology department and the doctor comes to write the reports. When the doctor is starting writing the reports, there is maybe around 300 to 400 reports sitting on the table, and doctor starts reading one after another. It's a big trouble for him when he's writing the reports, because the serious patient who is having a complication of acute stroke, who is having a stroke, and the image is clearly saying that he's having a stroke, but the report is sitting at 199. So when the patient report is sitting at 199, the doctor writing at starting number 1, it becomes such a terrific time for the patient that he will be sitting with the trouble or with the pain in the ER, waiting for the triage to keep him in forward. But until the report comes, they can't pull him forward. So this is one wonderful example that we have, that when we have a problem in imaging, we can keep the patient through this AI. We can bring, because AI says the doctor, yeah, see, there are some, out of your 300 reports, there are some 20 reports very important. The triage comes into action and the patient can be pulled forward. So this is a wonderful tool for the doctors to help them out to get the report first, and they can report the remaining normal reports easily and simply as it goes on. So this is one way of thinking of that. Another way, like pathological reports. Even pathological reports have a big trouble. Pathology, when we diagnose a cancer patient, a big human chronic condition where we need to identify the chronic cancer. In that cases also, we need at least 15 to 20 days for the pathological report to be read by a pathologist, and that is done again by AI in less than 24 hours or 48 hours. So that's another point where you see that in 48 hours we can get the report. So in this way we can make, and as I told you, as I work with a lot of countries, about 56 in different parts of the world, where medicine is unable to be, reaching to the neediest parts or needy parts of the world, where there is rural, tribal, and unreachable areas. In these areas, smart health AI clubs can be useful, and these smart AI health clubs can help the patients get the treatment faster, easier, and they can come before that AI and get a real-time reading of their hypertension, glucose monitoring, and a lot of stuff. And this importantly immediately triggers the doctors on the other side and look at that reports, and they can help the doctors, they can help the patients immediately by giving the treatment. So this is the way where we can cut down the administrative process. Even the visiting of the doctor to the patient, and people may sometimes really need to travel miles and miles to reach the doctor. So all these laborious process which we see in treating patients in our regular practice can be cut down. So in these circumstances, we have come with a brilliant thought called Neurexia Health AI, which is a brilliant thought of Bhuvan P. Raj, who is the co-founder of this Neurexia Health AI, where this system, where this software is bringing together all the ends, meeting all the ends, and makes the patient life easy and the doctor's life easy. This is where we are looking at today at this process. So I welcome Bhuvan Piraj at this point of time to come forward and have a discussion with me on his Neurexia Health AI revolutionary healthcare, a game changer in the healthcare. Come on, Mr. Bhuvan Piraj. Thank you for giving me this opportunity. And I know that healthcare has a lot of pain points. And now you can hear me. Sorry. So I think I have a mic. I'm sorry. So yeah, so I've been working with the IT industry more than 20 years, and I went to different, financial industry. A lot of them are broken. There is not able to sync it with that. But at the end of the day, how we can sync all those uh, systems integrated, get the right data so that we right results, right way of, reducing the burdens and all those things. So based on it, the healthcare side, I've been industry healthcare is 4.5 years, but my brothers, my uncles and all, those are all doctors. They are experts in their world. So I'm an engineer guy. So I take their all inputs, and this guy is also helping me all those pain points. We put together, we built the Nurex AI. That is the one we called it as it's a clinical hub, intelligent hub for the revenue transformation. So basically, when you talk about, every year the U.S. is spending $5.7 trillion just healthcare spending. In that one, it's a $934 billion is wastage. So $934 billion is every transaction is 40 cents for dollar is a wastage, meaning in the sense processing all this process, the administration and back and forth of all these activities, the patient won't get the treatment properly and all these things. So the idea is why won't you build such a wonderful platform to game changer? So I have my background is, as I said, I'm a enterprise solution architect. So let's take this all the use cases. We build a platform unified way to connect all the angles of the modules data to make the better shape of the system. So in terms of how the AI is working as a human, basically all the works will be do with as a human, but human in the loop. So the decision will make by
the humans only, but it's not by the AI. So AI will help you to do all the processes, and the human in the loop side, the human will take the decision for that. For example, you have a GPS, right? Everybody follow the GPS. Like if you want to go somewhere else, so the GPS tell you take left or you can take right. Depends on the instructions, right? You follow that, you go with that. So similar way, this will be the directions. It will help you the all kind of angles. Like when patient come, what are the areas of he has pinpoints? All those will be covered. And also like when you go to the doctor or nurse, they also speak with the the patient and all those information through the system. It will help you to get the what is the right side of right things of the treatment and all those things. It will help you to streamlining the process because of and also like in a headache with the insurances, like you don't give the proper paperwork, what will happen? Like they deny your insurance. So the patient will upset. Right? What happened? I have a good insurance. Why it is? So somewhere it's a manual intervention, a lot of issues. So we need to be consider those. The AI will work with you to help you to reduce all these processes. Let's go to the next level. Can you run a little bit more slides, please?
No.
See, I think I already mentioned. I got a couple of more slides, please. Okay. So as I say, like the traditional way, like every hop and who. So they have to use the administration activities like similar way, like when you work in the administration activity, one case like in a couple of people, 4 people, I don't know how many people work on that. But at the end of the day, that will solve like it take like 1 month, 14 days, or 15 days, or 6 months, or you never know when it is going to done. But these all the factors, all the areas of the workflows work together and help you to give you the better results for you. So that was my system. It's a game changer. We taken all use cases for a different world of the different part of the world, and we used all those things. So what is the game changer? So you see this, Nurex AI is a unified AI-driven intelligent hub. So it is like a transforming clinical revenue through the intelligent automation and a real-time consistently. So the real-time consistently mean it's worked with every angle of what the work needs to be done parallelly. So it's not be like wait for the next level. It works with the parallelly so that the guy will, whatever you want to do it to the same level, it go to the insurance guy, it go to the insurance, it go to the case manager, it go to the case manager. If it is a critical, you have to go to the hospital, it connected to all those dots. It help you to the streamline the customer get right treatment, right time, so that it, the end of the day, I want to save the lives. So that was my motive. And it will also like help you to bring the revenue. So nowadays, like what happened, like when wastage is like $934 billion, which means like a lot of money. How to get that money? So what is the angle of it? So what is the angle of it? So in terms of, so our system is, this is our system. It will connect to all all areas. It help you out it brings the revenue for every corner wherever it is you look the any opportunity or anything, it brings their revenue for that. So these are the specific some of the under the decision making, the AI powered decision engine, which is work like a human to help you to all those processes, and the let's go to the next. See, the intelligent layer is help you to all the processes. That's what I'm saying, that it is like in a around like in 100 and plus workflows working under, and also like in a 100 and plus AI agents. Like agent is like like a human. You have a boss, you have a manager, you have a the subordinates and who are there, and it's give a direction, so that direction will take and do their activities, action, task, and everything. That was the intellect way to run the processes for the whole system. So before and after, you see the traditional way, lot of Manual process is landing like a crazy chaos. So doctor get crazy. What's happening? Why I'm taking too much time on this particular case? So these things will taken down by our Nurex AI. So the AI will, everything is automated decision-making process for you, all your processes. And now the global use cases, yeah, I told you, I have a background of my brothers, my uncles and all. I work with them and bring them that different kind of use cases. So it helped me to boost this particular platform. So you can see that the use cases like, denial and prior authorization. That is the one top priority, $234 billion just for that. Imagine, that's a lot of money. So the solution is like, we want to be utilizing the AI driven so that that comes under another 24 hours, which means, can you believe it? If it's taking like a months and months, I'm doing for one day. That is the greatness of this system. So think like similar way to India is a very highly populated country. They don't have, what I mean to say that there are a lot of patients. Or doctor is one or two or three. They're not able to, complete the whole task because of a lot of paperwork. Who every time like they need to take the register and take the names. Whoever comes first, will get the. But what about others? They have to go home again. They need to come back. So this is, I want to reduce it. I want to make a systematic so that they'll get their turn, they get their treatment, they get the patient will have all kind of support. That's what I mean that. And not only that, you can you go to the, so even Canada,
Australia.
UK, Middle East, Australia, everybody has a different pain points. Different points. I have 1 minute. So these are the specific category which is utilizing the product positioning, innovation, security, and scalability. These are the specific drivers. And also you see the business impact, 40%, 35%. And I think that's the last. Yeah, these are the phases of implementation when we run the whole process. Because you take the pilot and run it to observe the whole process, and you take it to the next level, you do the very maturity level of this. Okay, so what I would say, like, looking for the better people who can, like, same kind of mindset, who can work with me, help me, strengthen me, so that we can reach across the world. My platform is connected anywhere in the world. That was the message I want to give you. Thank you, guys. This is a
Yes,
wonderful platform.
Mr. That's wonderful. Now, your Neurexia Health AI is going to impact the whole nation, as you say, and the countries by decreasing the administrative process.
Yes.
And it triggers both the doctors, insurance companies at a time.
Yeah.
Real time, it reaches both the people and helps them to, log in fast.
Yep.
And make
Yep.
the decisions fast, so that your denial in the insurance companies reduces. And
Yeah.
the bills
There
for the
is no-
doctors also, like, doctors like us get the bills back
Yeah.
on time.
Yeah.
Because generally, even the patients get the bills back after your insurance done.
Yeah.
Your patients are asked to pay again.
Yep.
So these kind of systems can be, stopped, and the Neurexia Health AI can be practiced from any parts of the world, as you say.
Yes, yes,
So we
yes.
congratulate you for this wonderful job, Bhuvan Piraj, and
Thank
I
you.
was very much impressed when I heard all this product, and they said you want me to ask me to come to US for this and have a look on the software and inaugurate this program. So we have been doing this from past few days, and it was lovely that we have an opportunity here in Health 2.0 to come, and this is the way we are here, and really. Neurexia Health AI, I wish you all the
It's
best,
the
and
game
really it
changer.
helps a
It's
lot
going
of
to be true.
people over the world to do the best in the field of, and the beauty is it reaches the needy parts of the world on this earth.
Yes.
Anywhere on this earth you can come down and get the treatment done.
Yeah.
So that's what Commonwealth and Indian Medical Association, we both work on, like, to reach the people and give the medical care. And this kind of apps, we really encourage them. Thank you for the time, and thank you, Malaika. I know that you're looking at us. Your time is up. Thank you very much.
Thank you so
Thank you
much.
guys.
so
Thank you
much.
so much.
I'm
And
so
thank you,
grateful.
guys. It's a wonderful time, and I know that this is going to be help you everybody. And I want to save their lives. That's what is the matter. Yeah.
Thank you so much, Dr. Chalagali and team. We're so delighted to learn about this and the potential use cases. We're moving on to our next session, the hormone mind connection, integrating mental wellness into holistic health. Hormones play a huge role with even more than we realize, influence how we feel, think, and how we show up every day. Our upcoming panel discussion brings that connection into focus. Let's welcome our incredible panelists of experts, as I call their names. Please hold your applause to the end. Kathy McKeel. Did I do it? McKeel? Yes. Kathy, almost closer. We have Somyara Saxena, Rachel Jarmus, Amy Elohim, Patricia Martinez, Brian McCullum, and Heather E. Gazjak. Please give a warm round of applause for all our panelists. And as they come up, if someone wants to do a more formal introduction, or I can read everyone's, yes. All right, so I will continue introducing everyone with their titles. Kathy is a health and life coach, business strategist, and legacy builder. Today forward, wave at the crowd, Kathy. All right, we have Samyara, CEO and founder of the Garden Recipe and the Garden Pooch. Wave. Wave at the audience, Samyara. Wave at the audience so they can see you. Yes, so we're just kind of getting faces. Amy Elohim, owner and founder of Restored Identity. Waving at the audience. We're just waving. We're saying hello, Amy. Hi. Rachel
I'm like,
Darmus,
that's me.
director of My Yoga Well. Rachel, say hi to everyone. All right. We have Patricia, owner and licensed professional counselor of the Mind Body Counseling. Brianna, CEO and founding member of Divine Empowerment Coaching. And Heather, licensed clinical mental health counselor, founder and owner of Providence South Counseling Group. Please give them one more warm round of applause.
Can you all hear me? Do I need to speak any louder to anybody else? No? I'm going to stand here because I'm going to read off of this, and I don't want to be like this, if that's okay for everybody. But welcome. Welcome to the Hormone Mind Connection. We're all excited to share with you our knowledge, awareness, skills, approaches to how we approach this topic. If it's okay for me to start, I just want to acknowledge it's been amazing, and it is such a breath of fresh air to see how many people are aware of the mind-body connection. Salud, bless you. Because our minds and our bodies are intricately connected. No system exists in our body without working in correlation with another system. So that whole mind-body connection is incredibly important to be aware of. Our minds are a neural network of experiences that we've lived through in our lives, and every situation that we approach, our brain is either looking to our past experiences to make sense of it and how to respond to it by communicating through our nervous system or communicating through our endocrine system, which is the part of the system in the body that regulates and modulates hormones. When we have these internal experiences, it influences our emotions, our physiological states, and if we're not aware of what we're feeling and what our thoughts are, our bodies and our minds just function on an autopilot. Somebody in here had a mind model that illustrated we spend 90% of our time or use 90% of our automatic pathways, but 10% of our intentional living. And that's designed for a reason. We can't go through our lifetime trying to think about everything that we're doing as if we're learning it for the first time. So that whole automatic pathway that we have is intentional to help us. Just when we learn things that aren't super helpful, even though in the past they might have been, it tends to hijack our automatic functioning, leading to more illness, leading to dysfunction in our social lives, in our intimacy, in the way our immune system works. And so we have a panel of experts who are going to share with you today how they use their approaches for this mind-body connection and how they achieve healing within themselves and within their clients. First question. What is happening from your experience and the work that you do? What is happening in the body when our inner biology quietly rewires how we think, feel, and function? Anybody want to answer that first?
Yeah, that's actually a topic that I'm very passionate about. Can everybody hear me okay? So there's a lot that happens in our minds that we're completely unaware of, and a few speakers have already spoken about that, where there's generational trauma, and then there's birth trauma, and then there's the things that are wired in our brain, and then our natural hormonal processes that happen as we age and become teenagers, become parents, go through
aging later on in life as well, but also our day-to-day activities that we do massively impact our internal landscape. So just our breath, the food that we put in our body. And at the end of this, something I would like to do is welcome everybody to do a breathing exercise with me if we have time. But everything that we do, what we tell our brains, they're like computers, right? And we're the programmers. We give it a command, it says, okay, let me find proof that this thing exists. And we are just constantly, okay, they're gonna turn off my mic, I'm the problem mic? Okay, I am the problem mic today, folks. It's not me, it's them, it's not me. But we have all these neural synapses that are being created like internal highways in our minds, right? All day, every day. And when we become mindfully aware of those neural synapses, that's when we can change the pathways. That's when we can create new patterns and we can actually impact our hormone regulation as we do that. We can change how our cortisol is released because that is a chemical process that happens in our mind. We can change how our hormone balance or imbalance is happening by being mindful of our body and our minds. What's happening? Why is this happening? Is this an emotional trigger? Is this a hormone trigger? Is this an external trigger? And then we can dig in from there. Right? Well, you have one.
Oh, yeah.
Yeah.
Can I piggyback off of that just a little bit? Everything she said, but just to say, like, our inner biology is also determined by our outer atmosphere. So I have women who are obviously, like, they're in toxic relationships and their hormones are a wreck. Well, what happens when they remove themselves from the toxic relationship? The hormones can actually just naturally fix themselves. So it's just taking a look from the whole perspective and just, filling in those gaps.
I was just going to say, from the perspective of a stroke survivor myself, I had a stroke when I was 25, so kind of have lived my young adult life being very disconnected from my own body, right? And within my own recovery, just trying to put the pieces back together, and went through the process of medical treatment for over 10 years until I finally found yoga that helped me restore this connection that we're all talking about, right?
Yeah.
And now have created a nonprofit that is helping brain injury survivors, trauma survivors restore this connection, because that mind-body connection is pretty much everything. And I can see in real time doing yoga with somebody that is paralyzed, their limbs coming back to life, and seeing that actually play out, like, oh, that reconnection is actually happening as we're sitting here doing breathing, asana, mantra, mudra, anything, right, in that mindful category.
I'll piggyback off of that. My background started out with me growing up on a farm and seeing what foods they were feeding our cattle, what they were putting into the ground to grow the harvest, to feed the world. I went to computer school, and everything has an if-then statement. That everything is a 0 and a 1. What I put in is what I'm going to get back out in essence. And so going from that state of what am I putting into my body? What is that hormone disruptor? So I always relate back to the real daily news, the nutrition, the exercise, the water, sunshine, and sleep. That's what our pets, our people, our whole community needs. And so that's where I focus on for today forward consulting. What life skills, what foods, what nutrition supplements am I needing?
Yeah, I spoke in my panel earlier, my journey. So I just want to just say briefly that when I had bleeding for 3 years from ovarian cyst, and then it became into ovarian cancer, I can tell you before that, my whole life after 10 years till that point was running on survival mode, okay? So it is where you think there's tiger in the room and it's focused on you and you got to save yourself, okay? So we don't realize at that point, my dear friends, that there's no tiger in the room. It's your mind. And to turn that off has a big connection with the way your genes are also turned on, the wrong genes. Like we want the oncogenes off. So it is like, why is the tumor gene turned on in somebody and not in someone else? Because they may be in survival mode sometimes, but not over excess cortisol. So I would say when I had my cancer and before that, I had severe anxiety, and I've shared in my journey, I had brain fog. I had severe tiredness. I didn't want to go to work, but I used to drag myself. And of course, I had bleeding for 3 years. So when you have insomnia, your mind is on survival mode, your genes are getting that signal that there's tiger in the room, keep on watching, we cannot relax and we cannot sleep. Sleep is the foundation of everything, along with the sunlight in the morning. Your body is going to create havoc on hormones. Thyroid hormones are important as women and even for men. And that's when everything is in internal chaos. It is haywire. So I would say for me, healing my journey and being 12 years cancer free, and then launching a 12-week program for women where I teach the same things, like look at your laundry detergents, what you use. Does it have dioxide? Do you use those fabric, air fresheners, the toilet bleach cleaners that we are told to use? Do you use any of these things because they are disrupting your hormones? And they all have to go. Bye-bye. We go back to basics, we go back to nature, we go back to what our grandmothers were doing and teaching us. That's it. So this is something that I wanted to bring it from my cancer perspective and my own journey with teach to women. Yeah.
Hi, do I need this? No,
You're good.
Okay. I'm going to build on that, but take a little different path. And I have notes because this is a great passion of mine. And will be here tomorrow morning if I don't follow some kind of notes. So the place that I see a lot of the hormone mind connection is in teenagers and puberty. And there's a rapid hormone shift. It impacts the amygdala. It impacts the frontal region. It causes, to build on that, increased threat sensitivity, fight or flight. And the frontal region is still developing regulation. So, of course, there's not much regulation there as well. So it leads to anxiety spikes, emotional intensity, and distressing intrusive thoughts, and that's really what I want to focus on. I'm seeing it more and more in the teenagers. I see teenagers and adults, families, but it is becoming more prevalent. I've been in practice for 25 years, and so I think there's a need for this awareness. So these hormones impact how the brain processes fear and emotion. The brain becomes more sensitive to perceived danger even though it's not there. And these thoughts aren't random. These distressing, intrusive thoughts, I like to say distressing, intrusive thoughts instead of like aggressive OCD or something like that because it's distressing. But so the brain becomes more sensitive even when there's not any danger. They're not random and they are often shaped by what teens are exposed to. It's the content, it's social media, it's hard there's a lot we can do, but then there's a lot we can't do about that. So, but it is. And so that's our reality and that's what is happening in their brains. One of the things that I think we're missing is in this field is talking openly about these intrusive, distressing thoughts, and especially like harm-related OCD. I'm seeing the trend for like a lot of suicidal ideation, depression. There's a lot of shame. A lot of these kids are like, oh, sorry. I don't want to tell anybody because they're going to put me in the hospital or they're going to send me off because my thoughts are very scary. And so they begin to believe that those thoughts reflect who they are. So what we see is this shame, isolation, but we can name it and we can normalize it and we can teach each other that this is a real thing. And our young people, I don't feel like in my generation that we had we didn't have the exposure. I had Young and the Restless, but and a little TV, but so I think helping name it, normalize it, asking the right questions so they can understand what's happening instead of like turning it on themselves. Now give a quick example, which kind of got me on this. Just recently, I had a teenager who I had seen for years, but like in a different setting, And I started to pick up on some things she was saying. She was kind of in crisis. And I learned after asking the right questions that really she had had some OCD as a child, of course, but it just was probably kind of cute. No one really paid attention to it. But she had, with hormones, she had watched a YouTube video that was violent, that was a person, a young person who committed murder. And so whatever caused it, maybe she didn't have much sleep, maybe stress level, hormones, but that became the thought. That became the intrusive thought that she couldn't get out of her mind. And this is neurologically based. And I think it's really important to open this up in discussion for parents and clinicians and doctors to realize what our young people are really going through when they are predisposed to something like OCD or just anxiety when the brain starts doing different things caused by hormones, anxiety happens.
Absolutely. And to maybe even kind of review the topic before we move on to the next one, what I heard was an excellent example of like the women in those relationships or overcoming an illness. It puts the body in such a state of stress and regular functioning that it does become normal. And then with the example that Heather gave with the children, the bodies become overwhelmed and we can develop things like, you can't hear me? How about now? Okay, so just to tie up the topic before we move on, there were some wonderful examples of how life experiences from relationships to overcoming medical issues can put the body in such a high state of stress that it becomes almost a normal pathway. And when you were talking about slowing down with the breath, what that does is it allows us to connect back to ourselves, because in those situations, we have to detach from ourselves to get through it. And what I also appreciated was that it was tied to how these ongoing situations that aren't addressed, or we get these messages from people close to us or who we rely on, might be afraid of what we're talking about, then we isolate to protect others, but we suffer more. And then we look to more extreme behaviors to address it, like suicide or addictions of any type. And then it just gets worse from there. So great job, everybody. Thank you so much for putting that all together. And we will segue to our next question. How can emotional resilience and physiological shifts lead to chemical changes for improved cognitive clarity, mood, and motivation?
So when my journey, when I had cancer, and like I said before, 3 years of nonstop bleeding, not knowing when the universe, God will stop this bleeding and what's going to happen next, I would have to say, for me, what helped was getting out in nature, because I had to switch my mind from that, well, the tiger is right here, it's about to chase me, to it's all okay, universe will take care of me, I'm all okay, my dogs are okay, my loved ones are okay, and seeing the reality what it is. So I would tell myself, stop thinking negative. Look at the reality right now. You're in a park, the sun is shining, your dogs are healthy, they're playing, and your loved ones are okay. And so just observing the reality shifts the mind back to come back. So I would literally tell myself, dealing with my nonstop bleeding and when the cancers finally came, that I would tell my mind, I don't need to think in my survival mode, come back to the present, giving my mind instructions, because there's a famous saying, the mind, I don't know if you remember the saying, mind can be a wonderful servant, but if used wrongly, it can become a powerful enemy.
Yes.
And that happens when we let the mind control us instead of us controlling the mind. Because body is, the language of the body is emotions, the language of the mind is thoughts. And getting the mind to listen to us and training it and saying, no, there's no tiger in the room. You know what, come back to this moment, go into parasympathetic mode, and I'm going to give you the instructions, and you're going to follow it. I'm not going into anxiety, I'm not going to have cold feet and hands, I'm going to enjoy this moment. That was then when I was surviving, now we are thriving. Reminding myself again and again and giving instructions to my mind and body to move from that to the present and not listening to it anymore. Over time, you keep doing this.
that is when your body starts relaxing and your mind starts relaxing. And once that happens and you improve your sleep and you're taking actions in your daily life, like you're getting sunlight, which is very important. You're having like grounding techniques, walking bare feet on the earth, and you're eating holistic meals. You're not eating processed or low vibration food. You're drinking water, but you're praying to the water molecules before you take them in. These all are ancient, and the modern world will say, oh, who cares? No, this is where we need to go back to. This is where the wisdom is. This is what works. And I talked last year in the panel, when I finished the panel, praying to water molecules and saying, you know what, I'm abundant. I'm so happy and calm. And thank you for taking care of my mind and body. And then drinking the water. It changes the molecules, as opposed to having.
Like the doctor, what was his name, Masato Emoto?
Yeah.
Anybody else on the panel heard of Dr. Masato Emoto? What are your thoughts, Amy, that kind of bring to?
Well, I'm huge on this because I believe that life and death are in the power of the tongue, just like scripture says, and that as a man thinks in his heart, so he is. So there's so much to just thoughts. And I just tell my people, like, if all of your thoughts have led you to a place where there's still bad thoughts, have another thought. Like, keep thinking, you know what I mean? And surround yourself. It's all about your environment. It really is. It's impossible to thrive, like even in those experiments where they put the bread out and they talk bad to the bread and the bread turns moldy, but the bread that you talk life to stays alive. Same thing with the water, same thing with fruit. How you speak to yourself, to others, it's an energy. It's a thing. It's a frequency.
Right, and that mind-body connection, your brain is telling your body how to function and what hormones to release and what nervous system state to be in. And so you were going to say something.
Yeah, the biggest cue that our body has for what's the thought connection to our mind, from our mind to our body is what? Our breath, right? So if our breath is shallow, danger, right? The body is interpreting danger. And so the simplest thing that we can all do without a device or without AI or anything is to just take a moment and breathe, right? Drop into your breath. And as simple as it is, working with stroke survivors, that is the big, and it's like something that they've never been told before, because the medical community is just shooting drugs into these people, and the population is it's so sad to me, because it's such simple tools like walking barefoot, sitting outside and connecting to your breath, the one thing that we always have with us. You don't have to buy anything. You don't have to go to the store. You don't have to pull something out of your pocket. It's literally right here with us, and we can sit and just connect to that. And that's yoga, really, is the union and the connection of that.
And Brianna was saying something about the breath earlier as well.
Yes, and also in relation to resiliency, because that is one thing that we were talking about with the breath. That's a part of building resiliency, because the brain is a muscle, right? So we have to work out that muscle like we would train any other muscle in our body. And breath work is such a huge part of that, because we've talked a little bit about going into parasympathetic versus sympathetic nervous system, that fight or flight space. And our breath controls everything, because when we're in danger, we breathe in really quick and out, and that in, out, so that our body's ready for that fight, flight, whatever needs to happen. But when we're mindful and we stop and say, oh, I'm doing things, and even if you don't know what it is, that's fine. My body's doing things, and I want to stop doing the things. And just 4 seconds in, 4 seconds out. Or box breathing, 4 seconds in, hold, 4 seconds out, 4 seconds, hold, 4 seconds, and then I'll do a different one it'll drop the bottom out of your nervous system and just completely decompress you. Absolutely. But it's powerful. It's a powerful tool. Yeah. Mobile meditation all the time.
Yeah. I will follow up with that. So going back to the real daily news, I suffer from asthma and allergies, and they're mainly environmentally induced, but I grew up and there was smoke from my grandparents. Outside allergens. I got the allergy test. It said I wasn't allergic to horse or pigs. I'm like, really? Thanks. So anyway, I use a lot of food, nutrition. There's different foods that I provide through my clinic through like 12-stage sessions that help release all those toxins. And there is, every day you wake up, your pH gets changed from the food or the drink or even your first kiss. And so going back to the days of Disney You know, those movies, if you just go back to your childhood and say, okay, if I'm a 2-year-old and I ask my parents why, what's that answer going to be? They're going to tell you, are you hungry, or ask you, are you hungry? Are you thirsty? Do you need to go outside? Do you need to sleep? It goes right back to that real daily news of decompressing. I would get up from my 8 to 5 job and go outside and I would walk with the dogs. I would look and just say, hey, I'm alive, you're alive. I would come out of the customer service realm and say, oh my goodness, this just happened. Go ask the questions so that you're prepared for that next session, um, and be prepared for the next life. I've almost lost my husband 3 different times. And so if I say anything that triggers you, just know that it's triggering me at the same time. I'm thankful that he's here today, but we've been teaching our kids how to transition and take over what we can't do for them later on. You fill out the paper. If you have a question, come and ask us. So if you don't like the answer that some of us are given on the panel, or if you resonate with one or more of us on the panel, get in touch with us afterwards as well.
Absolutely, thank you. And just to kind of, oh, I'm sorry, did somebody else have something they wanted to say?
I do.
Go ahead.
Yes,
Absolutely.
just to also build on everything you guys are saying, which is awesome. Um, a lot of what I do is education with the panic, with the fight or flight, because that's very scary. And the blood goes from your head to your heart and lungs, so our heart can beat faster, so we can get out of the way of danger, out of the way of the tiger. And our GI system shuts down temporarily, so we have the energy to get out of the way of danger. And so that's what causes these, butterflies. Some people actually throw up. But all of that's happening is very, very scary too. And so I think knowing what's happening, that everyone experiences it a little differently. Like some people sweat their hands, some people get jittery, because when you release those stress chemicals, you're not running after a tiger, you're not running around the block, you're sitting there, and those stress chemicals really cause very uncomfortable, yucky feelings. So what I wanted to add was, like, the brain is trainable. So with neurofeedback, we can shift the nervous system regulation. We can do it, like we can shift the cortisol patterns, the frontal lobe engagement. It's really a great alternative therapy. But then also with therapy, with nervous system regulation, like breathing, and just knowing your body and being really in tune with that. And then neurofeedback and biofeedback. We do have a lot of different alternative therapies that is very exciting, and it's emerging. And then even things like reframing, like for instance, I call it distressing intrusive thoughts rather than what it is in the book. And just to go on the teenage part, the brain gets really sensitive with hormones, speaking on the hormone one, and our most empathetic kids are the ones who are having the most distressing thoughts. And it actually, research shows that they would actually do opposite of what the thought is. So neurofeedback is something, yeah, it's very interesting. It's very interesting. And yeah, so what looks like overthinking is really protection, just protecting ourselves from the dangers out there. And the teenage hormones make the brain more sensitive and feel like everything. And so does menopause and all the other times in our life.
Absolutely. That was a wonderful point, Heather.
Yeah.
Thank you for adding that. And so just to kind of summarize, the return to self, that education and that learning that what you're feeling in your body actually has a message doesn't leave us feeling powerless or afraid of what we feel in our body. And the more you get to reflect on yourself, connect back to the self, and learn through education, you can start to recognize what the body's telling you. Somebody had mentioned the body talking to you. I think in your last panel discussion, and really our bodies are talking to us, but only if we learn to see it that way, which is why that whole mental capacity and understanding and removal of fear is incredibly important. Because once you're no longer afraid of your body, you can do things like go out into the light, and that light's going to help with cortisol reduction and help with sleep. And the other one was diet. When we have high levels of cortisol in our body or stress hormones, our body is going to digest our food and process our food differently, and we're going to have difficulty with our self-discipline in our diet. So all of those things really do matter when you recognize that you do have power over your thoughts and you can change the things that we've had to adapt to. And all of the panelists gave wonderful examples in how to be able to reconnect to the body, learn, and apply what you've learned through your work to help people's bodies realign. And our third and final question, from your knowledge, experience, and work that you do in your fields, what are some of the holistic, innovative practices you use to create a personalized care for emotional, physical, and behavioral well-being in the people you work with?
Work our way down.
Absolutely.
That works.
Yes, I am so sorry.
No, that's fine.
I skipped somebody. So yeah, if we can go down, that would be great.
Yeah. So with stroke survivors, like I said, it's all about the breath. But using yoga as the ancient tradition, we use mantra, meditation, mudra. There's actually a brochure on all of your tables about My Yoga Will, about the nonprofit organization that is sharing yoga with these brain injured folks. So if you want to take a look at it, find our website or reach out to either of us. The co-director of the organization is here, Christine. She is a specialized population yoga teacher and really just doing great things. So there are lots of tools, but mantra, meditation, breath, yoga asana, all types of things, right?
Yeah.
Continue.
Yeah.
I could talk for like the whole time about it, but I will not.
So at Restored Identity, I saw a hole in the market when I was trying to restore my body. I noticed that people will give you either one product and no information that goes along with it, or they'll just not really tell you the whole thing that you need to know. They don't tell you everything you need to know, and they'll they'll gatekeep, they'll hold information. So I just wanted to make a company where people could come. It doesn't matter. We've figured it out. The good Lord gave me the answer on restoring the body from disease. We have 14 people so far who have restored their body from stage 4 cancer. We have women who were ready to commit suicide and just took some of our hormone supplements, and now they're preaching from the choir and selling it. One of them was a hairstylist, and so anyway, long story short, it's really simple to restore the body, and there are people out here like us who exist that really want to help you through that process without ripping you off. Everything we do is for free too. Like, you can call us, you can message us. We will point you in the right direction without charging you $1,000 to ask a question. So yeah, that's us. You're welcome.
And so I have a private practice and I do traditional therapy, but then more recently I've brought in QEEG, quantitative EEG, which maps the brain, and also neurofeedback, which I've seen like awesome results. But we do have a way of seeing what the brain is actually doing and seeing what parts are not talking to each other correctly, if the different sides are not symmetrical. Also, for an example, like there's an ADHD pattern where it shows low activity in the frontal region, and that's delta, shows a lot of delta. Well, delta is the brainwave that we use when we sleep, so we really don't want that there when we're awake. So then our feedback is the training of that to regulate. But I think it's exciting, it's emerging, it's all research backed, all science-based. They actually take the same system as the heart. Oh, sorry again. The heart EEG, and we just look at the brain the same way.
So I think that's very exciting, and hopefully more people will look into that. Oh yeah, and then we stop at, so then when we put hormones, brain function, and environment and collaborative care, then we stop asking what's wrong with this person, and we start saying like, what's the system trying to do, and how do we support that? And we can all work together with all these amazing.
Great, yes.
I could geek out on this topic all day long
Yeah.
too.
That's why I
And
have
she
notes.
lives right up the road from me, so we are going to be talking more.
Yes, that's
Uh,
amazing.
so Brianna with Divine Empowerment Coaching and LMH Custom Teas and Herbs. Divine Empowerment Coaching is my full circle path and purpose work that I do now. And it started out as LMH Custom Teas and Herbs, which was more holistic health. So the specialization that I do now, I'm a professional cat herder, essentially. And what that means is people come to me with their issues, whatever they are, and there's always that trinity connection of mental health, physical health, spiritual health. Something is out of alignment, and we just need to pinpoint what it is. And with tools like a lot of these ladies have shared that they have, that's how we find our pathways, and then we find the actual issue that needs to be addressed as opposed to throwing medication at it. I equivalent it to, you don't want to put on a blindfold and turn out lights and then throw some darts at a dartboard, especially if your friends are around, because you might stab them and it'd be awkward. So I do a lot of that, just getting all the information as a weaver. People throw threads at me, I weave it together in tapestry, present it to them, and say, okay, now what do we do with this?
Yep.
So there's a lot of woo-woo and a lot of science, and then a lot of physiology that goes into the work that I do. I'm also a Reiki master, so I do bring the energetic component into it. And a lot of people, they don't really do the spiritual side of things. I live in the Bible Belt, so a lot of Bible Belters are like, yeah, Bible, Christians, no, please, and they run away. So I don't always approach it with that spiritual perspective, but spirit does run through everything I do, which gives a unique perspective, because I call intuition God speaking through our bodies, or great spirit, or energy, or whatever people refer to it as. I view it as different languages just speaking about the same thing. But it does help a lot, because sometimes I'll just get divine guidance, say, hey, this doesn't make any sense, but this is what I've been told. Let's explore it together as a team. So it's interesting work.
It's like the systems in our bodies working together.
Yeah, our body keeps the score, and our bodies will tell us what we need to do if we listen.
Yes. Thank you.
Yeah, you need the mic.
Can I have the mic? Okay. So in my work, because of what I had gone through, when women come to me and when they take the 12-step holistic program, one of the biggest things I emphasize is toxins, which we call ama in Ayurveda. And this is because when we have toxic waste in our body, it disrupts the thinking of the mind as well. And like I said, the language of the mind is thoughts, our thoughts, and the language of the body is emotions. So until we learn to tame the mind, that beast is running nonstop in our life. So I would have something like, for example, lymphatic detox, because lymphatic system is most important when it comes to detoxifying our bodies and preventing cancer, or if you have cancer or inflammation disease or fibroids, endometriosis, and things like that. So that way we are getting rid of the toxic waste, and then you will see in women that I coach, their mind is calming down. Another emphasizes that is the doctors will never tell you when they are consulting you for cancer or hormone disruptions, is that, well, how is your sleep? They never care to ask. Or if you say, well, I have bad sleep, well, I'll give you a drug that will put you to sleep. Well, it doesn't work. The drug doesn't work anymore, doctor. I'll up it up. Don't worry. We'll give you another drug and along with the first drug, and then let's see if you sleep better. That's not how sleep regulates. And this is not what anybody needs, neither a woman or a man. So I am very particular when I do coaching, and I'm very strict to bring healing, that you must have 8 to 9 hours of sleep. And I will give them actual tips. What is your bedtime routine? No cell phone, no internet, nothing like this. It is out of the question. And we are massaging foot with sesame oil. These are Ayurvedic practices from India, ancient practices, and they work. We are having some magnesium oil for calming your mind. When your mind calms down, guess what? Your hormones calm down. You are healing yourself. And in the morning when we get up, we are going outside in the sun. And then we are doing a little bit of fasting, because we don't want your insulin hormone to rise. When you eat, you're walking. I'm not having you sit down, because you know what? Your insulin is not going up, your cortisol is not going up. You're just walking around to get it back into the cells, not in your bloodstream. So these practices, they make a big difference when you're dealing with women or men who have cancer diagnosis or inflammation or thyroid or hormone issues, because hormones
are the key to preventing cancer. And I've always said it in my practice for 8 years now, the garden recipe, that if you can get your hormones in balance, you're not going to have cancer, and vice versa. And hormones, because they have a connection with our brain, and I shared in my panel, cancer cells, guys, have 10 to 20 times more hormone receptors than normal cells. Let me repeat it once more so everybody knows and remembers this one key takeaway from me. Cancer cells have 10 to 20 times more hormone receptors than normal cells. So they're competing when you eat anything. Like when your insulin goes up, they're competing for the hormones with normal cells because they are more powerful, they are more able to fight. The normal cells are not getting the food and the nutrients and the right hormones, and the cancer cells continue to grow. So that is why hormone and mind connection and preventing diseases or healing your body is very interconnected together. And this is why putting your body in parasympathetic mode, not allowing cancer cells to have the hormones, balancing your insulin and all of that, it all comes in function. So this is just my takeaway. And my last line is like body keeps the score from my own trauma that I've just talked about in a previous panel. And second thing is mind can be a very faithful servant, but if we don't control it, it can be the worst horrible enemy to us. We are always loving towards others, okay? If you bring something to me, I'm very loving. Oh, you did great. Oh my God, but do I make a mistake in panel? My mind is criticizing, Swami, you should have done this. You spoke 1 minute over.
Those
But
are very great
yeah,
points. And just in the interest of time, we want to give Kathy a chance to respond.
with love.
Absolutely, love. Love and return to the self.
Yes, I agree. Thoughts are things. So when somebody says something mean to me, I just say thank you. And there is a takeaway from it because today is yesterday's tomorrow. What I want to do in the future, I need to take that step and go. So, yes, today forward and Tioli moments, take it or leave it moments, whatever you heard today, use it, apply it, put it in your pocket, grab it out another time that you do need it. So
And if I could
hormones
say,
are huge.
yes, if I can say one more thing, this is something I tell my kids, and I hope that everybody kind of takes this away. There's going to be people who are not in a good place. They're going to respond in an unsettled way, in an irrational way. Maybe just think to yourself, what would I have to feel to treat somebody that way? That's what we tell our kids, and they're like, oh, they're probably in a bad place. And it rolls right off of their shoulders. So the mind is an incredibly strong organ in the body. And from all of our experts up here in the panel, I hope you all take stuff away from our discussion. And I don't think we have time for questions because we are done
And
with our
find
time.
me later for breath work. We can do that during networking hour. That would
Yes,
be funly
any
awkward.
questions? Yes, meet up with us during network time.
And I did want to say one thing. I don't know if you guys have this where you live, but there's a place called Hotworks, and it is you work out in an infrared sauna, and it's really cool. But an infrared sauna will get rid of like heavy metals and toxins, so you kind of do two things at once, and it's really fun, and it's great on joints too. So
Thank you so
I
much.
just found out about it.
And we hope you all enjoyed the panel and are taking something away from it.
Out with the old. Out with the old, in with the new. It's a new remix, so please don't hate. You did a great job. A great job. You did a great job. A great job again. Out with the old, in with the new. It's a new remix, so please don't hate. You did a great job. A great job. Y'all did a great job. Let's another warm round of applause for our panelists. All right. I was hoping that maybe one of our panelists who was a yoga instructor with myself might stay here, but I know we're all getting mic'd up and our next group is getting ready. I say that to say if everyone can just stand where you are, everyone stand up. It's about that time of the day. We need to get some stretches and move that body of ours. So I'm going to do my best to do this while wearing a dress. I'm going to stand behind here. Just take your arms above your head, hands, palms together. You're feeling your breath, you're feeling your lungs, and then we're going to exhale, hands down to our sides. We'll do another round of that if you feel so moved. Actually, on this inhale and on your exhale, forward fold if you can do so safely. Releasing any stress, swaying your body side to side. If you've gone forward fold, if you're just at the side, that's okay. Moving our body side to side. One more inhale. Together. And this time set an intention as you exhale, bring your hands to heart center. Set an intention for your day to be present, whatever it is you need to be well and here. Okay? Roll them shoulders back. How are we feeling? I say we got it going on at the health conference. You repeat after me. I said we got it going on at the health conference. Got it going on at the. We're gonna have a lot of fun as we follow the rules. Oh, where are they at, y'all? Oh, where are they at, y'all? I said we got it. 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 We got bright minds, you say, in the house. We got leaders, you say, in the house. There you go. We got innovators, you say, in the house. We got CEOs in the house. And the house is packed. The house is packed. All right. Give it up for yourselves. Give it up for yourselves. Give yourselves a round of applause. Sometimes we need to give ourselves a loving squeeze. As you see, our panelists are getting mic'd up. As they're getting mic'd up, we're going to go ahead and introduce our next session. Thank you again for the panelists, the women who are on the stage. Truly an engaging and profound discussion, one that we need to continue. We're now going to move into a session that starts with something we all think about maybe 3 times a day, depending on who you are. Food. For some, it's what we crave. Some, it might be something we avoid. What we promise is that we'll eat healthier tomorrow. We know that we need to eat food and maybe less of food-like products that are marketed as food. This next session is the future of medicine lies in food. Nutrition as the first line of treatment. Takes something so familiar and flips the perspective, showing how everyday choices can play a much bigger role in how we feel and function. Please give a big round of applause. I will introduce all of our panelists first, and then we can applaud for them at the end. Mudita Aurora will be coming to the stage shortly, founder and CEO of Posh N LLC. Marina Moiseyeva, founder and family nurse practitioner at Harmonious Life Family Health. Dr. Gabriel N. Digong, founder and chairman of CM Fit Global Health Consulting. And Svita Vikram, CEO and founder of Nimi Life LLC, and Dr. Roxanne A. Smith, CEO of Lemurian Healthcare. Please give a warm round of applause for our panelists as they approach the stage. Everywhere we go, people want to know who we are and where we come from. Awesome. Welcome to the stage. If you would like to introduce yourselves again, Mudita, wave to the audience. Marina, they're getting mic, no problem. Who do we have on stage? Go ahead and say your name.
Hi, I'm Dr. Smith.
Shweta Vikram.
Maria Moiseva.
And the rest of our crew is coming up.
Dr. Aurora.
Dr. Aurora is on the way.
And Dr. Dikong.
And Dr. Nia. Welcome.
Thank you. Good afternoon, everyone. Thank you all for coming to this later presentation about food as medicine. We have a wonderful panel, and we will all be introducing ourselves today, talking a bit about how we center food as medicine and to treat the chronic and prevent chronic diseases. And then we'll open up for questions because I know a lot of people have questions about food. If you don't have questions, I have plenty of questions. So then I'll send those questions to the panel. And we will share this time and the space to make sure that we give you guys a great presentation on food as the future of healthcare. Dr. DeGong, welcome. We'd like to start with you. We'd like to start with you. You can sit over there, please. Yes. You can cross the stage. And we're going to start with Dr. DeGong, who is going to tell us about his practice, and then we'll come down, and then it will end with me. Dr. DeGong.
Okay, can you hear me, everybody? Yes. Okay, my name is Dr. Gabriel N. Dicon of the CMFIT Global Health Consulting, part of CMFIT Global Group.
Maybe hold it closer to your mouth.
Okay.
Mm-hmm.
All right. So my name is Dr. Gabriel Ndaiken of the CNT Global Health Consulting, part of CNT Global Group. Our range of work is from health delivery, elderly, and people with disability, clinical research, procurement, clinical quality assurance, and also a clinic for RSV testing, sleep aid, COVID-19, and pre-employment growth testing, and many other clinical and community research services that we offer.
And Dr. DeGong, how do you center food as you treat your clients?
Pretty much, food is the first line of preventive medicines because every single one of us eat food. And thank you. Hello, hello, hello. Yeah, every single one of us eat food.
Mhm.
And in that regard, it's very important that we understand the importance of food. When you look at our body, I want to go a little bit deeper. Uh, Everything go back to energy. The food get transformed to energy, it's frequencies. So the electromagnetic wave that is being transmitted into our genetic section of the genome should be the one that was at the primordial fault. It means that when you're born, you have those healthy frequencies into your genetic makeup. Now, as we go, our body deteriorates because either it's external issue or internal issue, parasite, bad bacteria, viruses, that can affect some of the organ functionality. The body is normal stage, normally repair itself. But when it comes into internal issue, like I mentioned earlier, it start having deficiency. Now, the body stop producing the adequate amount of vitamins, of proteins, of lipid, fatty acid, of minerals, the 21 minerals. And, and then you start having some problems. So when you eat healthy food, what it does through a diet that is well followed by a doctor or from your own knowledge, you are able to gather all of the normal nutrients that a person need a day, in a daily basis.
Thank you, Dr. Igong. That's
Yes.
exciting to
Yes.
hear. We'll come back around
Yes.
to talk some more about, things that you would suggest. But for now, we could go to Dr. Aurora.
Yeah, I'll pass the micro to
It'll
the
come
next
back.
panelist.
Thank
Dr.
you.
Aurora, thank you.
I'm Mudita Arora. I am an owner of curated nutrition company called as Potion. I'm originally from India, and Potion in my language Hindi means nutrition or nourishment or support through food. So I like to connect my clients, my patients back to their body, connect their body through nutrition. I want to ask the audience here, how many of you have had a consult from a registered dietitian? Just raise your hand. Few? I can count about 3. So there's a huge need for our, our audience here or the communities in general to seek the um, nutrition counseling from a registered practitioner because there's a lot of diseases outside nowadays, some diagnosed, some undiagnosed, which can be healed through nutrition.
Awesome.
We can use nutrition as the first line of defense. For example, using precision nutrition, like maybe consuming omega-3s and omega-6 for anti-inflammatory diet, right? Maybe incorporating vitamin D in your diet so that a lot of us are vitamin D deficient, but what do we do about it?
We go, we get tested, lab work comes back, we are deficient, and then we take the supplement. And that's how we treat our vitamin D deficiency. But if we are proactive about it, or if you have someone who can guide you through, throughout, then you can be at a more healthier self and you can perform better from every state of mind, like from your mind, from your body, and so on and so forth.
So you say you're a dietitian and you center food in how? How do you center food?
So food, as
vitamin D in itself is usually gotten from supplements or the sunlight. So how do you center food?
So for me, food, like Dr. Gabriel said, it is one of the basic needs of the body.
Absolutely.
How many times a day we consume food? Several times, 1, 2, several times a day. But are we mindful about consuming food when we are eating? Are we in the right state of mind when we are eating that food?
Okay, I see where you're going.
Are we eating food as a more of a preventive measure or as more of a reactive? So this is where my expertise comes in. Once I know my client, like what they're looking for in improving their diet, improving their nutrition, improving their health and well-being, that's where I bring in the food and the curated diet plans so that they can be the best version of themselves when it comes to health and well-being.
Thank you so much. I really love that. Thank you.
Does this mic work? Can you hear me? No?
No.
All right. Raise your hand if you think your body at present time, last week or so, performs and feels its best at mental and physical level. Anybody? Okay, not so many. Raise your hand if you actually want to feel and perform your best at your mental and physical level. Awesome, right. So your body is the most complex but precise machine. There's nothing as magical and as complicated, but it actually knows what to do. But as I mentioned, machine, look, think Ferrari. If you give it sunflower oil, it will not go anywhere, right? So food has the same meaning. Food is fuel for your body. Think of it not just like calories. It's not about calories. It's priming your body. Food for your body is literally the foundation. It's literally, basically, the signaling is everything. Food turns on gene expression or turns it off. Food basically affects, obviously, immune function, mitochondrial resilience. I am a family nurse practitioner, board certified, and I have over 16 years of clinical experience in integrative functional medicine, regenerative medicine, anti-aging medicine, and nutritional medicine. I have a clinic, Harmonious Life Family Health, where I serve kids, adults, basically no age is a limit, in Brooklyn, New York. I do see people from a variety of conditions. I do have people who are very sick who've been around the globe, seeing multiple doctors and been treating the conditions for decades. And I do see people who are just health conscious, biohackers, just people who are, thank God, right now, I see a good group of people who are just thinking forward. Like everybody here, right? We're trying to do more prevention versus treating and curing than something it's a total different ball game.
That sounds amazing. So how are you centering food?
So considering I do see people sometimes who are very sick, and I do offer multiple modalities, meaning I do offer their effective and kind of, I would say, innovative treatments like exosomes, stem cells, peptides, methylene blue, ozone, ultraviolet blood radiation, and a lot of hormones. But I always have a very honest and a very straightforward conversation with my patients that those things are really cool and they are very powerful. But what you do every day, what you actually do a few times in a day, which is eating, is still the foundation. We are going to upgrade you, but if you're then still putting crap in your body, it's not gonna be as efficient, and you're just kind of wasting the money because those treatments are not for free. So I really kind of put it in the head that it's in your best interest to get the most out of those really cool, innovative, high-end, high-tech modalities and treatments to put food as a primary change. And that's where we come from. And I really usually utilize a lot of supplements, extracts, where I do use a lot of antioxidants because unfortunately, food these days is not what it used to be decades ago. Even if you are eating broccoli, it's not the same nutrition dense wise. So you need to be a little extra, I would say, intense with it. That's why for cushion and overall to give this extra therapeutic concentration, we are typically supplementing with some specific nutrients.
Okay, thank you so much. All right then, Dr. Shweta.
How's everyone doing?
Great.
Can we just get a quick round of applause for our amazing MC and the entire Health 2.0 staff who's been tirelessly doing all the good stuff? So I am a very informal person, but if I need to do something formal, I'm going to read it, put the phone away, and then break into shimmies. No, just talk. So my name is Shweta Vikram. I'm the founder of Nimi Life, an Ayurvedic doctor, a global speaker, author of 15 books, a certified grief coach, and host of the Grounded Leader podcast. And I promise you, it's all coming together. My work sits at the intersection of Ayurveda, grief, and trauma-informed care. And I support individuals and organizations in navigating stress, burnout, and life transitions. So to answer your question, Roxanne, I love that. Like, what about food and my practice, right? So a big part of my approach is food. I see nutrition, and again, from an Ayurvedic perspective, not as a trend, not as restrictive, but as one of the most powerful everyday tools for healing. Whether I'm working one-on-one with clients or consulting with corporations, I help people use diet, daily rhythms, and nervous system regulation to restore balance, resilience, and clarity. Because in my experience, healing doesn't begin with intensity. It begins with consistency, with what we eat, how we live, how we support ourselves through both visible and invisible forms of grief and healing. I'm really honored to be part of this conversation on food as medicine and to explore how we can bring nourishment back to the center of healthcare in a way that's both practical and deeply human.
Thank you. I'd like to say thank you to the entire panel. One, for your diversity. Two, for your passion. And three, for how you're centering food. I have to agree that we should be thanking Health 2.0 for giving us this opportunity, and I'm extremely grateful for the chance to chair this panel. I know it's not something everybody likes to do, but moderating this panel has been so far great. I am Dr. Roxanne Smith. I have 30 years of general internal medicine board certified experience. About 5 years ago, I went through a sea change where I took my private search for health and I turned it into learning. I went back to Health Mastery Institute and learned how to be a nutrition therapist, where I use food as a therapy and medicine to reverse chronic diseases. If you tell me you have diabetes, I have a method using food for you, and so on and so forth. I then also went back to Health Mastery to learn about quantum mind body therapy. Because as the previous panel was talking about, what goes on in your mind affects how you go towards and how you pick your food. Well, the hormone in your body dictates if you want to have a sugar craving or a fat craving or a salt craving. So the mind is also intricately involved. But the way I center food, to answer my own question, is food is the foundation. The temple your body that it is needs the right nutrition. You need the science and the knowledge. And our focus at Lemurian Healthcare is education and empowerment so that you can make the choices that then optimize your health. I could tell you from now till forever that meat is a class 1 carcinogen. But if you don't see the science, feel the difference, and then make the change as a voluntary change, I'm doing you a disservice. I shouldn't push it down your throat. You should understand it from your own sense of knowledge. So if I'm not empowering you, I'm not doing the right thing. Now, I'd like to bounce back to the panel to talk about different aspects of food. And if you guys have any questions, we're open to taking questions at this time since we all had a chance to share who we are. So if you have a particular question for any panelist, we'd love to hear them. And if not, we can start talking about if you have someone that comes in and you're trying to take care of them and you're trying to center the food, how do you approach that with the client? And what has been your experience so far with that? And I can start back with Dr. Digong and work this way back. Mm-hmm.
First of all, you're going to have an assessment with the client, ask him his daily routine about his food. Then you derive a conclusion on that. But to emphasize more is to have a blood testing to see where the patient have deficiency, so that precision food nutrition or precision medicine treatment can be done through that process. Like we say, everything is poison. The difference is the dose. That's the wisdom, philosophical wisdom. Everything we eat is poison. The difference is the dose. There is a chemical in food called aflatoxins. God, our creator, I mean, that's what I believe, have it there. It's a toxin based in food. It means it is necessary for the resistance to improve the immune system of our body. So when we eat, we need to come back to what she said. Are we eating as a preventive measure, or are we eating as a reactive measure? It's very important. I believe, this is the most important panel of this 2.0 health for these sessions, unless somebody tell me otherwise, because this is where our life is. This is the basic of our existence. We are here because somehow some of us have ate, I think by chance, maybe well. That's why we're here. If you eat bad food, the chances of you being healthy and being here probably will be zero. So we have to take this seriously and educate ourselves, because education is very important. We realize that a lot of us don't have that education, but we have the proper education on how to feed ourselves. If we need help, the dietitians follow through. We learn what our body needs, because each one of us have what we call a differential constant that are called pharmacogenetic, which is the reaction of your gene based on what you consume, which is different from one another. That's the difference. So it needs to be considered. That's what precision medicine come in place. It's called nutritional genetic, not genomic, but genetics. It's very important to consider when I talk to my patients, when I educate people to really know about it. So that's why the blood testing is important.
So blood testing and education. Thank you so much, sir.
Thank you. So my process is fairly straightforward. I set up a 90-minute call with my client, and during that call, I go over a list of comprehensive questions, like, their top 3 goals from the nutrition counseling. And after talking to them, we shortlist one goal, like that is most important to them. a lot of those questions are they are around what have they done in the past? Have they tried any diets? What has worked? What has not worked? We must know that what is truly important to our client. So, how's their sleep patterns? Sleep, some of the previous panels, they talked about sleep quite a bit. It is a very important factor in how we are, if we are going to wake up tired next day, how that day is going to go for us. Versus if we are well rested, or if we have time to cook a nice, good breakfast for us or not. So, how their lifestyle is, like if they have any genetic factors that has affected them in their journey towards health and well-being. Who does the grocery shopping at home? Who does the cooking at home? And do they have a supportive family? Do they live by themselves or they live with someone? If they live with someone, do they have the necessary support they need to make these lifestyle changes in their in the coming future? So there's a list of comprehensive questions, and once that is completed, I also make this visit very conversational.
Right.
There were times, to my surprise, I had even though I think I had a list of questions, but some of my clients actually talked for good 60 to 90 minutes. We did not get through. So that told me that there was the, those clients, I'm very thankful for them to opening up, because I do think that they were not heard before.
They were not heard before. I
They
agree.
were not heard.
I agree.
So before I go to the education or something, I like to know what is bringing them to me. What is the main reason, or what are they trying to achieve from this? And then once we shortlist those goals, then we start working on them in the follow-up calls.
Thank you so much. That sounds like very intense. I love it.
I pretty much have very similar process on onboarding and just understanding where the patient is. And that's basically sets the stage for what they can do. Because, let's say you can have in your head the best nutritional recommendations, but you can see it's not feasible. And you do want to make sure that you give their basically points and to-do lists that they are able to do, and that they come next time for follow-up. They're not gonna hide from you or lie to you or feel like a failure. You can do literally for some people it will be just start drinking water. It could be as simple as this, but it has to be, because I always say do not underestimate the power of one little change long term.
Excellent.
So that could be, again, it could be baby steps. Some people would say, I'm ready to do 360 transformation, and we go all in, or it could be literally one step for the next months.
Thank you. That's awesome.
I love that there's so much resonance with what both Mudita and Marina said. So just to backtrack a little bit, in Ayurveda, food is one of the pillars. It's called ahara, right? And food is not just what you eat, it's your emotions. There's the mind, body, consciousness. So the emotions, your environmental toxins, the conversations, it's everything that you feed yourself. The second part being, it's not just what you eat. Why is it that some people eat, completely organic, cook fresh, all 3 meals, exercise, go to bed, they still don't feel like their best selves? It's not just what we eat, it's also what we digest.
Okay.
So that's very important. The same food can work as poison for one person and honey for the other. So eat in season, food miles, all of that. So these are all simple Ayurvedic concepts. But when a client comes to me, it's very similar to what you said, Mudita. It's 90 minutes. And there's a reason I was talking about grief coaching in my introduction. Literally, almost 99.9% of my clients, they come in for a health issue, and there is unaddressed grief. So I'm not a therapist. I am an Ayurvedic doctor. But in my grief coaching or Ayurvedic coaching, they work together along with trauma informed, right? So through diet, you work on the grief that's gone unaddressed. And that's when the healing begins, because a lot of people, a large majority, and Dr. Gabor Mata says this beautifully, start to heal when they feel visible. And it's something that you touched upon, like There's so many people who are going about their lives feeling unseen and unheard. So I think compassion is at the core. Holding space, listening to clients is second. You can have the best material, but if you don't have a body that's willing to heal, to absorb, to take that all in, what's the point?
That was beautifully said. And you already called attention to the points that everyone has been bringing forth. And it's usually these kind of things that can really bring change to a person. One of the tenets of the practice that I use, which is the HMI way, we do a quantum life audit to begin, partially done by the client. They go and sit and answer everything. And then I do an intake that can take anywhere between 1 to 2 hours going through that audit. And then from that audit, we see where they need to begin. But we don't necessarily begin there if the client, like you said, is saying that they identify X as a problem. So I can have all the best intentions, but if I'm forcing it on you, it's not good. The decision to change rests with the patient. It rests with the client. And so empowerment in education, letting them know what this thing can do, is the foundation of how we use food. I'll tell people I can get rid of your diabetes by just cutting out fat. They don't believe me. I say, give me 2 weeks. Do your finger sticks. They come back. Oh my God, I believe you now. You give them a challenge, you give them hope, you give them knowledge. You give them a little bit of space and you see them again and they're changed. You give them things that will change their life quickly so that they believe you in the things that may take a little bit longer. And yes, supplementation is a powerful tool. But for them to understand that the source of that supplementation is food, that if they get enough of the right food, they can get lots of that supplement, plus on top of the supplementation they're taking, they will be set for life, turning on the right genes, turning off the wrong genes, and having more peace, joy in their life. And that's the basis of what we do when we are at Lemurian Healthcare. Now, I wanted to open up from the panel questions that you may have or thoughts that you may want to share, because I don't want to be the only one posing questions. So I'll go to Marina. Do you have a question you'd like to pose to the panel? Want something that you haven't yet heard, and then we can go from there.
The panel?
To the panel, to the audience.
Yeah, I think I would love to give you some valuable practical information. Just something you can do to yourself and, upgrade your health and wellness. Food-wise, as we all mentioned, definitely this should be your core, and this is non-negotiable, period. But are a few interesting things in terms of super nutrients, superfoods that, literally adding one quality supplement from food. But again, considering you will need to pounds and kilograms of that. So I'll give you a list. But overall, if you want more information, I have a Harmonious Healing Blueprint book where you have all this information, foods, and much more, biohacking regeneration. If you come over after or see me today, tomorrow, if you give me your phone number, I will gift you a book. Use it, share it. There's a lot of practical information for yourself and for your patients, for your family. So basically, I would say there are a few nutrients that I love and definitely bring a lot of kind of help to your body to be in this modern toxic world, because it's not the question if you're toxic, it's the question how toxic we are. Sulforaphane is number one, which is broccoli seed extract, but you will need to eat like pounds of it to get it, right? So it's great for liver, great to support detox, and great to support your cell DNA and anti-cancer properties. Another one, sea buckthorn. Basically, I buy frozen sea buckthorn and I make tea from it, or I can just eat it frozen. It's omega-7, great for cardiovascular, amazing anti-inflammatory, great for hair, liver. Chokeberry, also, you can get an extract, you can buy frozen berries. Another favorite is astaxanthin, and for example, PQQ, Urolith A. Those are some of my favorites that are definitely could be added easily. And another one, actually, Himalayan tartary buckwheat, which is, if you heard of buckwheat, it's like times 100 benefits for anti-aging and for overall anti-inflammatory and antioxidant properties.
Those are a great list. I'll pass it on to Dr. Aurora to see what she has to say.
So I have a question for the audience. Have you ever had to make a choice between your medicine or your food? Like whether
That's a
should
good
I buy
one.
this medicine or would I have enough money for the food? It's very real. The struggle is real. And nowadays with there are so many drugs outside like GLP-1s, they're expensive or if not covered by insurance. A lot of my clients are actually coming and asking information about them. So food is taking a secondary role. So I would request you that if you have those challenges, seek a help of a registered dietitian. We can actually help you budget your food in a way where you can, you know, find some balance between the medicine and the food.
I do
And
agree with that because there's so many good, inexpensive foods out there. You can pay for a box of beans already cooked, $2.
and
That's
and
great
a
food.
lot of my clients think that the canned foods are not good.
Right.
No, it's not true. So if you would like to get more knowledge about how you can, how you can eat on a budget, if that is your concern, then definitely me, or if there's another private practice dietitian, they can help you, or if there's a dietitian in your outpatient setting, they'll be happy to help you. I also want to ask, and it's a very personal question, so if somebody would like to answer, that would be great. On a scale of 1 to 10, how happy you are?
10. I heard a 9 out there.
9, 10? That's
Oh,
awesome. Yeah.
that's
Thank you for
awesome.
being honest with the challenges, because if your happiness score is higher, you're more willing to change your lifestyle. Once you're guided by the practitioner, you're more willing to accept the treatment strategies, and then overall health and well-being will be improved. But if your happiness score is lower, I have seen this time and again in my practice.
Right.
Some of the clients whose happiness is like 3 or 4 on a scale of 10, it takes a lot more motivational it takes a lot more motivational interviewing and strategies to help them get to the level of making the changes that is going to be important for them in a long run. I also have seen some challenges where the clients, the health deteriorates so much that they have to pay thousands and thousands of dollars in healthcare bills. So, but investing your time, effort, and resources in the right practitioner so that you can do the preventive maintenance of your body is very important.
I
How you feel
agree.
in your 20s is not how you are going to feel in your 30s or your
Unless
40s
you plan
or your
for it.
50s, unless until you plan for it.
Right.
Unless until you get your body ready for the next decade, you will not feel the same and you will feel the pinch.
I'm going to move the mic on to Shweta. Dr. Vikram, thank you.
All right. We all best friends now, right? Raise your hands if you pay attention to your poop every morning, afternoon, evening. To your poop, your bowel movement. The first time I said this to a client, like, OMG, TMI. I was like, no, not really. If you're so focused on what you're ingesting, shouldn't you be curious about what comes out of your body?
Yes.
And also, it's very much of a philosophy in certain parts of the world that it's okay if you don't eliminate every day. It creates ama, which is toxins in Ayurveda. And those toxins do a number on your body, right? So I love talking about poop. I know it's not the first thing that I said to my now husband on a first date, but your poop will tell you a lot about what's going on with what you're not digesting. So start paying attention to that. And one quick comment. We'll all share our wisdom, our experiences. Choose to walk away with what aligns with you. My rule, and which is coming from Ayurveda, is the 80-20 rule. 80% of the times I'll eat, what I need to do for my doshas to be balanced, for my sleep to be in place, for my nervous system to be regulated, for my happiness quotient to be there. 20% of the times I might be face down in a pecan pie and I don't judge myself. So give yourself that space when you judge yourself less, when you pray, and whatever your modality might be. Some people pray, some people say gratitude, some people just acknowledge how their food has come to your table. Dr. Arora just shared there are people who have to make choices, right, between medication and food. So if you're able to do that, just remember 80% of the times, the 80-20 rule, 20%, we are human beings. We live once, and life happens when we are planning it, right? Because that's life. So also make moments for joy.
Thank you so much. I'll insert my question here before I come back to you, Dr. Dikong. 5 minutes. So quickly, I will say that for anyone out there who wants to understand what we're doing here, please make sure you speak to us individually if you have any questions, any concerns. I will pass the mic to Dr. Digong because I know he has something to say to close us out on asking the audience a question or something you'd like to share about food.
Yeah, pretty much. I can say, I can look at them and say that, well, are we here? Pretty much, I can say everything starts with a thought, like my co-panelist stated earlier. Everything starts with a thought. If you have positive thought, you are giving your body that positive energy that goes in. It also heals the cell as in the energy level. It does heal it. It's needed. Now, something that we need to consider is that every single one of us have that specificity in them when it comes to processing the food. The pharmacodynamic and the pharmacokinetic, all of that played a role into the pharmacogenetics of the food processing in our body, and that is individualized. Certain, based on what the co-panelist stated earlier, we have nutrients that we find in food that play a specific role, like vitamin C, like vitamin A. We all know what it does. But now, when we go to precision medicine as we age in time, we can use it to age with quality. So it go back to the reverse. The quality of our food that we consume is the most important things that we need to consider in our daily life. That's something that I want people to take out of this conference, which I believe is the best panel, because talk about the most important things. You want to live 114 years. You can, if you take care of your body.
Thank you, Dr. Digong. Thank you so
by
much.
eating the quality food, proper food.
It has been a true honor and pleasure to moderate this panel. And we all have our different ways of practice. But the one thing we can agree on is the fact that food is the absolute foundation for your life. I personally will be available today and tomorrow for anyone who sees me, just stop me to talk to me more because I didn't really share a lot here today because I wanted to focus and make sure that everyone had a chance. Everyone here has their role, but I'll tell you as a nutrition therapist and mind body, I agree with several things that you guys have said, maybe not all, but know this. Find who you resonate with. Work as hard as possible doing what they advise you to do. Put yourself in it 100%. If it's not working, accept that it may not work for you and then move on. Find the person who's going to help you because you deserve that kind of help. And so don't ever get tied up that this person is a doctor, so they should know better. If you're not seeing the fruit of what they are sowing, if the seed is not bringing you the fruit that you want, be willing to walk away and find somebody else because you deserve the best health possible. All right? So, with that being said, thank you very much. Thank you to Health 2.0 for giving us this opportunity. And thank you to the audience for sticking around so late. We've taken several. They have one.
Oh, you want a picture? Of course. Please take a picture while I sing a beautiful song for you all. Which one have we? You know you did a good job, so say you did a good job. You know you did a good smile, so give us that good smile. Go ahead, smile for your photo. Y'all got your picture? Good job, panelists. Thank you so much for everything. Um, Kudos to our panelists again for delivering a rich and thought provoking discussion, one that we need to continue to be more comfortable having with ourselves and our family and our friends, those we care for. Now let's shift our focus to another important aspect of care, one that becomes especially critical as populations age or become more mature. As technology continues to advance, a key question emerges: how do we balance innovation with empathy? Our next session, touch screen or human touch, finding the right balance in elder care. We'll explore this delicate balance between digital solutions and human connection. This panel will dive into how we can integrate technology in elder care without losing the compassion, trust, and personal connection that define quality care. Let's welcome our distinguished panelists to the stage as they share their experience and insights on this evolving topic. Coming to the stage, Mark Friedman, Mina Amlani, Roger Mazzella, Andrew Tagsisihan, and Diana Connor Reed. Please join us on stage. Welcome. Mark is the owner of Senior Helpers Boston and South Shore. Mina is executive director of Ask Society. Roger was with Global Medical Industry Leader at QT Group. Andrew is the chief operating officer of All Care Provider, and Diana is the owner of MLS Senior Care. And Michael Macniak, Michael is joining us as well, founder of Care Coalition. Give them one more round of applause. Michael? Okay.
Thank you, everybody, and thank you for hanging out this late afternoon. My name is Mina Amlani. I'm the executive director of the Ask Society, and I'm really excited to be on this panel. Hello, can you hear me now? Thank you for joining us. I'll start by introducing myself, and then I'll pass it on to the other panelists. My name is Mina Amlani. I'm the executive director of the Ask Society in Vancouver, where we run adult day programs for older adults with cognitive impairments. So really excited to be here and talking about the role of technology and human touch when it comes to seniors. So moving it right along.
Hi, my name is Andrew Pexissian. I'm Chief Operating Officer of All Care Provider. Our lines of business is treating patients at their home, where everyone likes to be at. We treat pediatric patients all the way to end of life. So we spectrum when you are born to when you transition out as well. So, and we're basically, based out in Los Angeles County, lovely Southern California. We expand out to other regions as well with different health plans. But taking a look at technology and how they're quite accelerated for our clinicians, but also there's nothing that replaces a human touch in front of you, right? Seeing the screen, seeing other, but again, we're taking a look at workforce and enablement, but also biometrics as well to really aid into our clinicians of what they do best, but also seeking those efficiencies, for them. But at the end of the day, it's still that human warm touch, that face-to-face action that makes us truly humanize on what we do over in our provider. But also as a National Alliance of Care at Home, as well as CASA over in California, we deal with a lot of policies almost every day on guardrails of using AI technology.
My name is Diana Reed, and I am the owner of MLS Senior Care, which encompasses home care. We also have 4 assisted living facilities, so when our clients are no longer safe to be alone in their own home or they're in a failure to thrive situation, we can transition them gently into one of our assisted living facilities. And then we also have a transport company where we predominantly transport handicapped and at-risk children to and from school. We also transport our seniors, of course. So our goal is to just provide an all-encompassing solution for our senior community, just so they have a smooth transition as they move through their later years. And again, I'm Diana, and I'm grateful to be here.
I am Mark Friedman. I own Senior Helpers Boston and South Shore, a large in-home care agency, elder care agency in the metropolitan Boston and South Shore area. Um, with my staff of about 160 CNAs and home health aides, our goal is to transform the trajectory of aging for our clients and their families. I also sit on the board of an AI-based, audio-based monitoring company here in the U.S., and I'm co-founder of an agentic AI company targeted to changing the way employee caregivers manage their responsibilities without putting their careers at risk. So I've got a lot of strong views on this topic.
Hi, Roger Mazzella. I head the medical industry for a company called Cute Group. And our technology allows you to design, develop, uh, test, and deploy user experiences and user interfaces, whether it be applications on your phone, applications on your desktop, or embedded devices. You think of an embedded device like a surgical robot. We're heavy in that area where the actual user interface, the user experience that the doctor does, is actually built with our tools. Our customers design and build it, but we provide the tool sets to do that. And part of what I'd like to cover today is, we think it's an either or, right? It's either the human touch or the bad technology people, and I say it's a combination of everything. It's a collaboration. So interested in speaking with the panel today, and I'll hand it over.
Hi, y'all. I'm Mike Macniak. I am the founder and originator of what we call the Care Coalition. Basically, the concept is to try to get together with like-minded individuals throughout the world who are dealing with folks who are struggling with mental illness, chronic illnesses, etc., and trying to, as we talked about, provide care for them in our communities to keep people, in their homes and whatnot. My particular interest is in what goes on in the families and the impact that caregiving has to families, the siblings in the home, that are in the home with their brother or sister who may have a mental illness or otherwise. My work is founded in the mental health industry, but especially being here for this week, it's really I've met a lot of people who are really interested in the work that I'm doing to expand it into, as I said, more like dementia. We're getting a lot of people that are interested in the work that we do as far as it could be applied to dementia, um, care coordination, and that kind of thing. So um, I don't know anything about AI and technology. So I'm much more of a, 1950s bedside manner guy. So I'm really interested in learning what you guys have to tell me about it as well.
Excellent. So this is going to be a great conversation, I can tell. And thank you, everyone, for being willing to share your diverse opinions in this next question. So, I guess what I'm going to ask is, where is the line today between AI and technology and the irreplaceable human touch? What can never be replaced, and where is technology excelling?
Okay. I was like, hey, going down the line. I'm like, wait. So, I mean, take a look at the bridge line and words that define, right? I think it's right now we're in this interesting era, right? For 3 years, been over in DC and trying to figure out, what the guardrails are to protect our clinicians, right? Because their licenses are at stake as well. And then with the healthcare, especially in the US, it's been very tough because margins are getting thin, labor is actually increasing. So, I mean, for our workforce, we see that as a tool for them. But at the end of the day, we take a look at bio wearables as well, right? It really aids in that acceleration where individuals could live independently at home, right? We see these alerts versus, timely, frequencies when you go out to go see individuals like doctors' visits or even nurses and therapists. And, those are, accelerating the needs and the specific needs for them. But what is that replacement of a human touch? Some people are aiding. Are we going to be back in the Jetson days? Are we going to be, just iRobot where we have a caregiver that's kind of like there? And where is that warmth from it, right? And I was talking to a couple of panelists, right before and yesterday as well, is that human touch, that hand holding. Like, especially when I talk about hospice patients, and especially with my grandmother as well as my dog. My dog, oh, lovely, lovely kid of him. He passed away a year and a half ago. But he was with my grandma. There's nothing like that human touch, that warm touch right next to him. Especially like my friends who's taking epidural just because he has a herniated disc. Again, just a nurse or a person just holding your hand, knowing that you're going through excruciating pain. Hospice patients who are doing transitions, there's no way you could replace that with any type of robot or AI or anything else like that. I mean, maybe in the future, but probably not in our lifetime. But really, it's like there's that blend that we have to really seek that fine line of using AI, technology, and human effort. And we always talk about human in loop efforts, but also it's changing so fast. And again, those are the things that I've taken a look at from my workplace and also going to DC, really taking a look at it. And it's rough. There's no right or wrong answer, but it's going to be discovered very quickly with time.
I too belong to the 1950s generation of not quite understanding AI. But what I do know is that I gave up a very lucrative career in international logistics and supply chain management. And I did it primarily, I think, because I got tired of making money and decided I wanted to make a difference. But what I lost, I gained back tenfold because I am a firm believer in human touch. I am a firm believer that failure to thrive is a big problem in our senior population. I'm a big, uh, I just, I don't believe that you can see a trimmer over a telephone call or a teleconference. But more importantly, what we don't get is that interaction. I mean, I have met some of the most remarkable people in this industry. I met a gentleman who escaped the Siberian work camps and traveled by foot all the way over to eventually joining the British Army. I've met mayors, I've met CEOs, I've met KitchenAids, and they all have the most beautiful, remarkable story that I wouldn't give up that interaction for anything. And the other complication I believe we have in technology is I'm not sure how many of you have made a doctor's or dentist appointment in the last 6 months, but it always cracks me up when they send me a text and ask me if I'm going to show up. Like half my residents don't even own a cell phone, let alone know how to text back. So I just believe that there's going to be a time and a place for technology and a time and a place for AI, but it's not today.
So I'm going to say I disagree. The voice first agentic AI is here. It's here now, and its capabilities are far greater than most people realize. And chances are you've had phone calls with AI bots that went on a great time. You hung up completely happy and didn't even know you were talking to an agentic AI that was voice first. It's not about replacing the hands-on touch. It's about augmenting the types of things that we're doing and doing them better, smarter, faster. We've got a perfect storm of problems right now. We have caregiver shortages across the country. No market's really immune to it. You have rising costs, wages. Wages in the Boston area have almost doubled in 6 years at this end of the spectrum, which means the cost of care has doubled in 6 years. In 2 years, we'll have an hour of care with a 5 hour minimum hitting $60 to $75 an hour. Not many people have that kinds of money. So how do you find the right mix of technology and hands-on care so you're optimizing that investment in a way that makes sense for the family and they don't feel like they're being taken advantage from or they're depleting their savings faster than they can imagine because no one planned for cost this much. 24-hour care in the Boston arena right now is $385,000 a year and insurance doesn't cover it and very few people have a long-term care insurance policy big enough to it. In my market, Medicaid pays below my labor rate. So I wouldn't touch it for $1 million because I'd lose $1 million in there. So it's not worth it. But the tools can be set up in a way that's good. Look at different types of functionality. Checking in with a senior to find out what's going on. The ability to spot patterns using either audio or radar chips. Vire has a radar chip you can mount on the wall that can detect motion, pulse rate, temperature, speed of movement, gait. That's information that even if you have 24-hour care, if you have 24-hour care, you have at least four caregivers. You probably have six in and out of that life. They're not going to spot the trends. Even one caregiver may not spot the trends from one shift to another. We can do things better. We can pay more respect to the economics of care, and we can create better outcomes. And that's really what the conversation is about. How do you take advantage of these technologies? And AI is not new. It's just new that we're talking about it. How do we take advantage of these technology to produce better outcomes for the people we're caring for? Because that's what you want, and that's what you want, and that's what I want. And if I can do it without having that client pay $60 an hour for 12 hours a day, and instead I can have 8 hours of hands-on care because that's really what they need, 8 hours, but I can have a solution that wraps them for 24 hours, and I can intervene if necessary to spot anomalies or when to increase care, then I'm going to deliver that same outcome at a lower cost with better respect to the client's economics. Because right now, that's what I care about when families say they have to cut back because their funds are running low.
Yeah, and I think we're talking about where the line is drawn, and I think that's the question. Does everyone know what a doctor does more than anything else during a day? Administrative work. That's exactly right. Yep, nurses too. My mom was a nurse, absolutely. And so, can we leverage technology to be able to get them out of the paperwork, get them in front of the patient more? I have a number of personal stories, but being a technologist, I'm still, on the care side, I'm still, when I'm around clinical people and practitioners, and I had my dad in the hospital for a week, and I mean, the doctor may have he had 3 or 4 specialists on him, and maybe they came in and saw him for 5 minutes a clip. They ran in and they did things, and there was a cardiac person, a respiratory person, a person for his kidneys, and the treatment they were giving him was contradictory. One doctor didn't know what the other doctor was doing. So while one doctor was pulling him off his uh, laxative that he was on since I was 3 years old to flush his kidneys, another one was giving him something that was counterproductive to that made his liver fail. Could we have better and oh, by the way, the technology in that hospital, even though it was supposed to be modern, looked like it was 1992. Okay, it was all LED. There was no welcoming, no warm, no embracing type of user experience on the device. Now we throw voice in there. There's a lot more that we can engage in technology to help facilitate a better, care, better human touch. So if we can free the doctors and the nurses and the people who are helping our patients, free them up to do more of that hand holding, fantastic. And the user experience, who is the user, right? The patient may not be the user, right? The patient's the person that we are monitoring. So is it the nurse that needs that user experience? Where does that touch screen go, right? So I think we have to kind of broaden our horizons a little bit, open up our perspective, and understand that there's a marriage between all of this. And guess where that line's going to be delineated? The FDA still hasn't finalized its guidances yet. So a lot of it's going to be dictated by the ministries of health in marriage with how we're going to practice as well.
Those are all really cool points, actually. Got me thinking over here. I was talking to a doctor last week, just last week. This is sort of fortuitous that I'm sitting here. She told me that she has a maximum of 15 minutes to hang out with her clients in her office. And in terms of doing research into the medical record, she has less than 3 minutes per. So let me bring it back to an anecdote about my mental health experience in the community. We had a woman who we found this out later. She every October had a massive decompensation in terms of her psychiatric health. And this went on year after year, and it was my work wife who discovered this pattern. And she discovered, okay, well, the anniversary of this woman's mom's death was in November, so every October she was melting down, for lack, And my partner Sarah said she noticed this and pointed it out to the rest of the team. Now this was 10, 12 years ago. But these types of patterns, I think, is exactly what we can be using our AI to help us to identify. The problem is that we need to know, assuming we're the user, we need to know the questions that we need to know. We need to know what we don't know. And that's, to me, the bigger question. My IT guy's over here. He tells me all this magic stuff that my phone can do for me at any given time. It's, again, I don't know what I don't know. So, and I use for my podcast, the Holding It Together kind of podcast, shameless plug, which aired yesterday in honor of me being here. I talk about the messiness of the systems, the healthcare system and the mental health system, but I do use AI to help me formulate sort of my show sheet, if you will. And I go back and forth with it about interesting dialogue and interesting questions that can come up. So I think asking the right questions to the computer is is very important. AI is still at it's been around for a while, but it's still such a baby. It's still caught within its own algorithm. And it isn't, the robot guy that's going to come and I wish it would take my job, but it won't take my job. I keep asking it. But I think that we need to learn, and we can learn and really benefit from it and use it in a way that helps us to understand the behaviors of clients, the behaviors of disease, the chronicity, the recidivism, things like this that we all see in our various disciplines.
Thank you. Such diverse impressions. And I guess that leads me to another question for you. Go
I'm back on.
10, 15 years forward. Where do you see this relationship between technology, AI, and this notion of going back to the 1950s style, as we said, the human touch, without losing the human touch? Where do you see us in 15 years in terms of care for older adults?
I think that we are going to have some kind of a proactive, self-generating report system that will take this information like we just described, or I just described, and these two guys are talking about, that will inform a doctor or a nurse quicker, better, and not have to have them go through. As I said, my partner at work, Sarah, had to go through decades of documents to discover this pattern that she discovered. Well, if we have an automated system that's using this AI and the technology, it should be able to pick that stuff up for us, and it should be able to give the doctor in a 30-second, 1-minute synopsis a lot about things. And I don't think it's 15 years. I think it's a few years away. And I think that would be tremendous from the perspective of older adults, mentally ill adults, any kind of chronic illness, and you follow those patterns, because there are patterns. Dementia, we see patterns all the time.
Yeah, and I think, where we're going now, and you had mentioned doctor in the loop, and I'm glad you did. I think treatment and diagnosis needs to be a human touch all the time. So they're talking about doctor in the loop now. There should be someone in the loop going forward. Also, the diversity of that user. I said this the other day when I accepted my award, and I say it quite often. It may not be Dr. Judy or Nurse Judy treating your family member. It may be Aunt Judy, and Aunt Judy has an 8th grade education. She speaks broken English. How do we engage that person, empower them to be able to, treat? And I think it's the flexibility of technology, and that's what I pride myself in our product, that it's very flexible to be able to develop things where you can do things where you can have different archetypes, right? Different user archetypes, or use voice instead of touch, right? So I think as the years go on, I think there'll always be that doctor loop. I think what has to change sometimes, and I've got a number of doctors in my family. I am the black sheep. I'm not a doctor. Is that I'm seeing the care becoming less personalized. It's like, don't get too close to your patient, right? Don't, I think we got to get back to that. Look, doctors have to be professional, but I think that bedside manner has to come back. And sometimes I'll argue, like I said before, that they may be just too busy to really give that kind of personalized care. So again, we have to be careful what technology does. I think, and I also think we also have to be careful about automating too much, right? I don't want to have a self-driving car. I don't care how great it is in the future, right? And I think our healthcare should be the same way. So I think it's remaining that flexibility. I think right now, as I mentioned, you know, the standards, the guidances that take these technologies to build these devices are still kind of in flux a little bit. So I think as I'm hoping as we go 10 years, 12 years, the maturity happens where we stabilize it and we have a very efficient way to move forward.
So while I own agency, I'm also a caregiver. I take care of my 90-year-old parents. I'm the power of attorney with my sister. We're shared healthcare proxies. My dad just went through 12 weeks of hell from a kidney stone with 4 inpatients and an ICU visit because of scheduling nightmares at the hospital to get the kidney stone removed. So, you know, and I have 24-hour care for him. You want to have fun in elder care? Have your mother as a client. And trust me, she's a tough one. No amount of AI or technology or anything else is going to change my father's need for a caregiver to help him shower, right? And I don't want it to, because nothing's going to react as fast as Amy or Fritz or Brianna, who are 3 of the 4, or Pythagoras, who are 4 of the 4 people who are taking care of him week over week over week, or my nurse making a check-in to see how his attitude is. But where will I be in a year? I will have a voice first calling my caregivers after every single shift for every single client, using the care plan to inform the questions they ask to find out how care went that day. I'll have that same voice first checking in with the client, asking certain questions based on their individualized care plan to find out what's going on and look for patterns. Look for change in sentiment, because it can do sentiment and analysis, and find out, you know, is there a pattern that's emerging? We already have sensors deployed in some of our clients. We're spotting UTIs in 36 hours based on sound in there. Think about the difference of a UTI in an 80-year-old. The second thing that's going to happen, if you look 10 or 15 years, in 15 years, I'm the 80-year-old. All right? I'm much more comfortable with technology. You're going to find a tighter integration and a higher level of comfort with these tools, because I'm going to evolve as they evolve. I'm going to become adaptive. I would not have imagined what I do on an iPad 15 years ago that I do now, right? I mean, in my backpack, in my briefcase there before I go to the airport, there's an iPad, there's a computer, and there's a Kindle. And I got a phone in my pocket. There's not a lot I can't do from anywhere in the world, and I'm increasingly comfortable with it. How I interact is going to be very different, right? I don't really, well, our original title was touchscreen. I don't see a touchscreen in my life in 15 years. It's going to be voice, right? I'm going to talk to it. I already yell at my phone. Doesn't always respond, but I yell at it constantly. What time is it? Last night I woke up 3 times and said, "Hey Siri, what time is it?" It's probably going to answer now. But you know, that's I think going to be a major difference in 15 years. That line is going to move, but the population that's being affected by it is going to move. As long as we focus on the outcomes we're trying to create, as opposed to the technology that gives us those outcomes, and our focus is on making the quality of care and the quality experience for the person under care as the primary focus, hands-on care can only get better, right? Because it's more focused, they have better tools, they have better information to make better decisions. Caregiver 1 is going to know what caregiver 2 saw the night before, because it captured it more effectively and on a more systematic basis for consistency over time. I'm excited about that. I'm scared to death too, don't get me wrong, because there still has to be one of us looking at that data to say, you got it wrong. I'm going to overwrite that. I'm going to delete that. It'll never get rid of my care managers who have to go through and read those care notes and make sure the interpretation is right. But if it gets them a leg up, and if I can now have 2 nurses doing the work that I now have 4, I can double my capacity to support seniors.
I have to agree that I think that capturing data is hugely important. I do. And you talk about spotting a UTI within 36 hours. I get a call from one of my caregivers that one of my clients is acting erratically, and I can have him at a doctor within the next 30 minutes to get a UTI check. So
I think it's just a difference of philosophy. I never want to replace that human touch with a voice computer. And if you can't get a caregiver to write down a note in a logbook, how are you going to get them to convey correctly over voicemail? I just feel like that human interaction, again, they can voice to voice, but do they share that voice message, or are they sharing that technology amongst the four of them to know what's going on in the house?
Yeah.
And how are they conveying that? Are they conveying that as a CYA, or are they conveying that as a real person taking care of a real person on a given day? I just I know that technology is changing. I know that generation is changing, right? In 2006, we had a pandemic, everybody stayed home. So in 15 years, 20 years, those kids that were playing video games in their basement are going to be our doctors and our nurses, and they're going to have all the tools necessary for technology, but we hope to God that they can spot a UTI within 30 minutes. So I think there's a time and a place for everything, and maybe in a hospital setting or a doctor setting or a clinic setting, I think that's great. But I think in the home, you need somebody there holding their hand. You need two caregivers who are caringly communicating together to take care of that particular client and meet that particular client's needs.
Don't have the capacity to communicate, or they don't show up for work, or there are a lot of caregivers out there in homes with people, and the families can't get other people to do it because there's a shortage of caregivers for the home for the elderly, and so you can't always depend on someone to show up, much less write a note. So if you have that AI technology that can understand, learn, because it'll learn to understand, it will learn to talk, and that's the beauty of AI, is it learns with us. The danger is when we don't communicate with AI and we say, I'm not going to participate. Well, when you don't participate, it's the communication you need that won't be in the system. So everyone should participate so that so that all of the data is in there for everyone. But for the caregivers, it's unrealistic to think that everyone has a doctor on hand within 30 minutes, and it's unrealistic to think that the caregivers are always going to be on hand.
That very well may be true, but you have to understand, I'm not a PhD. I'm not even, probably don't even have a BSN at this point. But what I can tell you is that I live in a small town. I cover the whole western slope of eastern Colorado. I can tell you that my turnover rate is minimal. And I know that sounds pretty unrealistic in this day and age, but I set forth, I documented my core values. I interview based on my core values. I interview based on my instinct as a caregiver, and there's no AI involved. Yes, do I have caregivers that don't document properly on a regular basis? But as the head of my company, it's my job to educate them on how to document in a book. If they are not able to document in a book, how are they going to document in AI? If they're not going to show up for a shift, how is AI going to know that? I will know in a timely manner if they don't show up because, I've educated my clients on, you call the office immediately 10 minutes after your shift's due to start, and if nobody's there, I'll be there.
Well, I don't think anyone's saying AI is going to do it all. I think AI is going to be a tool to be
I think
used.
it's a tool. I think it's a tool, and I think it's probably a very
But
good
I would
tool in
praise
the proper
God that you
setting.
have such a great team, because I know most people don't have that great of a team. And I know several people who depend on home care, and it's a struggle. It's a real
Yeah,
struggle.
and I think it's trust. That's every session I heard today. I was at the HIMSS Health IT conference a month ago. Everyone's talking about now trust. How do we trust it, right? And I think that's going to develop over time. At the same time, you brought up something, and I don't mean to step on you because I know you're going next, but just what Mark said is they have right now sensors in the bathroom, in the home. As talented as some caregivers can be, and I was a home health caregiver for my father in home health hospice, right? We had a nurse come in, visit a couple times a day. She wasn't there 24/7. Did I notice his gait when he peed? Do I know what the consistency is? Do you know there are sensors that you put in the toilet that you can get these things? These are the things, and we're not looking to replace, we're looking to enhance. Go ahead. Sorry.
And I totally agree, right? I mean, these are tools, and these are tools that be, that we have to use and really innovate, right? Again, we have AI, we have sensors. I mean, I worked at a Microsoft project up in Washington, and this was like they're putting tiles, like pressure sensors, putting like infrared, making sure that things were there. What if the temperature drops? So now, it was 20 years ago, and now we're today's age. Like we see it in flourishing. Now we're talking about trending, right? Taking a look at that. Yes, we're not there 100% of the time. A doctor may be like looking over, trying to document, or trying to see some items, and all of a sudden the patient is doing something else. Same thing with our nurses and caregivers, right? And our therapists. But there are tools out there that maybe out of reach cost-wise, but there are some opportunities that we could use to really enhance the care of our populations, right? But again, it all has to be discovered. Someone has to take that leap of faith, right? And sometimes we have to go to certain countries, and I go to DC a lot. I go to Sacramento just because the big brainchilds of Silicon Valley is there and trying to figure out what the guardrails are. But we have to really take advantage of what's available for our clinicians and our populations. But what that looks like in 10 to 15 years is going to be so interesting. And I think we're seeing this paradigm shift of, hey, internet came in. Some people are scared. I think we're same era right now with AI, but we're seeing the acceleration of it. But what that looks like, again, I wear a biowearable right now. I mean, I'm on CGM as well, right? But again, those are the feedbacks that if my caregivers are not there, that alerts me of a behavior change, right? Vocal tone, sound. We're talking about like acidic sensors, frequency. Thank you, right? We're not there all the time, but it alerts, it enhances, it gives good time. Like maybe you don't need a doctor's visit every 2 minutes or every 2 weeks, right? Maybe you just need it every 6 months. But again, it's the appropriation of human assets as well as electronic and AI to really gravitate and accelerate what we currently have, especially with resources being so limited. But again, we have to put them more targeted. But what that looks like in 10 to 15 years is going to be so interesting, especially when we take a look and who's scared and who's not scared. Again, there's going to be winners and losers. Same thing in 1980s, same thing with any big paradigm shift. Again, the world is our oyster, but same thing, what do we have to do?
Thank you, everyone. Final thoughts and where we can find you. One question, sorry.
Just quickly wanted to add a couple of things. I'll be very quick. I live up in Boston. About 10 years ago, I went to a ear doctor. It was a second visit. It's one of the top hospitals in Boston. I waited 2 hours to see that doctor. The doctor came. I had my timer on, the phone timer. She attended me for 2 minutes, and I was tracking my insurance. My employer took care of it. It was $600. So I just want to go back to what Dr. Friedman was talking about, the economics. It's one of the industries that's going to be heavily disrupted by technology. And second thing I just wanted to put in an example was bank branches. How many of us today go to banks? We are so comfortable looking at our credit cards and bank balances on our phones. We just go to bank for something that we cannot do on our phones. We have evolved, and I'm very sure we will evolve in healthcare similarly.
Thank you for that. On that note, where can we find everybody on this panel? If we can just quickly go around. Where can I find me? You can find me in Vancouver. So I've been pretty silent because I'm living in the Canadian context, which is very, very different than what these individuals are facing right now. So thank you, but you can find me in Vancouver.
You can find me over at LinkedIn at Andrew Pexissian. So again, that's my primary contact, but also at All Care Provider. You could find me over at the National Alliance of Care at Home, as well as CASA, California State Association of Home Care and Hospice.
You can find me in Little Old Grand Junction. My website is www.mlsseniorcare.com, and the MLS stands for Must Love Seniors.
You can find me at seniorhelpersboston.com or on LinkedIn. Probably the 2 easiest ways to reach me.
So my contact information is on the app, both my LinkedIn and my email, firstname.lastname@qt.io.
You can find me sitting at my booth in that room over there for 3 days straight. I haven't seen the sun in 3 days. I feel like I'm going crazy. I live in Rhode Island. I'm from Connecticut. I've been spending my winters in Costa Rica, but you can find me in the app and come talk to me over there at the booth because somebody's got to talk to me.
Good job. Good job. Good job. Good job. GOODJOB. Good job. Good job. Remix. Muy bien. Muy bien. Muy bien. Muy bien. MUIBIEN. Muy bien. Muy bien. Thank you, panelists, for sharing your thoughtful perspectives. Without further ado, I'd like to introduce our final panel for the evening, and then we will be having our recognition ceremony and holding space for you all to have networking time tonight. So we are just so on time, so delighted. Thank you, everyone, for your support. As we move into the next phase of healthcare evolution, new models are beginning to take center stage with patient changing expectations and rapid technological advancements. Traditional models are being reimagined. What then does the future of healthcare delivery look like? How are new models making care more accessible, efficient, and personalized? Our upcoming discussion, the new healthcare business models, subscription based, value based, and AI driven care, will explore how these emerging approaches are reshaping the way healthcare is delivered and experienced. This panel will dive into innovative frameworks that are redefining value, improving outcomes, and creating more sustainable systems for the future. Let us welcome our distinguished panelists to the stage. Let's give them a warm round of applause. I introduce everyone that comes up. We have Chia Lynn Simmons, CEO of Logic Mark, Dr. Kasia Hein Peters, founder and CEO of Abante Scientific, Chaya Malavaram, founder and CEO of Spark Lunch, Dr. Arpit Kirambai Patel, CEO and founder of Pulse Perfect LLC, Yash Vagal, founder of Curanostics, Dr. Sean Hall, chairman and CEO of MedLab Group Incorporated, and Alice Arkello, founder and managing partner, Malachite Consulting.
Well, thank you guys for being here, day 2 at 5:30 nonetheless, and not at happy hour. So thank you for being here. We'll talk to you today about the business models that are emerging today, value-based, subscription-based, and AI models. And we're going to have a different point of view to bring to the table. We're going to discuss the good, the bad, and the ugly, the real impact and the hype. I'm going to let my esteemed panelists introduce themselves, but I'm going to start first. I'm Alice Arkello. I'm a founder of Malachite Consulting. And I spent 20 years inside healthcare systems leading innovation teams, and I know where innovation stalls. It rarely stalls at strategy, and it never stalls with the frontliners, although that's where we like to put the blame. It always stalls at the leadership level, the leaders that are carrying the cost of change because they have limited capacity. They have limited physical, mental capacity, and they're always asked to do more with less. The more they do, the more they're asked to achieve. So I distilled years of experience in design thinking, product, project, and change management, and I developed a methodology that helps them communicate clearly, simplify complexity, and accelerate decision making, which helps them expand their capacity. Yash, is it on?
Hi, everyone. My name is Yash Vagal, and I'm the founder of Curanostics and Nightingale. To give you guys some background about me, I'm a recent computer engineering grad from Georgia Tech. Been in the startup space for around like 6 or 7 years as of this point. Been a advisor at a bunch of companies, as well as been a community leader in the space, but also had the opportunity to become a venture capitalist. Kind of realized there needs to be a lot more innovation in the healthcare space, especially with personal things I've dealt with sadly having my grandfather die in my arms, as well as being a caregiver to my mother when she was going through cancer, and kind of realized there needs to be more innovation. So Curanostics is a platform that actually helps patients aggregate all their patient data. Think about medical records, wearables, any patient reported outcomes, help them understand what's going on with their health, but communicate that back to their doctors. And Nightingale right now, we're kind of focusing on the perspective of using that data and helping out more in the clinical trial space. being that data partner for a lot of these innovations that are happening in this area to actually allow them to get through the process, allowing us to handle all their data management processes so then they can just go and focus on the innovation that they need to do. Thank you.
Hi again, my name is Dr. Sean Hall. I'm from a company called MedLab Group. We specialize in basically drug R&D. So my day-to-day is dealing with government, dealing with health policy, dealing with solutions around diseases. Therapeutically, my interests have, for the past decade and a half, been around chronic diseases. And I spend a lot of my time donating to charities, especially in infant-related rare diseases and oncology.
Hi, my name is Dr. Arpit Patel. I'm the founder and CEO of Pulse Perfect, which offers proactive preventive cardiovascular care. And what we do is we offer a 360-degree blueprint of cardiovascular optimization and longevity.
It's not working?
So my name is Chaya Malavaram, and I'm the founder and CEO of Spark Launch. We are building an AI-powered game-based learning platform for children with ADHD, and also includes other like other neurodivergences like dyslexia, dysgraphia, autism, uh, because sometimes they can all coexist. And my uh, the reason for my company comes from my own personal journey, from my own personal challenges as being a neurodivergent person. And thanks to my son, who was diagnosed with ADHD, who gave me this purpose and showed me that a lot of challenges are because today's educational system are not designed for a neurodivergent mind. And when you create an environment where they can learn in a way that their brain works, a lot of challenges will disappear. And we also have a podcast where we speak to a lot of adults who are neurodivergent, and our focus is on mental health. And masking is prevalent with neurodivergence because they are forced to be somebody who they are not. And we want to stop that. We want to empower children and show them what their unique strengths are and tap into those untapped potential that exists within them.
Hi, my name is Dr. Kasia Hein-Peters, and I am the CEO of a medical device company called Evoke Technologies. We exist because the epidemic of vision loss in developed countries is actually growing. It's growing because of the aging population. And the problem with the growing vision loss combined with the shortage of workforce makes them less likely to be diagnosed early. So we developed a few devices that can test retinal health, and based on the retinal health through the adaptation to darkness or electroretinogram, can actually find out if the retinal health is where it should be, or maybe the retinal dysfunction is already occurring. So it allows for earlier diagnosis and much sooner intervention than with the currently existing diagnostic tests. Now, prior to joining Evoke Technologies, I was working for several leading pharmaceutical and medical device companies, and in the last few years also with the startup community as advisor, mentor, and angel investor.
Hi, my name is Shailene Simmons, and I'm the CEO of LogicMark. LogicMark is a microcap technology company focused on the personal safety and medical alerts business. Prior to joining this company as the Pivot CEO, to try to change the company from a reactive technology company to a predictive company. I spent 30 plus years in a tech industry as a product management executive, as well as marketing and business development executive for both startup companies, founding my own AI company as well, to working at companies such as Audible, helping to sell the company to Amazon and at Google. And so we are focused on transforming what is a very large category of people who are in need. I believe there was a previous panel here that was focused on seniors. And so we're trying to take the technology from the I fall and I can't get up era to basically predictive analytics and technology to basically prevent that fall before it happens. So that's what we do. Thanks.
Thank you. So let's start with talking about this convergence moment. So healthcare operates across a complex web of regulation, funding models, and competing stakeholder interests. And yet the pressure to deliver better outcomes has never been higher. At the same time, AI, subscription models, value-based contracts, and patient empowerment are all converging at once. From where each of you sits, and I'm going to start with my ladies on the stage, can you tell us what is simply not possible or was not possible 5 years ago that is possible today? And where do you see the greatest opportunity for these new models to take hold?
So we are really focused on this business of predictive analytics. And so until the recent couple of years, this idea of actually trying to pivot a business that is predominantly focused on, how good are you at predicting something as a fall? That's not a false positive, but rather a real fall, very critical to where it is today to be more accurate. Because the reality today is that the iWatch is wildly inaccurate when it comes to actually predicting falls. But not just focus on that portion of the business, but actually trying to look at what does remote monitoring and basically the capability for AI and IoT connected devices to help with actually transform that business from a reactive business to a predictive business, which means that in essence, like rather than actually dealing with the outfalls of catastrophic health issues after a fall, which happens to 1 in 4 seniors over 65, we're really trying to prevent that first fall or even that second fall to basically help prevent them from having worse outcomes. And I think until recently, we really didn't have the AI capacity to do what we need to do to make that happen. And so with the convergence of IoT connectivity being cheaper and faster and more, I guess, sensitive to the type of needs that we have from a sensing multi-channel sort of capability plus AI, we just wouldn't have seen this 5 years ago. And so this is why it's really actually a very exciting time to be part of a health tech and remote monitoring patient kind of company.
I think that many trends that we see now have been already emerging 5 years ago, but they are converging now. And what I'm specifically really very excited about is it's also a challenge, by the way, is the amount of data that we can gather from wearables. And both wearables that are in the wellness space, but also wearable devices that are specifically in the medical space. So what it helps us with is to have a longitudinal monitoring of a patient or a person before they even become a patient. Now, it does create massive amount of data that can be used by AI for analysis, for prediction, for risk stratification. And I think that's really will change, if not it's already changing, the way how medicine is practiced. But it creates a challenge. Who will analyze this data, right? How frequently a clinician will actually look at this data to find out what are the patterns, or what AI analyzed and it should be verified by a clinician. So I think that it's a huge opportunity and it's at the same time a big challenge for the healthcare system. But I am very excited about it, and that's the space in which we also play with these vision diagnostic tests, because they are all wearables and they all upload data to the cloud. So we will be able to then analyze this data longitudinally and then create an AI-ready databases to make sure that the high-quality data is uploaded and AI is properly trained to then make help us to diagnose or stratify patients.
So 5 years ago, with ADHD, which stands for Attention Deficit Hyperactivity Disorder, we could only treat symptoms, and even today, right? Because we are not addressing at the root level. And now with AI, we can address it as it's happening, as a child is learning. And we know I've done deep studies of ADHD, and being an ADHD person, I know how we can live in our strengths. And so we can tap into that as it's happening and allow the child to learn like the way their brain naturally functions without trying to change or artificially induce their neurotransmitters, but naturally create them through gaming and through joy, actually. When it's ADHD is an interest-based nervous system, and when you do what you love to do, what you enjoy, we are joyful, and so we can tap into that joy as the child is learning, and so the symptoms don't have to appear and the challenges don't have to happen. And so that's what we are today. We can address it at a root level, which we didn't have access to 5 years ago.
Thank you. So let's talk real impact versus real hype. We are all working with AI differently, and some of us have expressed real skepticism. Let's be honest, where is AI genuinely moving the needle in your work today? And where is it still more noise than signal, especially with regulators, payers, or patient and family trust?
So I can start. So I am going to be coming through through the builder side, and every single person, I guess, in this room has kind of dealt with AI in one way or another. And especially in the healthcare space, a lot of people have been building in a way to kind of make a lot of changes. But the way that healthcare works, it's very much like, especially with payers, dealing with patients, especially dealing with doctors as well, it's hard to kind of make the breakage into that market. You need to learn how to work into those sectors. So the way I see AI kind of coming into place, as well as seeing this firsthand when building with Curanostics in the actual patient provider lens, as well as through Nightingale in the actual clinical trial space, is to be a support tool. AI in itself is a way that you need to actually mold it and frame it in a way to actually automate and optimize any task that is going out to a place that people don't want to do. So when it comes down to dealing with patients and providers, it's going down to the perspective of how do you help understand this plethora of data? Like before, we were talking about like wearables and everything. Wearables are going to be the new frontier when it comes down to data collection, when it comes down to the perspective of understanding what is going on with the patient outside of the clinic itself. So, how do you actually go and understand it, and how do you communicate that to the patient? You allow them to actually use these models to actually go and communicate that over to them. How do you tie that up with medical records? How do you communicate that to your doctor? That's how you can use it on that lens. Through the clinical trial space, it kind of goes down to a perspective that a lot of the processes are purely manual. It goes down to a perspective of data collection, going especially with FDA regulations, ICH slash dash GCP stuff as well. It gets down to a perspective you need to have those data logs. You need to use those systems like AI, Gemini, whatever the systems are going to be beneficial for you to actually make sure that it's all contextualized properly, it's all normalized out, and making sure that the people who are actually doing that data collection can go and do what they really want to do, which is doing the innovation, doing the analysis, making sure that this technology that they're building is actually moving the right direction instead of just doing the manual grunt work. So that's what I think.
Thank you, Yash.
I think if we just extend the FDA question a little bit, and I can take this to TGA, the Australian equivalent of the FDA, and the European Medicines Agency. When we get into clinical trial work and we get into the real execution of it, we will start to remove AI from the question. Because when it comes down to the regulatory agencies, They want to know everything about that piece of technology you've employed insofar as the algorithm behind it. So collecting data and making sure that data connects to the various physical points of presence it needs to be, fine. But in that data collection, we will still scan every handwritten note because the FDA today still has in their constitution for looking at med tech versus drug tech raw data that made that data point come to be. And it's risky. If you think the price of drug work when you're at that final NDA submission to the FDA, not having that piece of paper to justify that data entry point risks everything. When we talk health, my mindset goes to medicine. And it doesn't matter whether it's nutraceutical or it's pharmaceutical. Then we add in doctor and healthcare, and then by virtue, hospital. I think AI has a long way to go to seek those core validations because I could take the FDA out of the equation and insert health insurer. And at this point in time, that outcome's still the same. I don't know how many medical doctors are here and have had to justify the use of AI to their health insurer because the reaction from them is quite remarkable. So before I pass on, I'm going to leave you with this thought. Years ago, I had a medical professor who was taking an interest in me because I wanted to go down this dark path, right? I wanted to work on new therapies. I wanted to work on health policy. I wanted to influence government. And he said to me, he said, Sean, you're going to find out that innovation in medicine is super easy. He said, what's going to kill you is adoption. And so when I think about AI, that hallmark of a statement, pardon the pun, that he made then and there is perfectly true. We can have some of the best AI in the world, but if those stakeholders that really do run medicine in this country are not across it, then the doctor who uses it is opening himself or herself up to potentially a world of hurt.
Thank you, Sean.
I have a little bit of different perspective on AI than a lot of my colleagues and panelists. And I'm talking from a physician background now. So I think AI is very powerful, but it does not do one thing, which is the hardest, change clinical outcomes, right? And for that, you need change in behavior, which AI so far is not able to do that. It's a great tool for gathering data, aggregating data, and able to pick up silent diseases early. But I still feel somebody needs to tell the patient once the data is aggregated that this is what you have. These are the steps you need to take to optimize and treat that disease. AI will tell you about falls, it will give you signals about the falls, but again, that education part, the behavior change that you are looking for, patients still look up for an authoritative figure, and that comes with trust. And when patients see their doctors that they trust, if the doctor's voice that, okay, this is what needs to be done, once we pick up the disease early to prevent it from progressing and manifesting, then I think in conjunction with AI and physician is the best, like option, like to optimize care and pick up diseases. So that's my take on AI.
It's always AI and
Physician.
yeah, that's absolutely true. All right, so let's talk money. Because as one of my favorite client clinician leaders says, no margin, no mission. So who's writing the check, right? So subscription, value-based, outcomes-based pricing, someone has to write the first check. Who is actually paying for the innovation you have built? And what has that taught you about what healthcare buyers actually value enough to fund? Chailin, I'm going to start with you.
So, as I mentioned, we are a microcap public company. We actually have been in this particular space for quite a while. I've only really joined the company in June of 2021. We continue to actually have payers that are both sort of individual stakeholders as well as large organizations. And so our largest client that pay for the technology, and ironically, looking at helping with us on innovation side is actually the Veterans Administration hospital networks. We've been working with them since 2003. I'm sorry, 2005. And so they are the largest payer and hospital network in the United States. And so we also work with, I would call it sort of midstream payers, basically retirement communities and senior living facilities who are trying to shape clinical outcome because, you know, some of our newer technology innovation, our goal is to actually turn around that initial fall to basically change behavior, to change the way that people operate within their sort of living environment so that they don't actually have a worse health outcome. And so they are sort of what I would call our middle tier sort of payers. And so they are actually very innovative and are starting to be more innovative. And ironically, the government has been a lot more innovative than we really give them credit for. And so, and then really at the end of the sort of pipeline is the individuals who are caretakers. And that is close to basically 1 in 3 millennials and more than half of Gen Xers in the United States alone that are caretakers and mostly sandwich generation caretakers who are paying for the technology. And so they're so used to actually wearing a Fitbit on their body and analyzing what they're doing on a day to day basis, they can't imagine not being able to track their parents. And that's where the friction typically comes in. And so we see a lot of friction between basically the payers, typically those people who are in a caretaking role from government to family members to the people who are actually utilizing the products.
Thank you. And Dr. Patel, since you have the patient as the payer, do you want to give us your take on this question?
Sure. So in my practice, Pulse Perfect, I have a membership-based model, and I had to put a lot of thought from a patient's perspective of what if I was a patient, what would I want, and like a physician who's taking care of me and the healthcare services that we have. So, as most of you know, the current healthcare market in the United States is more of a reactive model where the insurance will pay for services when you have symptoms. And when you have symptoms, it's already too late. Like either you are trying to put a band-aid on the problem that you have, but there is, like prevention where, like if you don't have symptoms, insurance is not willing to pay. So what I did in my practice is, and I do more of preventive, proactive cardiovascular practice. So I do very deep dive screening and do advanced testing. And because patients don't have symptoms, like the insurance will not pay for that. So I have removed that barrier and created into a membership where membership pays for all the tests and the visits. As you know, the cost of healthcare has gone up significantly, but so has the copays. Every visit that you go to see a doctor or a specialist, the copays have gone up significantly. I remember the days in 2000 when the copays were either non-existent or $2, $5, $10. Now every visit that you go to a doctor, the copay is either 50 or $100, and for specialists it's even more. And patients think about this. Every visit they have to pay out of their pocket. Plus, there's the surprise billing, right? Like after the visit, you'll say that you have not met your deductible, and like this is the bill for like what you're responsible for. I wanted to remove that, and I want to be very transparent. Like the price of the membership is what you're going to pay, and that is all it is, and there's no surprise billing. The third thing was the access and the time you spend with the patient, right? In the current healthcare model, I know few of the other folks in the panel did mention that it's a machine where the doctor sees you for 2 or 3 minutes, and like the visit is 15-minute max. I did not want to do that. I want to spend time with my patients, listen to their concerns, and then give them a game plan based on what it was. So based on all of that, I said, you know what? I believe the membership-based model is going to be the best for my patients, and it has worked out great.
Thank you. And Yash, you sit on both ends of that equation. What's your take on this?
Yeah, so what I will bring in is kind of like two perspectives, one from the builder mindset and one from like the VC mindset. As everyone on the panel has also said, right? Um, you need to kind of work within the system. That's one thing. So like with the current administration, with what they're doing with the MAWA as well as the access models and everything, they are making more innovations in that value-based care system, making it more possible for innovation to kind of go in and use those implementations to kind of go about it. Problem is with that, what most builders forget about is reimbursements, especially with Medicare and Medicaid, takes upwards of minimum 3 months to 6 months to actually get one patient to actually get that money back. So when it comes down to it, as a builder, as a founder itself, you need to kind of see what are other ways that you can actually monetize your product from there. There's another perspective, like as the doctor kind of talked about as well, through this consumer lens. There's been a shift into having more of the patients being that payer in this ecosystem. There's a lot of new companies like Superpower, Mido, all these different places that allow for people to get these kits to kind of go about it, as well as a lot of VCs are been pushing into that mindset. In my personal opinion, we're still a couple years ahead until the payers can kind of, I mean, the consumers can kind of do that directly. So you kind of need to go into the perspective where can you actually use Medicare and Medicaid to actually help and subsidize a lot of the build? But can you also go with this perspective of running a B2C product? Can you go in and make it where you are able to kind of maybe partner up with an insurance group like the Blues, or kind of work with the actual state regulated health systems to kind of go in with this perspective to actually get the money to actually fund your innovation? I feel like in the future, give it in the next 3 to 5 years, consumers will be one of the top people who would be paying in this healthcare system. But that being said, the healthcare system will still be right there. So being able to work within that area is going to be the biggest key factor that's going to help any startup to grow in this area.
Awesome. And regardless of who's paying or who decided that there's enough value for them to pay, scalability and adoption is always an issue. And it starts at end at the human level. We look at it as resistance, but if we translate that resistance into data, then we know exactly why somebody is resisting the change and how to value something from the what's in it for them to help them adopt and scale. With that, I want to ask you, what has to change for this to scale? So fast forward 5 years, and these new models have gone mainstream. What had to change to get there? Regulations, reimbursement, culture, or leadership? And what is the one thing this audience can do walking out of this room to accelerate that future? Kasha, I'm going to start with you.
Thank you. So I think that we pay too little attention to what I would call organizational capabilities. And when I talk about organizational capabilities, it means individual competencies, processes, governance, and systems. And why it is important? Because the technology cycles are becoming faster and faster, and almost to the point when it's difficult to adjust to changing technologies and market trends. And if the company does not have the right resilience in it, built into everything it does, it will very quickly can be outmaneuvered from the market by someone who does. So capabilities include culture and leadership, include mindset. So there's everything in it. But I think that we should look at this not only to make sure that our leaders have the right mindset and competencies, but do we have processes, governance, and systems that actually make the organization to move smoothly through these really fast changing technology cycles?
Thanks, Kasha. And Chaya, since you bring a very human angle to this.
Yeah, I I really feel it's just being open-minded to trying out different things and just allowing solution to come into your place, just being open-minded even to labels. For instance, there's a huge stigma around neurodivergence. I know in my own family circles and friends, people don't want to get a diagnosis because there's a label attached to it. Just being open to getting a diagnosis actually gives you a wealth of information about yourself, about your child. And when you are open, you're also open looking at the flip side, because there's always a flip side to anything. There's so many, with neurodivergence, there's untapped potential. And they have unique gifts and strengths. They're nonlinear thinkers. They are out-of-box thinkers. They can recognize patterns. You can also start looking at the positives. So I would say just have an open mind to even trying a subscription to see if it works for you. And if it doesn't, then you can always cancel it. Yeah, and just being open, I think will help a lot as growing as a human.
Awesome. Thank you. Anybody would like to add another perspective before we close? All right. So, Chaylin, I'll go back to you. If you want to take us out with what would you like the room to walk out with?
What struck me a lot was the previous panel that talked about this, and also the doctor who's sitting here. A lot of what we do today, I know that my panel is sitting to my right here. What we're doing is we're looking at devices and platforms and AI and technology solutions to actually help us uncover longitudinal data, to actually help us discover minute sort of changes in patterns so that we can actually help prevent and potentially bring better sort of health outcomes. But at the end of the day, we spend a lot of time in the sort of open world that we are in today, talking about AI and technology. But the reality is that what we do today is, processing data. And we really need a human touch to everything we do. We are not in a diagnostic business. We're in a data processing and sort of pattern recognition sort of business, and coupled with, great doctors and clinicians and all of the people who are in the world today who are healthcare providers, that's when I think really true change is going to come about. And so I would hate for anybody to sort of leave this panel for folks looking at us basically saying like, yeah, we're trying to replace doctors in the future or clinicians in the future, or even those who are doing the really critical work of helping people move around and give them the human touch, because we're never going to stop needing that. And so what I think the technology will do is to help us actually process a larger amount of data so that we can make better decisions. And hopefully that will change and radically change the way that we look at everything from healthcare to drug discovery to everything else in the world, because at the end of the day, we still need that human touch to make that change.
I'm glad that you actually mentioned this, because I wanted to say that despite all this talk about technology and AI, everything is centered around a patient in healthcare, and it should remain like that. And there is a lot of innovation to happen outside of technology. There could be innovative services, innovative business models. Innovation is everywhere. So let's not get bogged into technology so much, and let's never forget about the patient who is at the center of what we do, what we all do.
I want to highlight on collaboration, and I think we have to all work together as human beings. Also, bring in technology as one of the participants in this network of providing solution. And even especially with neurodivergence, what makes me feel so sad is everybody labels the child, but also the environment is responsible for it. What kind of parents, what kind of school setting, what kind of culture, all of that is deeply responsible on the child experiencing the symptoms. So we should take ownership for that and provide a solution collaboratively.
I agree with my colleagues on this. I don't think it should be AI versus physician or provider centered care. I think it's AI in conjunction with physician and provider centered care to optimize what means the most is patient centered outcomes and patient care. So that's what I think is the perfect blend.
I think first I would like to just add, I'd like to celebrate everyone in healthcare that takes that step forward and pushes the envelope. We're very complex beings and diseases are evolving. What we did yesterday is not going to work tomorrow. So whether it is technology, whether it is changing practice, whether it is a rethink of clinical protocol, whether it is a new data point that signals something else, 101% we need it. I would encourage leadership within those companies to strive beyond the basic and look for a bigger picture where it can be deployed into hospitals or aggregated across a network of hospitals. So if a problem cluster occurs, let's say in Boston, the other hospitals on the network are very quickly alerted what the cluster is, what the data points are around it. You know, when you think back on COVID, and I was in Australia, so what I went through was probably very different to everyone else in this room, but we were, as a country, closed-bordered for 3 years. What they don't tell you is, as a country, we were closed-bordered to our homes and a 5-kilometer radius for more or less the same time. To go outside, it had to be essential. Now, we can all argue what is and what is not essential. And certainly that conversation came up with the boys in blue multiple times. But the reality is, the data share was good. The data share was not great, right? If we had technology capable on picking information up from one quarter of the globe and sending it to another and saying, we're seeing it here, are you seeing the same thing? And allowing remote sites to collaborate, could we have handled that situation better? My concern is not so much COVID now, it's potentially what's coming next, right? And it's heightened by the fact that as we evolve, we need to expect our disease will evolve with us. But healthcare, as I said earlier today, is not. So I welcome any contribution to the space that makes the patient's life easier, the clinician and the supporting staff easier, and shares articulated data that we can truly believe in.
Yeah, and I want to echo what everyone else on this panel has said, and I'm very grateful to be on this panel with very much experts in their field. It kind of gets down to this perspective. Innovation has to occur. That's how we evolve as a species. That's how we evolve in this ecosystem. But in healthcare, it's different. There's always a monetary aspect in every single other industry, but in healthcare, it's always about the patient care. It's about helping the actual everyone in this room, as well as throughout the world, to live a better life off of it. And through that collaboration perspective, and also going into this perspective of if you're being an innovator, most people, especially entrepreneurs, like to break things, right? We like to break it, see if it works, and then fix it from there. Healthcare doesn't work like that. From there, you kind of need to go in and understand where I can maneuver. How can I go in this ecosystem? How can I work in this area and learn how you can go and best suit the actual end result, which is taking care of people, helping provide the data share wherever it's needed, and making sure that the doctors, as well as nursing staff, whoever's on that medical side, gets the proper care and support that they truly deserve.
Okay. So I want you guys to shift perspective for a second. And remember, then one day, the pen and paper was the latest innovation. So whether we're talking about pen and paper or AI, or the $1 billion business model that you might walk out of this conference with, it starts and ends with the human leader that has to carry the cost of that change. Thank you.
You know you did a good job, so say you did a good job. You know you did a good job, so say you did a good job. You did a good job. Good job. Good job. Good job. GOODJOB. Good job. Muy bien. That's right. Thank you, panelists. Thank you so much. Thank you. Thank you. We have reached a really exciting moment of our day. I think we know what to do. When I say I have a recognition, you all say what? I said I have a recognition. It's time for a recognition ceremony. And as we bring this day to a close, we're going to really center the celebration of possibility, collaboration, resilience, alignment, so much of what has been said. These are the change makers who go beyond expectations, who continue to redefine the possibilities in healthcare. Truly grateful for all the presenters today, everyone who has been here. I do want to share As you all know, I've been your host for the past 2 days. I want to express my gratitude for the kindness that I have received, for the celebration of the energy that I've been able to just give back and pour back into you all. This will be my last day with you all. Unfortunately, I have to be somewhere tomorrow, but you are going to have an amazing host. Kelly will be with you all, and it's going to be amazing. You're going to teach Kelly the good job songs, okay? All right, so that you can continue the spirit. This is fantastic. All right, here we are getting ready for our ceremony. I would love to invite Doug to the stage. Doug is going to be my co-host. Doug Sparks is the founder and CEO of Precision Healthcare. Come on down, Doug. Doug is a veteran of our 2.0 conferences. He's been here since day one. He's absolutely part of our family. Doug is also the CEO of Precision Healthcare Technologies, Precision Value-Based Management, a nationally recognized healthcare strategist. He brings more than 39 years of experience in healthcare innovation, value-based care. Doug founded Precision to address growing challenges of compliance, value-based mandates, and patient engagement across healthcare systems. Thank you, Doug. All right, and without further ado, our first recognition goes to Abraham Raikling. Abraham, if you're here, come on to the stage. All right, that's all right. I'm going to do my best to wrap up. Celebrate Alka later. All right. Okay. Amanda Shannon, are you here? Welcome. Let's give Amanda a round of applause. Fantastic. Come on up. Amanda Shannon is the founder of New Human Potential, a pioneer of human capacity training. With over 30 years in integrative health and human development, she bridges neuroscience and leadership to help teams expand capacity without burnout. Through her Diamond Presence framework, she strengthens internal systems that shape how professionals think, perform, and communicate. If you would like to say some brief remarks.
To be here. So one of the things that we've heard echoed many times is that everybody has enjoyed and benefited from all of the conversations and heartfelt connections. For that tomorrow as well. And so one of the things that I keep hearing between conversation and through here is the word trust, and then a great deal of fear around how we're bringing in AI and the transition that's happening between all of the changes that are occurring. And so it makes me want to just remind us of our humanness and to connect into our own faith and to be the leaders that you all are, the change makers, thought leaders, and to be the anchor for all of the population of people you work with within your own organizations. And I think that it's the bigger thing to take away is the fear and the trust comes from being coherent within. And I think that that's something to take away. Thank you very much.
Congratulations. All right, everyone. Tech team, I don't know if you can hear me in the back. Hi. At 30 seconds, I'm going to wave, and if you all can put the music on, that's going to be our cue so it doesn't feel rude if I have to. We just got 30 more people to go, and I want to make sure we get you out of here on time. Love it. Amy Edgar, come to the stage. Amy Edgar, are you here? Amy Edgar, all right, we'll celebrate Amy later. Ann Deatley, Dr. Ann Deatley, come on to the stage. Congratulations. CEO and founder of Optimal Health and Wellness Center, LLC, Quantum Breakthroughs. Dr. Deatley is an energy healer, author, transformational life coach, spiritual influencer, and an inspirational speaker. Bridging science, spirituality, and consciousness, Dr. Ann uses a pioneering approach to optimal health and wellness to focus on the whole person, mind, body, and spirit to become their highest version. 30 seconds for acknowledgement. Here you go.
Thank you very much. I'm really happy to be in this discussion about reimagining healthcare. I think it's really valuable, and I've enjoyed all of it. And I just want to tell you again, connect with the most powerful aspect of yourself, your true authentic self, and it will make all the difference in your health and your well-being.
All right. Next up, we have Dr. Barima Apong Owosu. Dr. Barima, are you in the room? Dr. Barima, come on down. Let's give applause for Dr. Barima. Dr. Barima, founder and CEO of Ankara Health, holds a degree in biology and a doctor of pharmacy from the University of Michigan. With 12 years of experience in healthcare, a lifelong athlete and former Division I collegiate football player, he saw a critical gap in accessible wellness solutions for underserved communities. Congratulations.
Thank you. Short on words, so.
That was fantastic. Thank you. The smile says it all. Up next, Bill Turpin. Bill, are you in with us? Celebrate Bill later. Brianna Valdispino. Brianna, come on up. Brianna is a board certified behavior analyst, entrepreneur, wife, and proud mom of 3. As the owner of clinical director of Joyful Journeys, ABA Therapy, she is dedicated to helping children and families thrive through compassionate, evidence-based care. Alongside building and leading a growing business, she balances the everyday adventure of raising her 3 children, which continuously shapes her perspective on leadership, resilience, and impact. 30-second and
All right, thank you. I'm very happy to be here representing the world of autism as a board certified behavior analyst. I've had great conversations with everybody I've met so far, and I think it's important to note that we're all here for one thing, and that's the betterment of everyone. And collaboration is so important. And so I'm excited to have those conversations, and we all have that aligned, bridging the gap, connecting industries, and success for our people.
Congratulations. All right, coming up next, if you hear your name, come on down by the stage. Cheryl, Colleen, Curtis, Deborah, Diana. Up next, we have Cheryl Stratos. Cheryl, are you here? Congratulations, Cheryl. Cheryl Stratos is the Chief Patient Advocate of 1104 Health. She is the author of Terminal Hope, How a Clinical Trial Saved My Life, and a passionate advocate for advancing progress toward a cure. Cheryl now serves as patient ambassador for the National Foundation for Cancer Research. Receiving the Health 2.0 Conference Excellence in Healthcare Award. Congratulations again. 30-second acknowledge.
Thank you. I really enjoyed Health, our 2.0 Health, and reimagining the future of cancer. As a cancer survivor and advocate of cancer patients, the next frontier in discovery and innovation in patient care is going to be amazing. And thank you all for doing what you do.
Congratulations. Up next, Colleen Fiamengo. Colleen, are you with us? Colleen, come on down. Colleen is an educator, healthcare consultant, a peri-op nursing consultant. As a peri-operative nurse with 40 plus years of clinical experience, curriculum developer, and legal nurse consulting, Colleen brings deep expertise across multiple areas of healthcare. Congratulations, Colleen, on receiving your Health 2.0 Conference Excellence in Healthcare Award. 30 seconds.
I just want to talk about how wonderful it's been to see the diversity among this group at a time when that may not be what's valued by everyone. So I've enjoyed just seeing everyone doing good work for all the right reasons. Thank you.
Congratulations. All right, up next, Curtis Alexander II. Come on up, Curtis. Curtis is the founder of TRZ Recovery, a mobile sports recovery platform dedicated to bringing professional level recovery infrastructure directly into live competition environments. Through TRZ Recovery, Curtis has introduced recovery services across multiple national sports ecosystems, including USA Volleyball's national championships and qualifiers, the International Flag Football League World Championships and Nationals, and USA Pickleball events. Please give it up again for Curtis.
So over the year, we spend billions to invest into athletes to help us to entertain us, but we spend almost nothing on helping athletes recover. TRZ was started with one simple goal, that you shouldn't have to search for recovery after competition, but recovery should be built into the actual infrastructure of the sport itself. Now, we've been blessed, as I said, that we've been able to introduce it over to the ecosystems of USA Volleyball, USA Pickleball, USA Flag Football, and other uh, sports within this realm. But just like with everything, sport is changing. Athletes are asking for more, they're wanting more, and that's where TRZ steps into that space. We're here to elevate the recovery, elevate the experience of athletes by filling that space for recovery. Thank you.
Congratulations, Curtis. Up next, Deborah Viano. Are you here? Come on down, Deborah. Deborah Viano, NP, is a board certified nurse practitioner and founder of CEO of Rejuve Health Plus in Palm Harbor, Florida. From her humbling beginnings to building a thriving medical practice, she has dedicated her career to helping patients achieve lasting wellness and confidence through personalized care, medical weight loss, aesthetics, and direct primary care. Congratulations again, Deborah. You have 30 seconds if you'd like.
Thank you. It's an honor to be here. I wouldn't be here without my team and, of course, my clients that support me and trust me along the way. We are 5 years in business this year, and I'm super excited for the journey. So thank you.
Congratulations. Diana Connor Reed, are you here? Diana? We'll celebrate Diana tomorrow. Do we have Dr. Hassan? Dr. Hassan, are you here? Okay. How about Dr. Heather V. Wolf? Bravo! She came with friends. Yay! Come on, Dr. Heather V. Wolf is chair of Institute of Energetic Medicine, doctor of Chinese Energetic Medicine, patient advocate, and founder of the Coalition of the Terminally Ill, Disabled, and Elderly. Through the disciplined practice of medical Qigong and energetic medicine, Dr. Wolf transformed her recovery into a calling to help others heal. She earned her doctorate in Chinese energetic medicine and now teaches practices that empower patients to participate in their own healing. Congratulations again, doctor.
Thank you so much. Can you hear me, doctors? This is Dr. Heather Wolf. I want to say thank you so much. Thank you to Health 2.0. Thank you for all of you being here. I think a lot of you are here dedicated to reducing human suffering. Before I was a doctor, I was a patient. I broke my neck. I almost gave up, and I'm so glad I didn't. I want to thank Dr. Holder for saving my butt and also for helping to teach the medicine that actually healed me. I'm excited to talk tomorrow at 9:45. And I want to thank also all the people that show up to my morning Qigong class. I love you so much. Never give up, never give in. Don't stop believing you can do it.
Fantastic. Thank you so much. Congratulations. Heidi Dollar, are you here with us? All right. Is that Heidi? Heidi's coming down. Let's celebrate Heidi. Heidi is a senior analyst design and development of CVS Health Incorporated. Heidi is a seasoned instructional designer and learning development expert with over 2 decades of experience. Currently a senior analyst at CVS Health, she leads training initiatives using blended learning and gamification strategies. Heidi holds multiple advanced degrees in adult education and curriculum design. Congratulations on your Health 2.0 Conference Excellence in Healthcare Award.
Really quick, I just want to say thank you to my love circle, which includes my husband and my son and many, many people. And I have immense gratitude for the conference and all the platforms that I've been able to celebrate and the people behind the scenes. Cannot have made this so amazing without you guys. So thank you.
So much, Heidi. Congratulations. Up next, James E. Burks Jr. Come on down. Congratulations. James, an LSAA at ANA, is a dedicated professional with extensive experience in community outreach and restorative services. As a CPSW, CHW, and specialist in reintegration, harm reduction, and gang intervention, he supports recovery and personal transformation, a criminal justice postgraduate from the University of Phoenix. James combines academic knowledge with real world experience to promote healing and empowerment. Congratulations on receiving your Health 2.0 Conference Excellence in Healthcare Award.
I just want to say thank you to my family, the city of Albuquerque, the Metro Behavioral Health Courts. With our team put together, we are able to provide and change lives daily. It's a struggle for some, struggle for most, but we put our best foot forward and we try to move with innovation, compassion, and understanding. Thank you.
Congratulations again. All right, Dr. Jasmine Burns, are you here? Woohoo! Come on down. The celebration is right. Dr. Jasmine Burns, founder, owner, CEO, and psychologist of Burns Virtual Psychological Solutions. Dr. Jasmine Burns is a licensed psychologist with expertise in neurodivergence and psychological evaluations. She began her career in 2010 at the UC Davis MIND Institute and earned her uh, Psych D from Alliant International University. As a Psych Pack provider, she offers accessible care across state lines. Congratulations.
Thank you. I'll keep this short. First and foremost, I want to thank God. Definitely want to thank my husband who's watching our two little ones at home. They're asleep right now. And I definitely want to thank my family, my team. Where's Ashley? I can't see him. There. Hey, girl. So definitely want to thank my team. And just congrats to all the other honorees. And thank you to Health 2.0. Thank you.
Congratulations. Up next, we have John Olatunbosun Giwa. Is it all together? John, come on down and help me with this. John is the founder of MedReach Digital Health Innovation Limited. John is a registered nurse, optician, and digital health innovator, improving healthcare access. He currently provides acute care and patient monitoring in MedStar Franklin Square's neurotelemetry unit. He's also pursuing a master's in health informatics at Harrisburg University of Science and Technology. Congratulations.
Thank you for this recognition. I'm truly honored. At first, I ignored so many times, but then thank you for not giving up on me. It's actually gave me an important message for to be determined and be persistent. So, and this is an amazing experience, and I've been able to connect with some beautiful people here, and they are so interested in what we do. It's actually so encouraging to see this happening. And I want to like thank everyone for being here. Thank everyone for what they do to for human service. I want us to keep something in mind. Let's know why we started, and this space is so big, and we need to do more, and most especially, let's try and focus more on Africa. I'm from Nigeria, and we there's a potential for coordination and to do great things in Africa. There are a lot of gap in coordination and in health access. Thank you.
That's a beautiful call to action. Jolene Briun. Jolene, are you here with us? Help me with that. Brining. All right. Jolene Brining is the owner and nurse behind JC Care LLC and jolenecare.com, providing compassionate, high quality home health services with a specialized focus on geriatric care. With over 2 decades of experience in healthcare, Jolene is dedicated to delivering individualized, patient centered care that honors dignity, independence, and quality of life. Congratulations on your.
I'll keep it short. I just want to say thank you. And Healthcare Conference 2.0 has been amazing. And I love all the like minded people.
Congratulations. Our next recognition is for Kingsley Ugoji. Kingsley, come on to the stage. Clinical pharmacist at Aya Healthcare. Kingsley Ugoji is a licensed pharmacist Yes, come with all that energy with expertise spanning clinical informatics and healthcare technology integration. With a background in chemistry, he has contributed to EHR optimization, interdisciplinary care across tribal and urban healthcare system. Kingsley is an advocate for global health and lifelong learning. Congratulations. 30 seconds.
Thank you to Health 2.0 for providing such an inspiring platform and a true think tank for innovation and collaboration. I'm grateful to be among brilliant minds like yourselves, my peers who are committed to pushing healthcare forward and reimagining what is possible. I'm leaving here reinvigorated, encouraged, and reminded that meaningful progress happens when we come together with purpose. Thank you for the opportunity and for continuing to fight the good fight.
That was fantastic. Thank you, Kingsley. Congratulations. Up next, we have Marina Moiseva. How do I say it? Yes, I did it. Marina, come on down. Congratulations, Marina, founder of Harmonious Life Family Health Wellness Center in New York. She's a board certified family nurse practitioner, diplomat in anti aging and regenerative medicine, an integrative medicine advocate. Marina built a diverse career spanning regeneration and functional and lifestyle medicine, as well as anti aging field. She's pursuing her PhD in integrative medicine at Quantum University. Congratulations.
Thank you. Health 2.0, from the bottom of my heart, thank you for putting together this marvelous conference. And I go to conferences a lot. And for this recognition, it's truly an honor to receive this award. I really want to send special appreciation to my loyal patients who trust me with their care. And also thank you for my incredible team, my family, my husband, my two sons. I would never do it without your support. And overall, just for beautiful synchronicity of life, for the people, places, opportunities I would never imagine for myself, just happening, trust, and just go on your mission and just never basically doubt it. All the best. Thank you, everyone.
Congratulations again. Thank you, Marina. Dr. Mary Oz, are you here? All right, we'll celebrate Dr. Mary tomorrow. Mudita Aurora. Mudita, are you in the room with us? All right, Mudita, we'll celebrate tomorrow. Dr. Preeti Mistry. Dr. Preeti, come on down. Congratulations. CEO and founder of Best Sell Forward, LLC. Dr. Preeti Mistry is a certified and accredited conscious leadership and relationship coach who began her career in healthcare, practicing clinical dentistry in a corporate setting for about 13 years. Her coaching journey began with a focus on relationships, grounded in her belief that everything in life is a relationship. Her work bridges emotional intelligence, self leadership, and human connection. Congratulations.
Thank you. I just want to thank the Health 2.0 conferences for hosting me and giving me the opportunity to share my voice amongst so many incredible people, leaders, entrepreneurs. And one of my main missions is to help people really find healthy, meaningful, authentic connections because, we're here to help end human suffering. And loneliness is one of the biggest epidemics that we're facing today that's not given enough attention. And by loneliness, I don't necessarily mean just being alone, but being around people and not feeling seen, heard, or understood. As a matter of fact, research backed by the US Surgeon General Advisory states that loneliness can be as detrimental to your health as smoking 15 cigarettes a day. So, my work really centers around deepening human connection and has also expanded to help women in healthcare lead well from within and really find their voice, as that was also part of my own personal journey, so they can thrive in all their relationships, personally and professionally. And my one message to all the women out there is don't second guess yourself, don't wait for permission, and recognize the strengths that you already have within you, advocate for yourself, and remember you are good enough. And if you struggle with any of that, you don't have to do it alone. You can come find me. Thank you.
Thank you. That was a very, very sincere, beautiful message. Rachel Jarmus, are you here with us? Rachel. All right, we'll celebrate Rachel tomorrow. Stephanie Fine, are you in the building? How about Victor Bycroft? Victor, are you here? Come on down, Victor. Yes, the celebration is right. Victor, with almost 3 decades of nursing and leadership experience, Victor, Chief Nurse Executive at Humboldt County Memorial Hospital, is known for cultivating strong relationships and building a culture grounded in trust, collaboration, and excellence. Driven by a clear and compelling vision for the future of rural health, he has championed innovative solutions that expand access, improve patient outcomes, and strengthen community trust. Congratulations, Victor.
Thank you. Throw out just really quickly, it's former chief nursing executive, but that's all right. And want to just thank Health 2.0 for the honor and thank closer. Okay, sorry. No, you sold them that close. Thank Health 2.0 for the honor of this award, and I want to thank my wife, who unfortunately couldn't be here with me, for the inspiration that she gives me and the motivation to do what I do every day. So thank you very much.
Congratulations. All right, we have 3 more recognitions to offer. Vivek Mahandra. Are you here, Vivek? Vivek is here. Congratulations. Come on down. Vivek Mahandra has over 3 decades of professional experience in the healthcare and health tech sector. He is an inclusive healthcare evangelist, AI practitioner, author, enterprise transformation advisor, certified corporate director, digital product visionary, and TOGAF certified enterprise architect. With over 13 publications, 12 IP assets, and 1 patented technology, you're receiving an award well deserved.
So much. In the fraternity of doctors and clinicians, enterprise architect, when it stands there, is not just a distinction, but an honor that I am there with you because I'm trying to work with you to understand your pains and see if we can elevate them. Thank you so much for the opportunity and representing the community of enterprise architects. I want to also thank my partner who's not here today, Ekta Khanna, and we continue to hope doing the same work. Thanks so much.
Congratulations. Up next, Patricia Martinez, LPC. Patricia, are you here with us? Come on down. Big applause for Patricia. Patricia Martinez is a licensed professional counselor and owner of the Mind Body Counseling Center, PLLC. Her experience spans various settings, including a psychiatric inpatient facility, community agencies, and a state prison complex, culminating in the establishment of her practice. She focuses on complex cases involving suicidal behavior, populations considered dangerous, complex trauma, personality disorders, dissociation, and chronic pain. Congratulations on receiving your award.
Well, I did have something I wanted to say, but I completely forgot it. So I guess what I will say is that without my partner standing over there in the back recording, I wouldn't be here because he made it possible. And if I wanted to leave everybody with anything, we're all people. We all have lives that are sacred. We all have stories that are sacred. And out of all of our pain and challenges, we can grow incredibly strong. And I like to use Newton's third law of motion. For every action, there's an equal and opposite reaction. Therefore, our greatest challenges can be our greatest accomplishments.
That's a beautiful message. Thank you for that. And our final recipient today is Dr. Casey Collins. Dr. Casey Collins, please come up. All right, we're going to celebrate quietly. And I want to thank Doug. Thank you, Doug Sparks, for everything, for your support and being a great co-host. Thank you, Karina. Everyone, thank Karina. Thank you, Riley. Thank you to our tech team in the back, Charles. Thank you. Thank you so much. As we get ready to close for the evening, I just want to say that it has been an incredible 2 days together. It has been so much joy, dedication, passion, the impact that you are having, the inspiration that you offer everyone here, and reinforce that visionary leadership is truly making an advancement in healthcare worldwide. Before we close out, love to take a brief moment to celebrate our incredible sponsors. A special thank you again to our gold sponsor, Brilliant Health Solutions, and our silver sponsors, Heavenly Healing Incorporated, Precision Healthcare Technologies. We are also grateful to our bronze sponsors, Serve Healthcare Consulting and Coaching, Restored Identity, Best Home Care Incorporated, and Care Coalition. Your support helped to make this event a powerful space for meaningful ideas and connections. As we wrap up day 2, this is a perfect time to continue the conversations, enjoy this opportunity to network, and please, anything that you capture, the energy of the day, pictures, feel free to tag us online, hashtag Health2CONF on social media. Ladies and gentlemen, please remember the journey does not end here. It is an ongoing journey, and I'm delighted and honored to have had space that I shared with each and every one of you all. Thank you for staying, and if you would like, please come to the stage for a final photo as the group that made it to the end of day 2. Congratulations, and give yourselves a recognition, a round of applause. Yes, congratulations. Thank you, everyone, and we'll see you tomorrow.